Hello guys. So now we shall be discussing regarding the abdomen. Okay, we shall discuss all the important topics that are present in the abdomen as well as the pelvis. Okay, so what are the important topics in the abdomen that will be mostly asked in your exams? Okay, so first of all, let us start with the abdominal planes. But before we discuss the abdominal planes, we have to discuss what is abdominal cavity, what is pelvic cavity, and what are its borders. Okay, so our topic of discussion would be with the abdomen. Now, if you can look at this particular picture over here, very easily you can figure out that this particular region over here is called abdominal cavity, and down over here this is called as a pelvic cavity. So, what are the borders that are separating abdominal cavity from pelvic cavity? We will discuss. So, abdominal cavity is having superior border, inferior border, anterior, posterior and lateral border. Okay. So, superiorly what do you have over here? What do you have superiorly? Just have a look over here. Because superiorly you have got, what is this? This is called as your diaphragm. Superiorly you have got the diaphragm, right? Inferiorly what do you have? Inferiorly you have got the pelvic bones. Okay, inferiorly you have got the pelvic bones. Anteriorly what do you have? Anteriorly you will have the anterior abdominal wall muscles. Posteriorly you will have posterior abdominal wall. Along with posterior abdominal wall, what are there? Ribs are there or vertebra are there? Vertebra. Right. So, in this region on the back, what vertebra are you expecting? Thoracic or thoracic or lumbar vertebra? Mostly the lumbar vertebra. Okay. The posteriorly we have got what? We have got the posterior abdominal wall as well as the lumbar vertebra. And laterally, what is this? What do we have laterally here? See, laterally we have got the lower surface of the ribs, isn't it? Laterally we have got the lower surface of the ribs. So, this forms your cavity called as abdominal cavity. So, abdominal cavity is having what all structures over here? So, first superiorly we have got diaphragm. Superiorly we have got diaphragm. Okay. And inferiorly what do you have got? We have got the pelvic bones inferiorly, pelvic bones inferiorly. Anteriorly what do we have? Anteriorly we have got anterior abdominal wall and muscles, anterior abdominal wall and muscles. Posteriorly we have got the posterior abdominal wall, posterior abdominal wall. Is posterior abdominal wall having muscles? Yes, there are only 3 muscles there, and along with that we have got the lumbar vertebra. We will discuss about the muscles. Lumbar vertebra. And laterally what do we have? Laterally we have got the lower ribs. Laterally we have got the lower ribs. So, these are the structures that are forming your abdominal cavity. So, these are the structures that are forming your abdominal cavity. Okay, these are the structures that are forming your abdominal cavity. Now, what are the structures that are forming your pelvic cavity? For that, what I will do is that I will draw the pelvis over here and then I will explain you what are the structures that are forming the pelvic cavity. Let us say these are the 2 halves of your pelvic bones. These are the 2 halves of your pelvic bones, and down over here you have got a diaphragm. This particular diaphragm over here is called as your pelvic diaphragm. Okay, and next here you have got this dotted line which I am drawing over here. This is the inlet of your pelvic cavity. Okay, so where is your pelvic cavity? Actually, this is your pelvic cavity. Okay, so in this pelvic cavity, what are the important things you have to see over here? First, this particular border over here is called as the superior border. Superiorly what do you have? You have got the pelvic inlet. This is called as a pelvic inlet. Okay. Next important thing, down over here what do you have? What is this border called as? This is called as the inferior border. So, superiorly you have got the pelvic inlet, and inferiorly what do you have? You have got pelvic diaphragm. Pelvic diaphragm that is located inferiorly. And this is the lateral border. So, laterally what do you have? This is the lateral border, and laterally what do you have? Laterally you have got the hip bones. Laterally you have got what? Hip bones. Now, superior border is pelvic inlet, inferior border is the pelvic diaphragm, laterally you have got the hip bones. Now, what are the structures that are located anteriorly and posteriorly? anteriorly and posteriorly. Yes, what do you have anteriorly? Anteriorly, what do you have? If this is the pelvic cavity, right? This is your pelvic cavity. Anterior to the pelvic cavity, we have two bones. What are those two bones? They are called as your pubic bones, and joint between them is your pubic symphysis. Posteriorly, what do you have? You have got here another bone called as sacrum and coccyx, right? If you remember the pelvis, right? If you remember the pelvis, then you will understand this picture, right? So I'm just drawing very roughly over here. See, posteriorly, what do you have? Posteriorly, whatever I'm drawing right now is your sacrum like this, right? And down you have got coccyx, okay? And right, so let us say, for example, if this is the cavity over here, anteriorly what do you have? Anteriorly you have got here pelvic bones, and the joint between them is pubic symphysis. Posteriorly what do you have? Posteriorly you have got the sacrum as well as the coccyx, okay? Anteriorly you have got the pubic bones. Along with pubic bones, what do you have? Pubic symphysis. What is this? Pubic symphysis. Posteriorly, what do you have? Posteriorly, you have got the sacrum. Sacrum as well as the coccyx. Sacrum as well as the coccyx. So, these are the important structures that are located over here. Okay. Now, let us discuss about the abdominal planes. What are the different kinds of abdominal planes? If this is the pelvis, see here it is very clear, right? Posteriorly, you have got what? Posteriorly, you have got the sacrum, and down you have got the coccyx. Anteriorly, you have got the pelvic bones and the joint between them. You see, this is the joint between them, that is the pubic symphysis. Laterally, what do you have? You have got the pelvic bones laterally, right? Like the iliac bones. So, chalo, now what we will discuss is that we shall discuss what are the different abdominal planes over here. So, before we discuss abdominal planes, let us mention few vertebra over here, okay? So, with the help of this vertebra, we shall draw these abdominal planes. Let us say this is L4. Here we have got L3, okay? Next we have got L2. Here we have got L1, okay? So, let us write it as L1, L2, L3, L4 and L5, okay? And not only that, we shall also start writing from 10th vertebra over here. So, let us say this is T12. Here we have got T11 and here we have got T10, okay? So, this is your T10, T11, T12, okay? So, these are the thoracic as well as lower thoracic and all the lumbar vertebra over here. Now, on either sides, what do you have over here? For example, if this is the sternum and all, yeah, for example, if this is the sternum and all over here, right? So, if you see what are the structures that are located on side to this, we have got the ribs. So, the lowermost margin you call it as a costal margin, right? Lowermost margin you call it as a costal margin. Now, if you look carefully, the xiphoid process whatever is there, that is coming all the way till T10 like this, okay? And from here stretches down your what is this? This is your costal margin, okay? So, all the way costal margin comes down to the lower border of L2 like this, okay? So, here we have got the ribs like this. These are your ribs. These are your ribs in this way. Now, let us discuss the different planes. Now, to discuss the different planes here, what we will do is that we shall rub out these structures over here so that it would be easy for us to draw the planes over here, okay? So, let us rub out these structures. Chalo. Now, what are the different planes over here? Let us draw it with a green. First important thing is that lower border of L1. Exactly, I am drawing a line that is passing through the lower border of L1. So, this particular line that passes through the lower border of L1 is called transpyloric plane. Okay, what is this called? Transpyloric plane. So, transpyloric plane. So, as I am telling, it is a transpyloric plane. It passes through the pylorus. Okay. So, I am not telling you that definitely it will pass through the pylorus if the patient is standing. In an erect position, this might not, I mean, lower border of L1 might not be the transpyloric plane, right? Or let us say if the patient has ate something, right? So even in that case also the plane will shift. So on empty stomach, when the patient is standing, then you can draw the transpyloric plane. Okay. Next important thing is the lower border of L2. So this particular lower border of L2, which you can see over here, this particular lower border of L2 which you can see over here, this is called as a subcostal plane. Why are you calling it as subcostal? If you can observe here clearly, you see the ribs over here. The ribs, where are they ending? The lower border of L2. So that is why this is called subcostal. Below all the coastal margin, you call it as a subcostal. So this plane over here is called as a subcostal plane. Subcostal plane is along the lower border of L2, right? And between L3 and L4 is the place where we have our umbilicus. This is the umbilical region, okay? And the lower border of L4, right? The lower border of L4, or between L4 and L5, this is a place, you call it as a transtubercular plane. Why are you calling it as transtubercular plane? Because this is your iliac crest. On the surface of iliac crest at one point there is a small bumpy elevation. I mean, in this picture it is not clear, but normally on the iliac crest you will have a small bumpy elevation. So if I am drawing a line from one elevation to another elevation, this is called transtubercular plane. What is this called? Transtubercular plane. This is your transtubercular plane. So this plane over here is called as your transtubercular plane. So what are the different abdominal planes which we have discussed over here? One we have discussed is called as a transpyloric plane, and remember one thing, transpyloric plane is also called as Edison's plane. Transpyloric plane is also called as your Edison's plane. Next you have got the subcostal plane, then transtubercular plane. These are the different planes which we have over here. Okay. Now let us draw all the important structures over here. See, this is already drawn and kept over here. So if you can see this, right? So there are different regions within your abdominal cavity. Okay. So let us discuss one by one what are the different regions within your abdominal cavity. Okay. So for this, what we will do is that let us draw that regions over here. Let us say the center part, the umbilicus is present over here. Okay. Now look here, I am drawing one line, right? So I have divided the I have divided the entire abdominal cavity into 9 regions. Okay. So these are called as what? These are called as abdominal regions. So I have divided the abdominal regions completely into 9. These are called as the 9 abdominal regions. Now out of these 9 abdominal regions, what are the names of each and every region over here? Now one very important thing, you should be sure that here you have got the ribs, and on the either side also you have got the ribs like this. So the place where these ribs are present, okay, this particular place is called as a right hypochondric region. What is this? This is called as a right hypochondric region, whereas this part over here is called as a left hypochondric region. So one is called as a right hypochondric region, another one is called as a left hypochondric region. Next important thing is that you see this particular region over here, right? So this particular region is called as a epigastric region. After epigastric, the middle region, whatever you have over here, is called as a mesogastric region, where your umbilicus is present. So upper one is called epigastric, middle one is called mesogastric, and the lower region over here is called as a hypogastric region. Okay, so let us name these regions over here. What are the different regions? This region over here is called as a epigastric region. This region over here is called as a mesogastric region, and this region over here is called as a hypogastric region. So epigastric region, mesogastric region, and hypogastric region. Now we have already discussed that this particular region over here is called as a right hypochondric region, right? Then what is this region over here? This is called as a right lumbar region. A right lumbar region. On the opposite side you have got the left lumbar region, right lumbar and left lumbar. In the same way, here we have got the right inguinal region. On the left side, what do you have got? You have got the left inguinal region, right inguinal, left inguinal region. Okay. So what are the different things we have got over here? So first important thing, this region over here is called as your right hypochondric, and this region over here is called as the left hypochondric. Next we have got the right lumbar region over here, right, and here we have got the left lumbar region. Why am I telling you these regions is that, for example, if a patient is complaining of pain in the right lumbar region, just by knowing what organ is present in the right lumbar region, you can guess where the pathology might be. For example, if I am telling you that the patient is having pain in the right hypochondric region, normally what is the organ that is basically present in this right hypochondric region, guys? That is your liver. So obviously you can guess the problem, that there might be some problem with the liver. Either it might be a gallstone, or it might be the damage to the liver, right? If there is hepatomegaly also, you will have tenderness in the right side, right? So these are the important things. And right inguinal, left inguinal, right? So if you know if you know that the patient is having pain in the right inguinal, you can guess that the right inguinal region is having appendix. So obviously you can think of appendicitis. For that you need to rule out some things. For that you need to do a CT scan and all. Okay, chalo, whatever it is, these are the abdominal regions. How many abdominal regions are there? Completely 9. Okay, now let us look at what are the organs that are briefly present within these abdominal regions. See here, in the epigastric region, what do you have? You have got the stomach in the epigastric region, and remember one thing, behind the stomach you have got pancreas. What do you have? You have got pancreas behind the stomach. Not only that, even transverse colon also. Okay, and you see this, I think there is no need to explain here. I'll just keep on writing the points over here. So you know that this colon over here is called ascending colon. This colon is called descending colon. And what is this colon over here is called as? This is called as sigmoid colon. Okay, this is called as sigmoid colon. What is this called? This is called a rectum, and this is anus. See, this is the place in the right inguinal region where you have your appendix. Okay, and again here I have to draw the liver over here. You see, this is the place where your liver is present, and in the left hypochondric region is a place where your spleen is present. Okay, and remember one thing, can you see that the ascending colon is going up and then suddenly coming down like this? In the same way, transverse colon is continuing suddenly up and then again coming down like this, right? So what is this sharp edge? What is this sharp edge called as? This edge is present near the liver, so you call it as a hepatic flexure. What do you call this point as? This point is called as hepatic flexure of colon. Hepatic flexure of colon. And what is this point should be called as? Splenic flexure of colon. Splenic flexure of colon. Splenic flexure of your colon. So we have got two flexure here. One is called as a hepatic flexure of colon, and the other one is called as a splenic flexure of colon. Okay, so these are the organs which are present over here. So mostly you need to know that, for example, you come across a question where they are telling you that a patient is having a stab wound with a knife in the right hypochondric region. So which organ might be injured or ruptured? That might be your liver. Let us say patient is having pain in the left hypochondric region, and we came to know that the patient met with an accident. There is bruising here and all, right? There is internal bleeding. So which organ might have been ruptured? That might be your left, the spleen. Okay, so if you look at this, right, if I am dividing all these regions over here, just have a look over here. See, if I am dividing all these regions like this, so these are the regions to which I am dividing. So can I tell you that liver is not only located in the right hypochondric, it is also located in the epigastric region and a little part in the left hypochondric region? Yes. So this is your spleen again. See, this is your spleen which is hiding behind, and this is your stomach. Okay, so here also you can figure it out, what are the structures that are located. Okay. Now regarding the liver and all, these are the things which I wanted to discuss right now. So just have a look over here. Yeah, just have a look over here. So this is the location of your liver like this. Okay, and this is the location of your spleen, and this is the location of your, what is this, stomach, in this way, location of your stomach. So stomach is exactly located here in the epigastric region. Okay, now question is, where is spleen located? Basically you have to know spleen is normally not palpated. See, when it comes to liver, you can palpate the inferior border of liver. This is your inferior border of liver, right? You can actually palpate the inferior border of liver in the right hypochondric region when the patient is supine. Okay, but normally can you palpate the spleen? No, you cannot palpate the spleen normally. Why? Where is the spleen located? Spleen is located between 9th, 10th and 11th rib. It is located behind 9th, 10th and 11th ribs. Enlargement of spleen is called as splenomegaly. Enlargement of spleen is called as splenomegaly. Basically guys, there are three different grades of splenomegaly. Okay, what are those three different grades of splenomegaly? Let us say there is mild, moderate and massive. MMM, mild, moderate and massive splenomegaly. What are this mild? Mild splenomegaly, what will happen is that you can actually palpate the spleen because spleen is enlarged till here, right? You see, spleen is enlarged till here, so you can actually palpate the spleen beneath the left, right? What? You can palpate the spleen beneath the left hypochondric region. Okay, beneath the left hypochondric region, you can just palpate the spleen if it is mild. If it is moderate splenomegaly, spleen will be enlarged all the way till the umbilicus. You see, this splenomegaly is called as moderate splenomegaly. If massive splenomegaly, spleen will be enlarged all the way till the right inguinal region. Spleen will be enlarged till the right inguinal region. Okay, so there are three different grades of splenomegaly. So this is called as mild splenomegaly, this is called as moderate splenomegaly, this is called as massive splenomegaly. Okay, so these are the three important grades of your splenomegaly. Just look at this picture over here. Now in this picture, what is happening? You see a distended abdomen. Why? Because there is splenomegaly. Can you see the markings over here? You see, which the doctor physician has already made these markings. So see, this marking is towards the umbilicus. So this is moderate splenomegaly, and there is also one more marking that is going all the way down. It means this is a massive splenomegaly. Okay, massive splenomegaly, and this is the splenectomy. Once the spleen is removed, this is how the spleen looks. And remember one thing, the anatomy point of view is, this is your splenic artery. What is this? This artery over here is called as your splenic artery over here. Okay, so this is one of the very important thing which you need to understand over here. Now one very important clinical point I wanted to discuss. What is that clinical point is that this clinical point will also cover up your little part in microbiology as well. Okay, it will even cover a little part in your microbiology as well. So what is this point? What is this point is that normally let us say that this is your blood vessel. This is your blood vessel. Okay, and let me draw this thing, that you have got an artery. See, this is an artery, right? This is an artery that is supplying blood to the spleen. Let us say this is your spleen, and within the spleen you already have some macrophages. These macrophages are called as splenic macrophages. What are they? They are called as splenic macrophages. Now what I am telling you is that, let us say that within the blood vessel there is a bacteria. See, this is a bacteria here, and this bacteria is having a capsule surrounding it. So this bacteria is called as encapsulated bacteria. Now what will happen? Looking at the capsule, our liver releases two important proteins. So one protein over here is called as C3b. Another important protein over here is called as IgG and C3b. Now what do this IgG and C3b do? They both attach to the surface. Okay, they both attach to the surface, and what do they do is that these both proteins, they take the bacteria. These both proteins, what are they doing? They're taking the bacteria all the way to your spleen. What will spleen do? Spleen is having splenic macrophages. These splenic macrophages, what do they do is that they completely destroy this bacteria. This is the normal thing that happens in you and me. Okay. Now another important thing is that, for example, let us say in this particular patient, he is not at all having a spleen. There is no spleen at all, right? Let us say I met with an accident. Now my spleen has been removed. Let us say my spleen is ruptured. There are 5 grades of splenic tear. Okay. Grade 5 splenic laceration has happened. So finally splenectomy has done. My spleen has been removed. Now once my spleen has been removed, what might have happened? Let us say bacteria entered into my body. Now these two proteins which are attaching to the surface, these two proteins are called as opsonins. Opsonins, and the way they are taking these bacteria to the spleen, right, for the macrophages to destroy it, this entire process is called as opsonization. What is this? Opsonization. So in the question, if they ask you, in opsonization, what are the opsonins? That is C3b and IgG. Okay. During this opsonization, what is happening? So during this opsonization, now the proteins will attach here, right, and they take back to the spleen. Now do I have spleen? I don't have spleen. If the spleen is not there, don't you think this bacteria will leave, or it will die? It will leave, obviously. It will not die because there is no one to destroy this bacteria. So in that case, what is going to happen? The bacteria will multiply and cause the disease. So any patient who is coming to me telling that, doctor, my spleen has been removed few months back and now I am worried that I might contract, I might get some infections, right? So can you please tell me what infections will I get? So you have to tell him you are at a risk of getting pin infections. What is pin infections? P stands for what? P stands for pneumonia. Okay, that is Klebsiella pneumonia. Klebsiella pneumonia, and I stands for influenza, that is your Haemophilus influenza. Haemophilus influenza, and N stands for Neisseria. So patient is also going to have Neisseria meningitidis. Neisseria meningitidis. So you have to tell that yes, you are at a risk of these 3 infections. Why? Because you are an asplenic patient. You are what? You are a asplenic patient. So that is the reason why you are at a risk of these 3 infections. Okay, so now what you have to do? What you have to do is that you have to start taking the vaccines for this. For Klebsiella pneumonia, you take a vaccine called as pneumococcal vaccine. Pneumococcal vaccine. Now for Haemophilus influenza, you take a vaccine called as Haemophilus influenza type B vaccine. Type B vaccine. Neisseria meningitidis also meningococcal vaccine will be there. Meningococcal vaccine. So these are the 3 important vaccines which you basically use in this particular patient over here. These are the 3 important vaccines which you basically use in this patient. Okay. So always remember what infections are more common in asplenics. There are 3 infections. They are called as pin infections. P for pneumonia, I for influenza, and N for Neisseria. So what you need to do? You need to, for the prevention sake, you need to give the vaccines to the patient. Okay, so this would help the patient. Now let us discuss about another important topic, that is your muscles of your abdomen. What are the different muscles of abdomen which you have over here? Now muscles of abdomen are basically divided into 2 groups. Now whatever muscles you can see on my front here, these are called anterior muscles. Whatever muscles you can see on the sides here, these are called anterolateral muscles, because from the front they go to the sides. So anterolateral, and these muscles are anterior muscles. So we have got 2 groups of muscles. Okay, one are called as the anterior muscles. Another one over here is called as a anterolateral group of muscles. Okay, now when it comes to the anterior muscles, right, you have to know anterior muscles are basically vertical. So that is why you call them as vertical muscles. You call them as vertical muscles. Now when it comes to anterolateral muscles are flat muscles. Anterolateral muscles are flat muscles. So what are these anterior muscles over here? There are 2 anterior muscles which are straight. One is straight muscle. Straight is called rectus. and it is present in the abdomen, so you called as abdominis, rectus abdominis. Second important muscle over here is pyramidalis, okay, pyramidal shape muscle is pyramidalis. Coming to the flat muscles, we have got the three flat muscles, okay. One is called as a external oblique muscle, Next we have got is the internal oblique muscle, and third we have got is the transverse abdominis muscle. So anterolateral we have got the external oblique, internal oblique, as well as your transverse abdominis muscle, okay. Now before I proceed on to the muscles, one very important clinical point I just want to share it with you, that you can see this muscle which is straight. See, tell me first of all, this muscle is located anteriorly or laterally? It is located anteriorly, and this muscle is straight completely, so rectus. So what muscle this might be? This muscle is called as rectus abdominis, this muscle over here is called as rectus abdominis. Next important thing over here is that here you have got an artery. Let us say this particular artery is your external iliac artery. What is this artery? This artery over here is called as your external iliac artery, okay. What is this? This is called as your external iliac artery. Now a branch of this external iliac artery is going up like this, okay. So a branch of this external iliac artery is going up and supplying to your rectus abdominis muscle. So this branch over here is called as what? Inferior epigastric artery. Very important, inferior epigastric artery. Sometimes what will happen, this inferior epigastric artery will rupture. So when it will rupture, obviously there will be leakage of blood. Now this blood, where will it accumulate? It will accumulate within this rectus abdominis muscle. Once if this blood, you know where the blood will accumulate? The blood starts accumulate within these tendinous insertions, you know. This rectus abdominis muscle is having some interruptions here. These interruptions are called tendinous interruptions or tendinous intersections. Within these tendinous intersections, the hematoma will be formed, the blood clots will be formed. So you call it as rectus sheath hematoma, okay, rectus sheath hematoma. So you need to, the important question over here is that which is the artery that is ruptured in rectus sheath hematoma? That is inferior epigastric artery. So this is how it looks from outside, and when the autopsy is made, can you see the rectus abdominis muscle with some tendinous insertions over here, and within the tendinous insertions can you see a dark red color? That is the blood over there, okay. So let me show another picture. You see this one, these are the, this is the muscle over here, the tendinous insertions, and you see the blood that has been clotted over here, right. So this is nothing but your rectus sheath hematoma over here, okay. So look at the muscles over here. Two muscles which are straight, one is rectus abdominis, another one is pyramidalis, which is not shown here. Next is external oblique, internal oblique, and transverse abdominis. External is completely outside. After that we have got internal, after that we have got transverse abdominis. See, look at this external oblique. See, this is external oblique, right. If you look at the fibers of external oblique, how are the fibers of external oblique? These external oblique fibers are, they are projecting downward medially like this. You see, the center line is the medial line. So you look at these fibers, how are they projecting? Are in the projecting downward medially like this? So these fibers are projecting downward medially. Look at internal oblique, they are projecting upward medially, isn't it? So if the fibers are projecting upward medially like this, right, they are your internal oblique. So this is your external oblique, this is your internal oblique. Next, if the fibers are transverse in this way, right, transverse in this way, you call it as transverse abdominis. See, if the fibers are transverse like this, you call it as transverse abdominis. So there are three important fibers, you also know how they are projecting, okay. Now what we shall discuss is that we shall discuss what are the components of anterior abdominal wall. After that we will discuss what are the components of posterior abdominal wall. Components of anterior abdominal wall. So what are the different components of the anterior abdominal wall you have got? From outside to inside we will see. First, outermost layer will be what? Skin. Okay. If I cut the skin, what will I have? I will have a fat called as subcutaneous tissue. Subcutaneous tissue. Okay. After this subcutaneous tissue, I will have a fascia over here. This fascia is called as superficial fascia. Superficial fascia. Now this particular superficial fascia is divided into two important structures. What are those two important structures? We have got the outer and we have got the inner. Outer fascia and inner fascia. Outer superficial fascia is called as camper fascia, and the inner fascia over here is called as Scarpa's fascia. Outer is camper and inner is Scarpa's fascia. Next, the fourth important thing over here is that we have got another important muscle called as external oblique muscle. What is that? External oblique muscle. Now you will tell me, after external oblique what do you have? You have got internal oblique muscle. Internal oblique muscle. After internal oblique muscle what do you have? You have got transverse abdominis. Transverse abdominis muscle. Okay. After transverse abdominis what do you have? You have got the deep fascia. So deep fascia is also called as transversalis fascia. I mean, this is a fascia of transverse abdominis muscle, so you call it as transversalis fascia, also called as transversalis fascia. So if you have looked at my lectures of the upper limb, the rapid revision of upper limb, there I told you in the thigh there is deep fascia. The deep fascia of the thigh is called as what? Fascia lata, I told you, right? So the deep fascia which is located in the abdomen, that is transversalis fascia, right? This fascia in the abdomen, as it goes down, it becomes continuous with the deep fascia of your thigh. Okay, the deep fascia in the abdomen becomes continuous and it fuses with what? Fuses with the deep fascia of thigh. Fuses with the deep fascia of the thigh. And lastly, we have got a layer called parietal peritoneum. Parietal peritoneum. So these are the layers from outside to inside which we have over here. What are the layers? One we have got is the skin, right? Next we have got is a subcutaneous tissue. Then we have got a superficial fascia, outer camper, inner Scarpa's fascia. Next we have got the external oblique muscle. Then next internal oblique. You know, external oblique fibers, right? What did I tell you? They are running downward medially. Upward medially is internal oblique, transverse is transverse abdominalis, and transverse abdominalis is having a fascia called as transversalis fascia, and this fascia is in continuous with the deep fascia of your thigh. Okay, and lastly we have got another important thing called as parietal peritoneum. Now if you look at this particular muscle over here, you know this muscle. What is this muscle over here? This is called as your rectus abdominis, rectus abdominis. Okay. Now, can you see a line over here that is separating the rectus abdominis from the other one, right? So this particular line over here is called as arcuate line. Arcuate line. Why am I telling about this arcuate line? You will understand it in a minute. Okay, but before that, before you understand what is arcuate line, you have to know about a very important topic that is called as rectus sheath. Rectus sheath. What is rectus sheath? You see this rectus, what is this muscle in the center? These are your rectus abdominalis. See, what did I do? The muscle in the center over here, I have made a transverse section. When I made a cut section like this, then I will see the rectus abdominis muscle in this way. You see, surrounding the rectus abdominis muscle, there is a very multi-layered aponeurosis. There is multi-layered fascia, different fascia or different aponeuroses, multi-layered, all of them they join together to cover and protect this rectus abdominis muscle. Okay, so this multi-layered aponeurosis is nothing but called as your rectus sheath. What is rectus sheath? It is a multi-layered aponeurosis, multi-layered aponeurosis. So how is this multi-layered aponeurosis formed? You have to know. First important thing, what is the outermost layer? Outermost layer is called as your skin. Again repeat the same thing. After the skin, what do you have? What is this yellow color layer? This yellow color layer is called as your subcutaneous tissue. Subcutaneous tissue, yellow color layer over here is called as subcutaneous tissue. After subcutaneous tissue, so skin, then we have got subcutaneous tissue. After this subcutaneous tissue, the next this pink color layer over here, this is called as a superficial fascia. Superficial fascia. After this superficial fascia, we have got three important muscles. What is this? This is called as external oblique muscle, external oblique. Then what do we have? We have got internal oblique muscle, internal oblique muscle. Next we have got what? Transverse abdominis muscle, transverse abdominalis muscle. We have got external oblique, we have got internal oblique, we have got transverse abdominalis muscle. After that, what do you have? Okay, after these muscles, what do I have over here? After these muscles, I have got, what is this? Deep fascia, transversalis fascia. It means this one over here is your deep fascia or your transversalis fascia. And finally, this is called as your parietal peritoneum. Okay, right. So, this external, every muscle will have a tendon. Every muscle will have an aponeurosis. Yes or no? Now, if you look at this particular muscle over here, right? So, and by the way, this is your rectus abdominis, here also rectus abdominis, and on the opposite side also here, external oblique, internal oblique, transverse abdominis, which we have over here. Now, how is rectus sheath formed? Rectus sheath over here is having two layers. What are the two layers? In front of the rectus sheath, look here carefully. In front of the rectus sheath, whatever layers are there, this is called as the anterior layer. Behind the rectus muscle, not in front of rectus sheath, in front of rectus abdominis muscle. I am sorry. In front of rectus abdominis muscle, you have got a sheath over here. This is called as anterior layer. Behind rectus abdominis muscle also you have got a sheath. This is called as a posterior layer. So how many layers we have got? We have got anterior layer, we have got posterior layer. Let us see. Now anterior layer is formed by, yes, anterior layer is formed by what? You tell me. Anterior layer is formed by, one is, what is this? This is the aponeurosis of external oblique muscle. Okay, aponeurosis of external oblique muscle. And look at the aponeurosis of internal oblique. This is the aponeurosis of internal oblique dividing into two lamina. This lamina is called as anterior lamina. This lamina is called as posterior lamina. Now tell me which lamina forms the anterior layer? Anterior lamina of internal oblique. Okay, so anterior layer is formed by two important things. One is aponeurosis of external oblique muscle. Okay, another one over here is anterior lamina of internal oblique muscle. Okay, aponeurosis of external oblique and anterior lamina of internal oblique muscle. In the same way, if you look at the posterior layer, how is the posterior layer formed? See, posterior layer is formed by the posterior lamina of internal oblique and the aponeurosis of transverse abdominis. Okay, so posterior layer is formed by transverse abdominalis, the aponeurosis of transverse abdominalis, transverse abdominalis, and what is that? Next you have got the posterior lamina of what? Internal oblique. posterior lamina of internal oblique. This forms the rectus sheath. Then what is this picture? What is the difference between this picture and this picture? Both of them are looking same. Okay, let me write down the names over here. So again, this is your rectus abdominalis, rectus abdominalis. We have got external oblique, we have got internal oblique, we have got transverse abdominalis. External oblique, internal oblique, transverse abdominalis. Skin, superficial fissure, all of them are same. Okay, then what is this? We don't have any layers behind. Posteriorly, we don't have any layers. Only the layers which are located are anterior layers. Only anteriorly we have got the layers. Posteriorly, there are no layers at all. Whatever layers we have got, all these layers are located anteriorly only, no posteriorly. Okay, so what are the layers that are, what is this picture and what is this picture? Actually, if you see here, this is picture number 1 and this is picture number 2. Okay, so look at this particular picture. Okay, so picture number 1 is above the arcuate line. This is your arcuate line. Above the arcuate line, this is a picture. Below the arcuate line, there is picture number 2. Okay, so above the arcuate line, rectus sheath is formed by, that is a question. Above the arcuate line, this is your above the arcuate line. Above the arcuate line, how is rectus sheath formed? Above the arcuate line, rectus sheath is formed by both anterior layer and formed by posterior layer. Below the arcuate line, rectus sheath is formed only by anterior layer, no posterior layer. So this is below arcuate line, below the arcuate line, below the arcuate line. Below the arcuate line, rectus sheath is formed by only the anterior layer, not the posterior layer over here. Okay, right. So let us look at what are the layers over here. See, what is this? What is this particular layer? This is your, this is your aponeurosis of external oblique muscle. And what is this? Aponeurosis, not aponeurosis, exactly speaking, this is called anterior lamina of internal oblique muscle, and this is aponeurosis of transverse abdominalis. Aponeurosis of transverse abdominalis. So all these three form the rectus sheath. Rectus sheath. Where are they forming the rectus sheath? They are forming the rectus sheath below the arcuate line over here. Okay, below the arcuate line they form the rectus sheath. Okay, so this is all you need to know regarding the anterior abdominal wall. So now we shall be discussing regarding the posterior abdominal wall. We are done with the anterior abdominal wall. Now we will discuss about the posterior abdominal wall. Now coming to the discussion of this posterior abdominal wall, you need to understand few important things. So what are the muscles that are present in the posterior abdominal wall? Basically we have got three important muscles. So the first muscle which you can see over here, right? So this is called as psoas major muscle. So psoas major is the one that is present in the posterior, or that is forming the posterior abdominal wall. Now this muscle which is present in the posterior abdominal wall, if you look at the origin and insertion, okay, from where it is originating, see, you see what are these these are called as your transverse process. So this muscle originates from the transverse process of T12. This is the transverse process of T12, then L1, L2, L3, L4, L5. So it is originating from the transverse process of T12, L1 to L5, L1 to L5. And where is it finally inserting? It is inserting to the, let's see, this is your greater trochanter, this is your lesser trochanter. It is inserting to your lesser trochanter of the femur. Where it is inserting? It is inserting to the lesser trochanter of your femur. Okay, so this is all about your psoas major. Next, the second important muscle is iliacus. What is this muscle? This is your iliacus. If you look at this iliacus, from where it is originating, so This fossa, whatever you can see over here, is called as the iliac fossa. So it is originating from the superior 2/3 of the iliac fossa. Again the same, it is inserting to your lesser trochanter of your femur. It is originating from superior 2/3 of iliac fossa and it is inserting to the lesser trochanter of femur, inserting to the lesser trochanter of the femur. In the same way, if you look at this muscle over here, this is called as quadratus lumborum. Quadratus lumborum. So from where this quadratus lumborum is originating? First, if you look at this muscle is originating from the medial half. You see, this is the medial half. The medial half of the inferior or the superior border, inferior border of 12th rib. This is your 12th rib. So it is originating from the inferior border of 12th rib on the medial side, right? And also the tips of all lumbar vertebra. Okay, you see this is a transverse process of vertebra. So from the transverse process of all the remaining lumbar vertebra, it is originating, and where it is inserting to here this point. This is called as your iliac crest. Okay, so it is originating. It is basically originating from the medial half of medial half of inferior border, medial half of the inferior border of 12th rib, medial border of the inferior border of 12th rib, and also the tips of lumbar vertebra, tips of lumbar vertebra, and all the way it is going and inserting to what? Iliac crest, inserting to iliac crest. So this is the origin and insertion of your quadratus lumborum muscle. Okay, so what is a nerve supply over here? So first of all, we discussed about psoas major. Okay, after psoas major we discussed about iliacus, then we discussed about quadratus lumborum. Quadratus lumborum. So these are the three important muscles which we are discussing over here. Now this psoas major, where it is inserting, what is the nerve innervation? That is your anterior rami. From the anterior rami of L1, L2 and L3. So the nerve that is supplying to the psoas major arises from the anterior rami of L1, L2 and L3, and iliacus arises from the femoral nerve. So the femoral nerve branch gives to iliacus, that is your L2 to L4. Femoral nerve root value is L2 to L4. And quadratus lumborum again from the anterior ramus of T12, L1 to L4, L1 to L4. So this is a memory part which you have to remember. So we are done with the anterior abdominal wall, we are done with the posterior abdominal wall. Now let us look at the arterial supply to your abdomen. So the first arterial supply which we shall be discussing is your celiac trunk. Okay, so before we discuss celiac trunk, repeat. So the first arterial supply which we shall be discussing is your abdominal aorta. Abdominal aorta. Okay, now regarding this abdominal aorta, what are the important things you need to know? First of all, you should know one very important thing, that this is your abdominal aorta. Okay, now this particular abdominal aorta will be divided into two common iliac arteries, and these common iliac arteries will in turn be divided into external iliac as well as internal iliac. Okay, now if I divide this abdominal aorta into different parts, for example, this part of the abdominal aorta is present at the level of T12. Next, this particular part of the abdominal aorta is present at the level of L1. Okay, next here we have got, this is your L2, and this one over here is L3. So let me extend it a little bit down. L3, and this part is your L4. Okay, let us say that this is your L4. Now these are the different topographic regions over here. Now from T12, exactly from T12, which part of your abdominal aorta will start? I mean, what is the branch that starts from T12 over here? That is your, what is that? That is your celiac trunk. So from T12 part, what is the branch that is starting? That is your celiac trunk. Celiac trunk starts from T12. Next important thing is that what is the branch that is starting from L1 over here? L1 over here, this is called as superior mesenteric artery. This is called as superior mesenteric artery. Okay. Next, what is the branch that is starting from L3 over here? So if I tell superior mesenteric artery is at L1, then L3 what will be there? Inferior mesenteric artery. Inferior mesenteric artery. Now coming from L2, okay, what are the arteries which we have on either sides of L2 are? So L2 we have got one very important artery called as the renal artery, and here we have got a pair of gonadal arteries. So a pair of renal arteries, a pair of gonadal arteries. So these are your, these are what? These are your renal artery over here, and this is your gonadal artery over here. A pair of renal and a pair of gonadal arteries are coming. Now here if you see this, these are the two, what are these? These are the two iliac arteries, right? So this is your right common iliac, this is your left common iliac. Right and left common iliac artery, which is in turn divided into external iliac and internal iliac, external and internal iliac. Now this internal iliac gives out three branches. Okay, this internal iliac artery gives out three branches. Now one is called as a rectal artery. What rectal artery? Middle and inferior rectal artery. Middle rectal artery and inferior rectal artery. Then what about the superior rectal artery? Superior rectal artery I will tell you later on. Okay. Now middle and inferior rectal artery are the branches of internal iliac. Next we have got an artery to the bladder. We have got an artery to the uterus. They are all supplying from your internal iliac artery. So these are the topographic, this is the topography of each and every artery which you need to remember over here. Okay. Now after this what we will discuss is that we will discuss about celiac trunk. So the next artery which we shall be discussing is your celiac trunk. But before we discuss celiac trunk, you should know one very important thing. What is celiac trunk, where it is exactly present? Just now I told you this thing, that let us say this is your heart. Okay. Now coming out of your left ventricle, what is the blood vessel that is coming out of your left ventricle? This is your arch of aorta. Okay, arch of aorta is descending down, so you call it as a descending aorta. Now this descending aorta descends down all the way. Okay. Next important thing is that here you have got a structure called as diaphragm. What is this? This is called as diaphragm. Okay. Now within this abdominal aorta over here we have got three branches. So on the top over here we have got celiac trunk over here. Next here we have got superior mesenteric artery. Down over here we have got the inferior mesenteric artery. Okay. So here we have got the celiac trunk. This is called the superior mesenteric artery, and this is called as the inferior mesenteric artery. Celiac trunk, superior mesenteric as well as the inferior mesenteric artery. Now first we shall discuss, and by the way, where did I tell you where is your celiac trunk? Celiac trunk is present at the level of T12, superior mesenteric is present at the level of L1, inferior mesenteric is present at the level of L3. Now we shall discuss each and every branch in detail. Okay. So first let us start with celiac trunk. So celiac trunk is the blood vessel that mainly supplies to your stomach, liver as well as your spleen. So what we will do here is that first let me draw that this is your abdominal aorta here. Okay, this is your abdominal aorta. Now this abdominal aorta is hanging down all the way down till the thoracic region, okay, sorry, thoracic, and then this is the abdominal aorta, finally dividing into your two common iliacs. So exactly this is the point where your celiac trunk was present, exactly at the level of T12. Okay. Now let us look at the branches. Now first important thing, later on I'll draw a schematic picture, schematic diagram where you can understand all these branches. So the first branch supplies directly to the lesser curvature of the stomach like this. So this artery is called as LGA. LGA stands for left gastric artery. What is this? Left gastric artery. There is another artery that comes all the way like this, okay, and this artery passes behind the stomach. So how it is passing behind the stomach? In a tortuous way. So it passes behind the stomach tortuously, and then finally inner way, supplies your spleen. So this artery over here is called as your splenic artery. This is called as a splenic artery. After this splenic artery gives one branch on the top, it gives one branch on the bottom. So the branch which is giving on the top is called as short gastric artery. Short gastric artery. The branch which is given on the bottom is called as the left gastro-omental artery, or you can call it as left gastro-epiploic artery. Omental, or you can call it as epiploic. So left gastro-omental artery or left gastro-epiploic artery. Okay. So this is the thing over here. Now what we will do is that we shall draw some of the branches over. And by the way, if this is a celiac trunk which is supplying your stomach has been given one artery, left gastric, another artery I will tell you, right? Splenic artery giving two branches, short gastric artery and left gastro-omental artery. Next, from the celiac trunk you see another branch that is coming over here. This particular branch is called as hepatic artery proper. What is this? Hepatic artery proper. Now this particular hepatic artery proper is divided into two branches. See, one branch over here is called as your common hepatic artery. What is this? Common hepatic artery. And this common hepatic artery is divided into two other branches. What are these two other branches? One is called as a left hepatic artery, another one is called as a right hepatic artery. Okay. From this right hepatic artery, you come across another branch that supplies to your gallbladder. Okay, that supplies to. From the right hepatic artery, you see another branch has come that supplies to your gallbladder here, right? So that is located posteriorly. So this particular artery here is called as cystic artery. What is this? Cystic artery. Now from the hepatic artery proper itself, you have got a branch that goes and anastomosis with the left gastric artery, and this artery is called as right gastric artery. So you remember this thing, left gastric artery directly originates from the celiac trunk, right gastric artery is originating from the hepatic artery proper. So what are the two branches of hepatic artery? I have told you only one branch. So hepatic artery gives one branch called as common hepatic artery, and another branch, right? Another branch passes down all the way like this. Yeah, another branch passes down all the way like this. Now this artery is present between stomach on one side and duodenum on other side. So you call it as gastroduodenal artery. What do you call this as? You call this as artery as GDA, that is your gastroduodenal artery. Now this gastroduodenal artery gives out two branches. So one branch coming down and another branch anastomosis with left gastro-omental artery. So see, left gastric artery is anastomosing with right. So left gastro-omental artery will anastomose with right gastro-omental artery. Right gastro-omental artery. Okay. So what is another branch over here? So this branch over here is called as, now tell me what is present within the loop of the duodenum. What is this structure that is present in the loop of the duodenum? That is your head of the pancreas. So it means this artery is present between duodenum on one side and head of the pancreas on the other side. So you have to call it as pancreato-duodenal artery. Okay, but this artery is called as superior pancreato-duodenal artery. This artery is called as superior pancreato-duodenal artery over here. Next important thing is that if you are going down like this, right, if you are going down all the way here, right, so here you have got one more branch, okay, you see you have got one more branch. What is this branch? This branch is called as a superior mesenteric artery. Superior mesenteric artery. If you remember from the previous picture, superior mesenteric artery is present at the level of L1, right? So this is present at the level of L1. So from superior mesenteric artery, a branch is going up and anastomosing with superior pancreatoduodenal artery. So what might be this branch? This is called as inferior pancreatoduodenal artery. Okay, what is this? This is your inferior pancreatoduodenal artery. So what are the branches just now we have discussed? What are the main branches over here? Let us discuss about the main branches. Main branches. So directly from the celiac trunk, what are the three important branches that are coming out? One is called as a hepatic artery proper, one is called as a left gastric artery, another one is called as a splenic artery, Hepatic artery proper is divided into two important arteries. What are those two important arteries? One is called as a common hepatic artery, another one is called as a gastroduodenal artery. Okay, so this common hepatic artery is in turn divided into two more branches. One is called as the right hepatic artery and left hepatic artery. Okay, a branch of right hepatic artery is called as cystic artery. What is that? Cystic artery. Coming to gastroduodenal artery is giving rise to two important branches over here. What are these two important branches? One is called as your right gastro-omental artery, right? Another one is superior pancreatoduodenal artery. Okay. Next, coming to the splenic artery. What did I tell you? I told you that splenic artery gives out two branches over here. What are those two branches? One is called as the what is that called? Short gastric artery. Another one is called left gastro-omental artery. So the anastomoses. What are the anastomoses over here? Anastomoses are you can see one anastomose from right gastro-omental artery, that is anastomosing with the left gastro-omental artery. Right, you can also see the left gastric artery. Where is the right gastric artery over here? Yeah, right gastric artery is here. I told you that the right gastric artery is arising from hepatic artery proper. So I'll also draw down this thing. There is a third branch called as right gastric artery, right? So here the right gastric artery is anastomosing with the left gastric artery over here. So these are the arterial anastomosis which you can see in case of celiac trunk. Okay. Now there is one very important clinical point. So this is a clinical point which you can see over here. What is this clinical point? This is not from the lateral side. If you see, this is your celiac trunk. This is your superior mesenteric artery. Okay. This is at the level of T12. This is at the level of L1. You know what is this particular ligament over here? See, if this is a abdominal aorta, this ligament is dividing into two and completely it is looping the abdominal aorta in this way, right? It is hooking the abdominal aorta in this way. So what is this particular ligament is? This is called as median arcuate ligament. What is this? Median arcuate ligament. This is the ligament of what? This is the ligament of your diaphragm. We have got median arcuate, we have got lateral arcuate, right? So in the diaphragm we have already discussed that median arcuate ligament. Now this is a normal condition, but sometimes what will happen? Can you see the median arcuate ligament is compressing your celiac trunk? So if the median arcuate ligament is compressing your celiac trunk, what can happen? What can happen is that the most important symptom that the patient will have is, patient will complain that after eating the food he is having very severe abdominal pain. So patient is having chronic abdominal pain postprandial. Postprandial is after the meals. right? So this is the most important complaint. Apart from that, patient will also complain of nausea, vomiting and all. Okay, nausea, vomiting, weight loss also will be there, right? Whatever it is, what is this syndrome called? What is this syndrome? What is the question they will ask you is that in case of celiac trunk compression syndrome, what is the ligament that is compressing, or what is the structure that is compressing the celiac trunk? That is your median arcuate ligament. What is the other name for this celiac trunk compression syndrome? It is also called as Dunbar syndrome. What is this? Dunbar syndrome. What is the other name for this? This is called as celiac axis syndrome. What is this? Celiac axis syndrome. What is the other name that is given for this? It is also called as Harjola-Marable syndrome. Harjola-Marable syndrome. And finally, it is also given another name called as median arcuate syndrome. Median arcuate syndrome. So these are the 4 important names that are given for the celiac trunk compression syndrome. And in which individuals it is more common? In females it is more common than in males. Okay, the ratio is around 4:1. Okay, so what is the treatment you do? The only treatment is surgical decompression. Surgical decompression. So what you do is that you just divide this ligament so that it will be decompressed. So it is completely compressing. It is completely compressing like this, right? So even if you put a pen or anything in between your fingers and compress it, you will have a pain. Yes or no? So what do? You just separate this ligament like this. You see, you are separating this ligament. When you are separating this ligament, what is happening? The aorta or the celiac trunk will be free. So that you do laparoscopically. Okay, so that you do laparoscopically. You do a laparoscopic approach. Laparoscopic approach. Okay, so that is what you need to know regarding the celiac trunk. Okay, now after celiac trunk is done, the next important artery we have to discuss over here is your superior mesenteric. See, we are done with the celiac trunk completely, and we are also discussed the clinical point. Next important one over here is superior mesenteric, inferior mesenteric arteries. Okay, so together we shall discuss here. So this is the colon over here. Let me explain this to you. This is your ascending colon, this is your transverse colon, this is your descending colon. Okay, and this is called as your sigmoid colon. And what is this? This is your rectum over here, and this is the anus. And what is this part which you have drawn? Actually, there should be small intestine here. If I draw the small intestine, it will be difficult to draw the arteries. So that is why I have drawn the small intestine in this way. What do you think is that? The first half just think as jejunum, the remaining half you think as ileum. And look here that the ileum is attached to the cecum. This is your cecum. Okay, and attached to the cecum, what do you have? What is this? This is your appendix. Clear now? Right. So now what we do is that first we will draw the abdominal aorta over here. So this is your abdominal aorta. This is your abdominal aorta. In this abdominal aorta, at the level of L1, now tell me which artery is present? Superior mesenteric artery. At the level of L2, which artery is present? We have got inferior mesenteric artery. Okay. So again I am writing it for you. This is at the level of L1, this is at the level of L3. Okay. Now where is your ascending colon, guys? This is your ascending colon, I told you. Where is your ascending colon? Ascending colon is on the right side. Transverse colon is in the middle. Descending colon is on the left side. So can I call this ascending colon as right colon and descending colon as left colon and transverse colon as middle colon, middle part of the colon, right? Middle colon over here. Now important thing is that from the superior mesenteric artery, what are the branches you see? See, first branch is coming all the way down here and it is making an angle near the what is this? Ileocecal junction, where the ileum is entering into the cecum. This is the ileocecal junction. Okay, so you see an angle over here. Now this artery is supplying your ileum as well as your colon. So that is why you call, okay, let me name this artery. I am naming it as artery A. Okay, artery A. So what is artery A over here? This is your ileocolic artery, ileocolic artery. Okay, now if you look carefully, from this ileocolic artery you see a branch that is coming, and this branch is making turns around your appendix like this, right? So this branch is making turns around your appendix. So this artery over here is called as appendicular artery. Ileocolic artery branch is your appendicular artery, appendicular artery. Okay. Next important branch. What is the next important branch? From the superior mesenteric, you see another branch that is going like this, right? Another branch that is going like this, which will divide into two parts. Okay, which will divide into two parts. So this part over here, which is supplying to your right side of the colon, is called as right colic artery. What is this? Artery B. What is artery B? Artery B is right colic artery. Why? Because it is supplying your right pole of the colon. Right colic artery. After that, you see an artery that is supplying like this to the middle part of the colon. This artery over here is artery C. What is this artery C? Artery C is nothing but middle colic artery. What is this? Middle colic artery. So what are the branches of superior mesenteric artery? What are the branches of superior mesenteric artery? We have got the ileocolic artery, we have got the right colic, and we have got the middle colic. One important clinical point is that, for example, if I wanted to do appendectomy, okay, if I want to remove the appendix. So if I want to remove the appendix, what will I do? What will I do is that, will I clamp appendicular artery or will I clamp ileocolic artery? I will clamp ileocolic artery in case of appendectomy. Keep that thing in mind. Coming on to the left side now. Now there is an artery that is supplying from the inferior mesenteric all the way down here to the sigmoid colon. So what will be this artery? Artery A. Artery A over here is called as sigmoid artery. What is this? This is called as your sigmoid artery. Next important thing is that there is an artery that is supplying to the top of the rectum, right? Let us say this is artery B. So artery B is which is supplying the top of your rectum. Top of your rectum is superior. So superior rectal artery. So now you understood. Previously when I was teaching abdominal aorta, I told you that middle rectal artery, inferior rectal artery are the branches of internal iliac. Then superior rectal artery is a branch of inferior mesenteric artery. Keep this thing in mind, okay? Next important artery is going all the way to the left and dividing like this and supplying to your descending colon. So artery C should be called as left colic artery. What is this? Artery C is your left colic artery. So these are the branches of inferior mesenteric artery, which is L3. So there are two important branches, superior mesenteric artery and inferior mesenteric artery. Superior mesenteric artery is L1, inferior mesenteric artery is L3. So this completes the discussion of both of your aortas. I mean the aorta, the superior mesenteric, the inferior mesenteric, the celiac trunk. So guys, now we shall be discussing regarding the inferior vena cava. What are the tributaries of inferior vena cava? What are the veins that are draining into your inferior vena cava? Okay. So here you have got one very important thing. This is called as your diaphragm. Okay. This is called as your diaphragm. So right now, as we already discussed that this is the diaphragm. So let us also discuss what are the veins that are draining into your diaphragm. Okay. So yeah. What are the veins that are draining into your diaphragm? So the vein, see, on either sides at the level of T8, on either sides at the level of T8, okay, at the level of T8, the veins that are draining into your diaphragm, this is called as your inferior phrenic vein. Inferior phrenic vein, inferior phrenic veins. Okay, there are two inferior phrenic veins that are draining into the inferior vena cava. Next, not only that, at the level of T8 only, there are three important veins over here, okay. So here we have got one vein, okay, here we have got another vein over here, and here we have got another vein. So these three veins over here are called as hepatic veins. How many hepatic veins we have got over here? We have got three hepatic veins. We have got the right hepatic vein, we have got the middle hepatic vein, and we have got the left hepatic vein. So three hepatic veins we have got, right, middle and left hepatic vein. Next important thing is that at the level of L1, you see a vein that is collecting blood all the way from the suprarenal gland. I mean the right side adrenal gland, okay. So let us say that this is your right kidney, this is your left kidney. Okay, so from the right suprarenal gland you see the vein that is collecting the blood and draining into your inferior vena cava like this. Okay, inferior vena cava like this. So what will be this vein called as? This is called as right suprarenal vein. But before I discuss this right suprarenal vein, let me discuss one very important thing. Let us discuss about the right renal vein itself. Okay, at the level of L1 only you see the right renal vein. So this is your right renal vein. Okay, now coming to the left renal vein, so this is your left renal vein. Again the same, it is draining into your L1. So this is your left renal vein. So I won't be telling you the topography, you just look at the topography that is written on the side. Okay, the topographic landmarks. Right, these are not the spinal segments guys, again these are the vertebral segments. Okay, right. So now look here, the right suprarenal vein drains directly into your inferior vena cava. Right suprarenal vein drains directly into your inferior vena cava, whereas the left suprarenal vein drains into what? Into your left renal vein, okay. So this is your left suprarenal vein draining into your left renal vein, okay, left renal vein, and this is your renal vein, on the left side, left renal vein. Next, you even have got veins over here. What are these veins? So if you see here, you have got the first lumbar vein, right? Here you have got the second lumbar vein, and here you have got the third lumbar vein, and here you have got the fourth lumbar vein. What are all these? These are nothing but your lumbar veins. Okay, we have got four lumbar veins, 1, 2, 3 as well as 4. Okay, so this is the first lumbar vein, second lumbar vein, this is the third lumbar vein, and this is the fourth lumbar vein over here. Clear? Now next important thing is that at the level of L2, right, there is a vein that is directly draining into the L2 segment, right, of the inferior vena cava. This is called as your right gonadal vein. What is this? Right gonadal vein. Whereas there is another gonadal vein that is directly draining into your left renal vein. Okay, this is called as your left gonadal vein. So you should know the differences. This is called as your left gonadal vein, and this is called as your right gonadal vein, left and right gonadal vein. And finally we have got at the level of L5 two important veins over here. These two important veins are draining into your L5 segment. So these two important veins over here are called as iliolumbar veins. What are these? These are called as iliolumbar veins. Next, overall it is dividing into two common iliacs. You know, this is your right common iliac, this is your left common iliac. Right and left common iliac veins, right common iliac vein and left common iliac vein. So these are the tributaries of your inferior vena cava. So now we shall be discussing regarding the portal vein and its tributaries. Okay, we shall discuss about the portal vein and tributaries. So what are the tributaries of the portal vein and what are the structures over here? So you can see this particular part which I have already drawn here and kept, right? So this part over here which I am highlighting with the green, this is your duodenum. Okay, so this is your loop of duodenum, the C-shaped loop of duodenum. Okay, now if you look over here, how is this particular portal vein formed? Okay, so how is this portal vein formed is that, so here let us say I am drawing a vein over here. Okay, so can anyone tell me what is this vein which I have drawn over here? This is called as superior mesenteric vein. Okay, so what is the name of this particular vein over here? Yeah, so this particular vein over here is called superior mesenteric vein. So if you remember the celiac trunk which we have discussed, so most of the branches here will be similar to the celiac trunk only. Okay, so this is your superior mesenteric vein. Now what will happen is that this superior mesenteric vein will go back of your what is this, pancreas. Okay, so if it is going back of the pancreas, I have to draw it lightly like this. Okay, so it is going back of your pancreas, and what it is happening is that it is joining with another vein over here. This is also located back of the pancreas. Okay, So what is this vein? This vein over here is called as your splenic vein. Okay, what is this vein over here? This is called as your splenic vein. Now the splenic vein and the superior mesenteric vein, both of them join together to form this particular vein called as portal vein. Okay, so this vein over here is splenic vein. So both of them join together to form the portal vein, and this portal vein also, it passes behind the duodenum. Okay, behind the duodenum, and then it comes up like this. So this is your portal vein. And now what will happen is that this portal vein is divided into two branches now. Okay, so one is the branch that is going to the right side, and one is the branch that is going to the left side. So it is divided into two important branches here. Okay, so this is your portal vein. So portal vein is formed by both superior mesenteric vein and another vein over here. What is this? This vein is called as splenic vein. S-P-L-E-E-N-I-C, splenic vein over here. Okay, now let us draw the tributaries. So, and by the way, this is your right branch, this is your right branch, this is your left branch. Now, and by the way, what is this vein over here? This is your portal vein. Portal vein. Okay, P-O-R-T-L, portal vein. So this is your portal vein. Now let us look at what are the different tributaries. Now if you remember, in the stomach, in the celiac trunk, okay, let me compare and contrast these two, okay, so that it would be easy. So in the celiac trunk over here, if you see carefully, what is this artery? Left gastric artery. In the same way, what is this artery over here? Right gastric artery. The left gastric and right gastric, both of them anastomosed over here, right? So in the same way over here, we have got two important veins. For example, if you look at this particular vein over here, this is called as a left gastric vein. What is this? Left gastric vein. And this vein over here is called as a right gastric vein. Okay, so what are these two veins over here? One is called as a left gastric vein. This is called as a right gastric vein, left and right gastric vein. Okay, they both anastomose each other. And how the left gastric vein is receiving the blood? Left gastric vein usually receives the blood from branches of esophagus. I mean, from the esophagus it is releasing, it is taking up the blood over here. Okay, so these veins over here are called as esophageal veins. What are these? These veins over here are called as esophageal veins. Now from the right gastric vein, you already have one more tributary over here. There is one more vein which is a branch of this right gastric vein. So this is called as prepyloric vein of Mayo. Prepyloric vein of Mayo over here. Okay. Now from the right branch, you come across a vein like this. Same way, from the right hepatic artery, you got a artery called as cystic artery. So from the right branch, you are getting a vein. This is called as cystic vein. This vein over here is called as cystic vein. Okay, what is this vein? This is called as cystic vein. Next, another important thing is that, have you come across an artery like this here? What is this artery? You see, this artery which is coming down is gastroduodenal artery, right? After gastroduodenal artery, it is divided into two. What is this? Right gastroomental artery, right? Another one is, you see here, superior pancreatoduodenal. So keep in mind about superior pancreatoduodenal and inferior pancreatoduodenal. Inferior pancreatoduodenal was coming from where? It is coming from the superior mesenteric artery. Okay, so in the same way, if you look at superior pancreatoduodenal, that is a branch of what? Gastroduodenal artery. Okay, that is a branch of gastroduodenal artery. So let us compare the same thing here with the veins. Okay, so we have to draw now superior pancreatoduodenal and inferior pancreatoduodenal vein. So from the top over here, you come across a vein. Okay, so this is the vein like this. So this vein over here, which I have drawn right now, is your superior pancreatoduodenal vein. Okay, what is this? This is your superior pancreatoduodenal vein. What is this? This is your superior pancreatoduodenal vein over here. Okay, now in the same way, from what is this? This is superior mesenteric vein. From this superior mesenteric vein also you come across a vein here. This vein is called as inferior pancreatoduodenal vein. What is this vein? This vein over here is called as inferior pancreatoduodenal vein. Inferior pancreatoduodenal vein. So we have got superior pancreatoduodenal, we have got inferior pancreatoduodenal vein. Okay. Now in the same way you have got some more veins over here. What are these veins? For example, if you look at superior mesenteric vein, to the superior mesenteric vein you have got small veins like this. What are these veins? These veins over here are called as jejunal as well as ileal veins. What are they? Jejunal and ileal veins, right? Jejunal and ileal veins, iliac veins, jejunal as well as your iliac veins. Okay. Next, there is one more vein. There is one more vein that is going all the way into your superior mesenteric vein. This vein over here is called as a right colic vein. What is this? Right colic vein. Next, here down here we have got another vein called as middle colic vein. If you remember the branches of superior mesenteric artery, you remember one is ileocolic artery, right colic artery, middle colic artery. So where is ileocolic artery? So here I have got a artery called ileocolic artery. But the vein over here is called ileocolic vein. One is right colic vein, another one is middle colic vein. Okay. So let us say this is ileocolic vein. Okay. And this one over here is right colic vein. Okay. And this one over here is middle colic vein, right colic vein and middle colic vein. Okay. Now, what are the other important branches over here? So, we also have to discuss one more branch that is going like this. This is called as right gastroepiploic artery. Like we have got left gastroomental artery, right, or left gastroepiploic artery, anastomosing with right gastroomental artery or epiploic artery. So, here we have got right gastroomental artery or epiploic artery. Okay. Now let us discuss about the splenic vein. Okay, coming to the superior mesenteric, what are the branches we have got in the superior mesenteric over here? We have got branches like, what are the branches over here? One is inferior pancreatoduodenal, and one is right colic, middle colic and ileocolic. Okay, right colic, middle colic and ileocolic. We have got jejunal and ileal veins. Okay. In the same way, we have got right gastroomental artery over here. Next, coming to this splenic vein, there are small branches over here, right, on the back side. That is why I am drawing it very lightly. So, on the posterior aspect, there are small branches over there. These branches are called as pancreatic veins. What are these branches over here? These are called as your pancreatic veins. These are called as here pancreatic veins over here. Okay, right. Next important thing is that one of the vein that is attached to the pancreatic vein like this, just have a look. One of the vein that is attached to the pancreatic vein in this way. What is the vein over here? There are 2 to 3 important veins that are entering here. What are those 2 to 3 important veins? See, now tell me the branches that are present on the left side. One is called as a left colic vein. Like we have got left colic artery, we have got sigmoid artery, we have got superior rectal artery. You remember the branches of inferior mesenteric artery? Same way, one is left colic artery is left colic vein. Next, sigmoid artery is sigmoid vein. Next, superior rectal artery is superior rectal vein. Okay, superior rectal vein. So, what was that artery name called as? That is your inferior mesenteric artery. So, the vein here will be called as inferior mesenteric vein. So, this total vein, you see this particular vein over here is called inferior mesenteric vein. Mesenteric vein. Okay, let me just highlight the major parts over here. You see this inferior mesenteric vein is the major vein, right? And what is this? Superior mesenteric vein is a major vein over here, right? So these are the major veins here, superior mesenteric and inferior mesenteric. And what are the branches of this superior and inferior mesenteric? What did I tell you? Left colic artery. So here it will be left colic vein. There it was sigmoid artery. So here it will be sigmoid vein. Sigmoid vein. There it was superior rectal artery. So here it would be superior rectal vein. Okay, superior rectal vein. Next, coming to this particular splenic vein. Here you have got a vein right? So this is that particular vein over here. This is that particular vein over here. This is called as left gastroepiploic vein. Okay, what is this? This is called as your left gastro-omental artery, because we have got right gastro-omental artery. Now this is left gastro-omental artery. Okay, and this splenic vein, once it enters into the spleen, it will give branches to the spleen. In the same way, there are two more branches here. What are these two more branches? These two more branches, you remember that splenic artery, right, was giving two branches. What are those two branches? Just look at the celiac trunk once again. See, what is this artery? Splenic artery, giving two branches. Short gastric artery, right, and another one is left gastro-omental artery. So in the same way, this is a splenic artery, in the same way, this is a splenic vein giving two branches. One is called as a left gastro-omental artery. I should write it as vein, right? So this is a vein, and here also I should just write it as vein, not artery. Okay, so this is the vein. And short gastric veins, short gastric artery there, so here it would be short gastric veins. Okay, so these are the portal vein and its tributaries. These are the branches. So if you clearly understood celiac trunk, superior mesenteric artery, inferior mesenteric artery, then the branches of this portal vein will also be easy. Hello guys, so now we shall be discussing regarding the inguinal ligament. Okay, so we shall be discussing regarding the inguinal ligament and all these important things, like what are the structures that form the inguinal ligament and all. Regarding the inguinal rings and everything we shall be discussing right now. Okay, so first important thing you need to know is that this particular part which I'm drawing over here is your anterior superior iliac spine that you have in your pelvic bone, right? So I hope all of you know that in the pelvic bone, let us say, I'm just drawing it very roughly. These are the ala, right? So this part here is called as your sacrum. This is your sacral bone. Okay, and down over here, so I'm just drawing one half. Okay, so in this particular half, you see this part over here is called anterior superior iliac spine. This is called as anterior inferior iliac spine. One is superior, one is inferior, and both are iliac spines. Okay, and the same picture I'm drawing over here. So this part over here is called as your anterior superior iliac spine. Okay, and down over here you have got, what is this particular part? Here we have got pubic tubercle, and this is called pubic crest. Okay, pubic tubercle and pubic crest, and this part here, over here, is called as obturator foramen. And you know that here we have got what? A joint called as pubic symphysis, which will eventually join with another part of your pubic bone like this, another part of your pubic bone. Okay, I hope you understood this picture. So all the way from anterior superior iliac spine to the pubic tubercle, right? By the way, what are these? See, one is called as a pubic tubercle, and this part is called as pubic crest. Pubic tubercle and pubic crest. So the line that is joining pubic tubercle all the way to your pubic crest like this is called as your inguinal ligament. What is this? This is called as your inguinal ligament. And by the way, tell me, what is this particular line over here called? This is not pubic crest, right? What is this line then called as? It is called as pectineal line. It is called as pectineal line. So what are the three things which we have over here? So here we have got pectineal line, right? Next we have got pubic tubercle. Next we have got pubic crest. Where is inguinal ligament attaching to? Inguinal ligament is attaching to your pubic tubercle. Okay, now you need to understand one thing. What is this particular muscle over here? What is this? What to say? What is this? How is this inguinal ligament formed? That's a very important thing. So in the abdomen, right, I think we have discussed the muscles of the abdomen. In the abdomen, there is a muscle called as external oblique muscle. All of you know, right? We have a muscle called as external oblique muscle. external oblique muscle. Okay, now this external oblique muscle, the lower portion of the external oblique muscle is the aponeurosis of external oblique. So that aponeurosis will infold and form inguinal ligament. What do I mean by this is inguinal ligament. What do I mean by this is, for example, let us say, right, for example, what do I mean by this is, as you can see, this is your external oblique muscle. Okay, this is your external oblique muscle. Now what I am trying to explain you is that this particular external oblique muscle, see, till here it is a muscle. Okay, so till the mid part here you have got the external oblique muscle. Till the mid part you have got the external oblique muscle over here. See, till here you have got the external oblique muscle. This is the aponeurosis of external oblique. So what is happening? The lower part is having the aponeurosis. So the lower part, the aponeurosis, what it is doing, this lower part of this aponeurosis is folding like this. It is folding like this. So because of this fold, you see a lumen and you see this entire ligament that is formed. This ligament which is formed by the folding of aponeurosis of your external oblique muscle, this is called as your inguinal ligament. Okay, what is this called? This is called as your inguinal ligament. Clear? Now this inguinal ligament is actually like this. See, external oblique is actually like this. Yes or no? If you remember, how are the fibers of external oblique directed? They are directed downward medially, right? You see, they are directed downward medially like this. So if you see, this is the anterior, this is the inferior. Okay, this is anterior and this is inferior. Antero-inferior part, you see a small opening here. This small opening over here is called as superficial inguinal ring. Okay, superficial inguinal ring. So what do we basically call is that this is called as a aponeurosis of external oblique muscle. The aponeurosis of external oblique muscle will loop like this and form a ligament called inguinal ligament. This inguinal ligament antero-inferiorly is having a deficit. Okay, antero-inferiorly, this aponeurosis is having a deficiency. This deficiency, whatever is there, is guarded by an opening over here. This deficiency forms an opening over here. This is called as your superficial inguinal ring. Actually, this is not a ring. A ring in the sense, anything which looks perfectly circular is called as a ring. But this is not a ring. Okay, why it is not called as a ring, why this is called as a misnomer, I will tell you now. Okay, but before that, we just have to draw this picture over here. Okay, so let us draw this picture over here. So this was the thing, this was your pectineal line, you know this. What was this? This was your pectineal line. Here we have got your pubic tubercle, then we have got pubic crest, and this is your pubic bone over here, pubic bone. Okay, and not to forget, here you have got, what is this? This is called as your pubic symphysis. This is your pubic symphysis. Okay, and yeah, this is your anterior superior iliac spine, anterior superior iliac spine. Now look here, this is a muscle. See, what is this muscle over here? This muscle over here is your external oblique muscle. Okay, so let us say these are the fibers of external oblique muscle which are directed downward medially. Okay, so this is your external oblique muscle like this. Now this particular external oblique muscle, the lower part of this external oblique muscle, see here, the lower part of the external oblique muscle will loop inward like this. You see how it is looping inward, right? The lower part of external oblique muscle is looping inward. So once it loops inward, it comes all the way down and attaches to your pubic tubercle. So in this way it is looping inward and it is finally attaching to your pubic tubercle like this. Okay, it is finally attaching to your pubic tubercle. So this entire ligament which I am drawing right now, right, is called as your inguinal ligament. But what did I tell you? And by the way, yeah, here is your anterior superior iliac spine like this. Now by the way, what did I tell you? Okay, let me write this thing. This is your external oblique muscle. Okay, external oblique muscle. Now another important thing, what did I tell you? I told you that anteroinferiorly, there is a small deficiency like this. Anterior inferiorly, what do you have? You have got a small deficiency. So this deficiency, I will draw it like this. Okay, so let me draw it in the form little more darker, in the form of a ligament over here, inguinal ligament. So anterior inferiorly I have got a deficiency like this, isn't it? So this deficiency of the external oblique muscle aponeurosis is what is called as a superficial inguinal ring. But tell me, is it looking like a ring or is it looking like a triangle? Isn't it looking like this? Isn't it looking like this? Yes. And down, you have got pubic tubercle like this, and what is this? This is your pubic crest. Isn't it looking like this? Now there are two structures. What are these two structures? This is called as a medial crus and this is called as a lateral crus. Of what is this? This is, you call this as superficial inguinal ring. Superficial inguinal ring, but it is not looking like a ring. It is in the triangular form, but it is not looking like a ring, so you cannot call it as a ring. But in the textbooks it is given, you just have to follow it. Okay, what is superficial inguinal ring? That's what I told you. There is a deficit. Okay, deficit of what? Deficit of aponeurosis of external oblique muscle. Okay, so where is this located? Antero-inferiorly. Antero-inferiorly there is a deficit. So this particular deficit is what is called as your what? What do you call this particular condition as? What do you call this particular deficit as? Superficial inguinal ring. Till here you are clear? Right. Next important thing what is happening? Next important thing what is happening is that from, you see the fibers here? These are the fibers of your inguinal ligament, right? Now the fibers of inguinal ligament, what will happen is that, see, these fibers are coming like this and they reflect backwards. These fibers, they are coming front. You see how the fibers are coming front, and these fibers are reflecting backwards. Reflecting backwards on what? They are reflecting backwards on this surface. What is this surface called? Pectineal line. Okay, so this particular fibers which are coming downward and reflecting back, they are together forming a ligament here. This is called as a lacunar ligament. Okay, so what do you call this particular ligament as? You call this particular ligament as lacunar ligament. Lacunar ligament. Okay, so what is lacunar ligament? Lacunar ligament is nothing but the fibers of inguinal ligament are reflecting backward. Okay, they are called as lacunar ligament. Okay, now from this lacunar ligament, look what is happening. Some of the fibers are reflecting laterally like this. You see, some of the fibers from this lacunar ligament, they are reflecting laterally in this way. So these fibers which are reflecting laterally, they are purely resting on what? They are purely resting on this particular pectineal line. They are purely resting on this pectineal line. So these fibers over here are called as pectineal ligament. These fibers over here are called as pectineal ligament. So here we have got two important ligaments, guys. One is called as a lacunar ligament and the other one over here is called as your pectineal ligament. Okay, now look here what is going to happen. This inguinal ligament, right, some fibers of this inguinal ligament, what will happen is that these fibers of the inguinal ligament, they are reflecting. Where are they reflecting? They are reflecting medially. See, if this is your pubic bone, see, this is your pubic bone on the right, here you will have pubic bone on the left. It means this is your midline of your body. Yes or no? So let me draw this, that this is your midline. Okay, let me use another color. Let us say this is the midline of your body. This midline of your body is called as linea alba. What is this? Linea alba. Now, as I already told you, some of the fibers from this inguinal ligament are reflecting upwards medially and they are crossing what? You see, they are going upward, they are going medially. Why am I telling medially? Because they are going towards the midline of the body. And these fibers are crossing the linea alba. So such fibers which are crossing the linea alba, this is called as a reflected part of inguinal ligament. What is this called? Reflected part of your inguinal ligament. Okay, reflected part of your inguinal ligament. So what should I write over here? So this part over here is reflected part of inguinal ligament. Reflected part of inguinal ligament. So this reflected part of inguinal ligament is crossing your what? It is crossing your linea alba. And in the same way, let me draw some more fibers over here with another color. Okay, let me use pink over here. See, I am drawing some fibers which are going opposite direction of these inguinal fibers. See, the fibers of inguinal ligament are going like this, and these fibers are going in this way. You see, these fibers over here are called as intercrural fibers. Okay, what are these fibers over here called as? Crural fibers. So what are the things we have discussed so far, guys? We have discussed that external oblique muscle aponeurosis antero-inferiorly will form what? Inguinal ligament. Okay, it will form inguinal ligament. And next, antero-inferiorly there is a deficiency. This deficiency is called a superficial inguinal ring. Next, antero-inferiorly, you see some fibers are reflecting backward. So these fibers are called as lacunar ligament. And fibers from this lacunar ligament, they reflect laterally and rest on the pectineal line. That is why you call them as pectineal ligament. If any fibers are resting on the pectineal line, you call them as pectineal ligament. Right? Next, some fibers are reflected, right, crossing the linea alba like this. This is called as a reflected part of your linea alba. Next, we have got the medial crus as well as the lateral crus over here. Okay, so this forms a triangle over here. So these are the important things which you need to understand over here. Okay, so let me write this thing down, that we have got two important rings. I will also show you where is a deep inguinal ring. So one we have written is superficial inguinal ring. Sound ostundi. One is called a superficial inguinal ring. Okay, this superficial inguinal ring is a misnomer. Why are you calling it a misnomer? Because it is triangular shaped. It is triangular shaped. In the same way, there is another inguinal ring called as deep inguinal ring. It is called as deep inguinal ring. What is deep inguinal ring? This is a true ring. This is a true ring. So superficial inguinal ring was with the how it is formed? It is formed antero-inferiorly. There is a deficiency in the aponeurosis of external oblique muscle, and that is how a superficial inguinal ring is formed. Then how deep inguinal ring is formed? If you remember all the muscles, external oblique, internal oblique, and next we have got transverse abdominalis. And after that we have got a fascia called as transversalis fascia. So if there is a deficit in transversalis fascia, if there is a deficit in the transversalis fascia, that gives you a deep inguinal ring. That will form a deep inguinal ring. So you should understand these two terms. Superficial inguinal ring is formed by, right, it is formed by what? Which muscle it is forming this? That is formed by external oblique muscle aponeurosis deficiency, right? In the same way, deep inguinal ring is formed by deficiency in the transversalis fascia. Okay, keep these two things in your mind over here for at any cost. Okay, next important thing, here we have got anterior superior iliac spine, right? So now I am showing you how the deep inguinal ring looks. So this is your pubic symphysis and all. You know that here we have got a ring like this all the way. This particular ring over here is called as your inguinal ligament. Okay, next important thing is, here you have got, this is the midpoint, exact mid half. Here we have got lateral half, medial half, the center, right? This is called as your inguinal point, inguinal region. This point over here is called as your inguinal point, mid inguinal point. Exactly above this mid inguinal point, we have got a ring exactly above this mid-inguinal point. We have got a ring. Okay, and what did I tell you? Anteroinferiorly there is a deficiency like this. This particular deficiency anteroinferiorly, what do you call it as? You call it as, yeah, what do you call this deficiency as? This is called a superficial ring. So this ring over here is called as superficial ring. This is called as superficial ring, and this is called as a deep ring. Superficial ring and deep ring. Okay, next important thing is connecting both the rings, connecting both the superficial as well as the deep rings like this. You see, connecting both superficial and deep rings, you see a canal over here, right? You see a canal over here connecting both the rings like this. This canal over here is called as inguinal canal. What is this canal over here called as? This particular canal over here is called as inguinal canal. Okay, and how many centimeters is inguinal canal? It is around 4 centimeters. Okay, and where is it located? It is located above and medial to the inguinal. It is located above the inguinal ligament or below the inguinal ligament? It is located above the inguinal ligament. Now medial part of inguinal ligament, see, this is medial part of inguinal ligament, this is lateral part of inguinal ligament. Where it is located, medial or lateral? Medial. Above and medial part of inguinal ligament. Medial part of inguinal ligament, that is where this inguinal canal is located over here. Okay, now what is inguinal canal consisting of? You have to know that. What is this inguinal canal consisting of? Inguinal canal in the males, it is consisting of spermatic cord. In the males it is consisting of spermatic cord, but what is it is consisting in case of females? Females, the inguinal canal is consisting of what? Round ligament of uterus and also ilioinguinal nerve. What are the two things? One is called as a round ligament of uterus, round ligament of uterus, round ligament of uterus, and ilioinguinal nerve, ilioinguinal nerve, round ligament of uterus and ilioinguinal nerve. These are the two things that are located in case of females. Okay, now let us see each muscle, how it is forming these, how they are crossing or what kind of borders they are forming to these inguinal rings. We shall look into the picture right now. How the fibers of each and every muscle are projected over these inguinal ligaments, we shall look into that. Okay, so the first important thing over here is here we have got, this is called as pubic crest. I am drawing two muscles on both the sides like this, inguinal ligament and here. Okay, so here is your anterior superior, here also your anterior superior. Let us say that this is your inguinal ligament on the right hand side, inguinal ligament on the left hand side. Now what I am trying to show you here is that you have got abdominal muscles. External oblique muscle you already know. Internal oblique muscle, transverse abdominalis muscle will form the transversalis fascia deficiency will form the deep inguinal ring. I told you that also you know. Now how the remaining fibers are projecting over these rings we will discuss now. So where is the midpoint? This is the midpoint. Here also we have got the midpoint. Just above the midpoint you have got a ring over here. This particular ring is called as your what? This is called as your deep inguinal ring. Here you have got a ring called as a deep inguinal ring. Okay, now look here. Let us draw each and every muscle right now. So first important thing is that we shall discuss about, on one side I will tell one muscle, on the other side I will tell a different muscle. Okay, so first we shall discuss about the transverse abdominalis muscle. Where is your transverse abdominalis muscle present? It is present lateral to your inguinal ligament like this. And if you look at the fibers of this transverse abdominalis, these fibers of transverse abdominalis, they are actually not touching, they are not disturbing the deep inguinal ring. What will happen is that the fibers here, okay, the fibers here, these fibers of transverse abdominalis, you see how, what are they doing? They slowly curve downward like this. You see, these fibers are slowly curving downward in this fashion. Okay, they slowly curve downward in this way. They slowly curve downward in this way, and they come and attach over here to pubic crest as well as your pubic tubercle in this way. This is how the fibers from the lateral 1/3 of your inguinal ligament, they are going like this and coming down, curving down and attaching here. Okay, but there are some fibers, they are curving immediately surrounding your deep inguinal ring like this. You see, there are fibers immediately surrounding your deep inguinal ring. These fibers are called as inferior alveolar fibers. What are these fibers? These fibers over here are called as inferior alveolar fibers. So these fibers which are curving downward and coming down, where are they actually attached? One side they are attached to your pubic crest, right? And on the other side they are also attached to your pectineal line like this. To the pubic crest, they curve downward and attach to pubic crest as well as the pectineal line. And now it forms a tendon, very thick tendon on both the sides. This is called as conjoint tendon. What is this? This is called as conjoint tendon. Now, what are these fibers which are immediately curving? What are these fibers which are immediately curving around the deep inguinal ring? So these fibers which are immediately curving downward, they are called as interfoveolar fibers. If I told inferior alveolar, I'm sorry, this is interfoveolar fibers. These fibers are called as interfoveolar fibers. Okay. Now, what is this muscle, by the way? This is called as transverse abdominalis muscle. Transverse abdominalis muscle. Now let us discuss another important muscle, that is your internal oblique muscle. Okay. Now this particular internal oblique muscle, you see, the fibers of internal oblique, from where are they originating? These fibers of internal oblique, where are they present? Origination might be different. Where are they present right now? Lateral 1/3 or lateral 2/3? See, these are lateral 1/3. Okay, but these fibers over here are lateral 2/3. Lateral 2/3 of your inguinal ligament. Okay, and look at these fibers. These fibers, they are crossing the deep inguinal ring. They are passing from anterior to deep inguinal ring. Okay. After that, after passing anterior to deep inguinal ring, now they are curving downward in this way. You see, all fibers are now curving downward in this way. Now these fibers are curving downward like this, and now here they are forming a tendon. This is called as conjoint tendon. This is called as conjoint tendon. Okay, so what are these fibers? These fibers are the fibers of internal oblique muscle. These are the fibers of internal oblique muscle, right? So these fibers are passing anterior to what? These fibers are passing anterior to your deep inguinal ring. Anterior to your deep inguinal ring, and they are curving down, and finally they are forming this tendon called as conjoint tendon. This tendon called as conjoint tendon over here. Okay, so two differences you should know when it comes to transverse abdominalis muscle. These transverse abdominalis muscle, they are forming a curve around this deep inguinal ring, and this is called as interfoveolar fibers. So interfoveolar fibers are present for transverse abdominalis. Next, when it comes to internal oblique passes from the anterior side, passing anterior to your deep inguinal ring. So these are the two important things which you need to know. Next and most important thing I'm going to discuss now. I'm right now going to discuss about a triangle over here. Okay, so let us say this particular part over here is your inguinal. This is the place where your inguinal ligament will attach over here, right? So this is your anterior superior iliac spine, and this is your inguinal ligament. What is this inguinal ligament over here? Next important thing is that in the center you have got a muscle. You see, what is this particular muscle that is located in the center with the tendinous insertions? Yes, and this muscle is perfectly straight. What is this? This is called as your rectus abdominis muscle. What is this muscle? This muscle over here is called as your rectus abdominis muscle. Okay, now Now, how to draw this transverse abdominalis muscle fibers? Okay, first of all, you have to draw where is your deep inguinal ring. If this is the mid inguinal point, see, this is the mid inguinal point, exactly above you have got your deep inguinal ring. Okay. Now, lateral one third of the, from lateral one third of your deep inguinal ring, the fibers start coming out, and these fibers are your transverse abdominalis fibers. What did I tell you? These transverse abdominalis fibers, first they form what? What is this? They form interfoveolar fibers over here, and remaining they curve downwards like this. You see, these fibers are curving downwards in this way. These fibers are curving downwards in this way. Okay, these fibers are curving downwards in this way like this. Okay, so these are the fibers over here. These fibers are called as what? These are the fibers of your transverse abdominis muscle. Transverse abdominis muscle fibers. Okay, now if you carefully look, you actually can see a very important triangle. But before I finish up the triangle, let me draw one more important thing. Just below this deep inguinal ring, you have got an artery over here. Okay, this particular artery over here is called as your external iliac artery. What is this? This is your external iliac artery. Just medial to that external iliac artery, you have got a vein like this. This vein over here is called as your external iliac vein. What is this? External iliac vein. Just medial to that, you have got a very important ring over here. This particular ring which is located over here is called as your femoral ring. What is this ring? This ring over here is called as your femoral ring. What is this? This is your femoral ring. Okay, and by the way, not to forget here that the fibers of your inguinal ligament, they are arching backwards like this. I told you these fibers are called as lacunar ligament, and they are arching laterally on the pectineal line. So pectineal ligament, this thing you know, right? Now I'm drawing a triangle here. Just look at this triangle. See, this is that particular triangle over here. Can you see a triangle over here? Right? Now, what are the borders of this particular triangle? What are the borders of this particular triangle? We have got three important borders. One, what is first border? See, one is called as a medial border. Okay, see, this is called as your medial border, and this is called as your lateral border. And what is this? This is called as your inferior border. So this is called as your medial border, this is called as your lateral border, and this is called as your inferior border. There are three borders here. Now these three borders together, they form a triangle called as inguinal triangle. The other name for this inguinal triangle is Hasselbalch's triangle. Okay, so now I'm going to describe about this triangle. So this triangle over here is called as your inguinal triangle. Okay, or you can call it as Hasselbalch's triangle. Okay, Hasselbalch's triangle. So this is called as your inguinal triangle or your Hasselbalch's triangle. Why this triangle is very important is that usually direct inguinal hernias, they pass through this triangle. Okay, why is this triangle important? Because the direct, there are two types of inguinal hernias, you know, direct and indirect. So direct inguinal hernias, they usually pass through this particular triangle. Okay, they pass through this particular triangle. So tell me, what are the borders of this triangle? We have got, one is called as a medial border, we have got the lateral border, we have got the inferior border. So medially, what do you have? Medially you have got, see, this is medial border. Medially, what do you have? You have got the lateral border of rectus abdominis. So this is rectus abdominis. These two lines which I am drawing are the lateral borders. So medially you have the lateral border of rectus abdominis. Laterally, what is a thing that is located laterally over here? Yeah, see, laterally over here you will have an artery called as inferior epigastric artery. So inferior epigastric artery is what? It is a branch of what? It is a branch of external iliac. Look here, from external iliac you see an artery that is going up like this in this way. This is called as your inferior epigastric artery. Right, so this particular artery over here is called as your inferior epigastric artery. If you remember, we talked about inferior epigastric artery somewhere, a very important hematoma, if you remember, right? right? So let me show that to you over here. Yeah, you see, external iliac artery branches inferior epigastric artery. Once if this artery is ruptured within the rectus sheath, you will have a rectus sheath hematoma, I've told you, right? So this is your inferior epigastric artery over here. Okay, so this artery is inferior epigastric artery. Now you tell me here. Medially, what do you have? Lateral border of rectus abdominis. Laterally, what do you have? Inferior epigastric artery I have got. Inferiorly, what do you have? Inferiorly, I have got the, what is this? Medial half of inguinal ligament. So, medially, what do you have? You have got the lateral border of rectus abdominis, lateral border of rectus abdominis. Laterally, what do you have? You have got the inferior epigastric artery. Inferior epigastric artery. And inferiorly, what do you have? You have got the medial half of inguinal ligament. Medial half of your inguinal ligament over here. Okay, so you see this femoral ring over here, right? So why did I draw this femoral ring? Because this is the place where mostly femoral hernias happen. Mostly femoral hernias will take place over here. Now if you carefully look here also, you can see a very important triangle. Here also you can see a very important triangle. Now this triangle is having an anterior border, it is having a posterior border, it is having a medial border, it is having a lateral border. Okay, so what are these borders over here? So anteriorly you have got what? See, if you look over here, anteriorly you have got what? Inguinal ligament. You see, anteriorly you have got inguinal ligament. Okay, posteriorly what do you have? Posteriorly in the sense down, anteriorly in the sense up. Up, what do you have? Anteriorly inguinal ligament. Posteriorly, what do you have? You have got this ligament called as pectineal ligament. Medially, this is medial. Medially, what do you have got? Medially, you have got this lacunar ligament. And laterally, what do you have got? Laterally, you have got the external iliac vein. Okay, laterally, you have got the external iliac vein. So this is the place where your femoral ring is present. So if I ask you, what are the borders of femoral ring? What are the borders of your femoral ring? What will you tell? What are the borders of your femoral ring? Tell me. Anteriorly, I have got medial half of inguinal ligament. Just write it as inguinal ligament. Inguinal ligament. Posteriorly, what do I have got posteriorly? Posteriorly, I have got, yeah, what is this? This is called as your pectineal line. Posteriorly, I have got the pectineal ligament. Pectineal ligament. Medially, what do I have got? I have got the lacunar ligament. And laterally I have got the external iliac vein. Okay, so borders surrounding all of this, the center, because centrally it is consisting of femoral ring. So these are the borders of your femoral ring. Okay, these are the borders of your femoral ring, where most commonly the femoral hernias usually tend to appear. Okay. Now what we shall do is that we shall discuss about the inguinal hernia. So if you look at the inguinal hernia, hernias, usually there are different kinds of hernias, guys. Abdominal hernia, inguinal hernia, right? Umbilical hernia, femoral hernia and all. But usually these things will be studied in surgery anyways. But now I am telling you two important clinical points from surgery, that when it comes to inguinal hernia, we have got the direct hernia, we have got the indirect hernia. Direct and indirect hernia. So what is the difference between direct and indirect hernia is that, for example, just roughly I am drawing this thing, that let us say this part over here is your inguinal canal. Okay, let us say this is your inguinal canal, just a schematic diagram. Okay, inguinal canal, and you have got the testis inside. Let us say, just for an example, this is a testis like this. Okay, next let us say this is your abdominal wall. Behind the abdominal wall, here you have got your loops of intestine. Okay, so where were the rings over here? See, here the ring which you have over here is called as your superficial inguinal ring, and down over here you have got your deep inguinal ring. Okay, now this is seen in a normal patient. So what will happen over here is that, so this is a normal patient over here, right? Now for example, when it comes to direct inguinal hernia, first we shall discuss about direct. Now in case of direct inguinal hernia, if you can see here, the abdominal wall contents, okay, see the abdominal wall contents whatever are there, let us say here is your ring, okay, the abdominal wall contents, they are protruding down like this. You see how are the abdominal wall contents, they are protruding. This is how the abdominal wall contents are protruding inside. Okay, so let us say that all this is your abdominal wall contents here, but look here, all the abdominal wall contents in the sense, the intestines, the loops of intestine, you see how the loops of intestine are protruded inside. Now tell me, how did the loop of intestine come here? You see the intestine is herniating inside, okay, herniating inside. First it passes through deep and then through superficial, or in this case directly it is passing through the superficial. What is this ring? This ring is your deep inguinal ring. This is your superficial inguinal ring. Now tell me, the products are herniating, I mean the bowel loops are herniating through the superficial inguinal ring, or first to deep and then superficial? Directly it herniates through your superficial ring. You see, directly they are herniating through the superficial ring. Such kind of hernia, you call it as a direct inguinal hernia. What do you call them as? You call them as a direct inguinal hernia. And remember one thing, direct inguinal hernias, they always pass medial to inferior epigastric vessels. You see, inferior epigastric artery was there, inferior epigastric artery. So how does this direct hernia they pass? They pass medial to inferior epigastric artery. Now let us look at the indirect inguinal hernia. How does indirect inguinal hernia they pass? Okay, so let me put up a picture over here down. Now let us look at how indirect inguinal hernia will pass. So this is your deep inguinal ring over here. Okay, this is your deep inguinal ring and this is your superficial inguinal ring. Now look at how the contents are passing. Now look at this, that see, first contents are passing through the deep inguinal ring like this, they are passing through the deep inguinal ring, then these contents are passing through the superficial inguinal ring. Okay, first contents are passing through the deep inguinal ring, right, and then the contents are passing through the superficial inguinal ring like this. Deep inguinal ring first and then superficial inguinal ring later. This is your deep inguinal ring, superficial inguinal ring. Okay, and look at this important part. It is a direct or indirect? It is a indirect hernia. Why are you calling it as indirect hernia? Because they are not directly passing through superficial, they are first entering into deep and then superficial. Okay, now direct inguinal hernias, they are present where? They are present medial to the inferior epigastric artery. Now opposite to that, indirect, they are present lateral to inferior epigastric artery. Lateral to your inferior epigastric artery. So this is all you need to know, right? Apart from this, next important thing I want to tell you is teach you regarding the spermatic cord. Spermatic cord. What did I tell you? What are the contents of inguinal ligament I told? Yeah, first of all, tell me what are the contents of your inguinal canal? So inguinal canal in case of males, right, what it is containing? Spermatic cord. In case of females, it is containing round ligament of uterus. So before we discuss this, we shall discuss what are the contents of inguinal canal. What are the contents of inguinal canal? In case of males, you have got spermatic cord. In case of males, you have got the spermatic cord. In case of females, you have got the round ligament of uterus. Round ligament of uterus. Okay. Apart from that, the second important point is you have even got nerve. Two nerves are there. One is called as ilioinguinal nerve. ilioinguinal nerve, and third nerve is genital branch of genitofemoral nerve. Genital branch of genitofemoral nerve. Genitofemoral nerve. You have got genitofemoral nerve, and genitofemoral nerve is having two branches, genital branch and femoral branch. So that is the thing. Okay. Now whatever it is, now what we will do is that you have to know, first of all we will discuss about the spermatic cord and its contents. First of all, what is spermatic cord? What is spermatic cord? First thing, you know, spermatic cord is one of the content of your inguinal canal in the males, right? The next important point you have to tell is that what spermatic cord is nothing but it is the continuation of abdominal wall into the scrotum. Okay, how is spermatic cord formed? You see here in the abdomen we have got anterior abdominal muscles, external oblique, internal oblique, transverse abdominalis, fascia and all. These muscles, they continue down till the scrotum also, and as they are continuing down till the scrotum, they are forming the spermatic cord. Okay, so simple way to just draw it, a very rough picture. Okay, let us say this is the posterior side, this is on the back, this is on the front. So you have got external oblique muscle, you have got internal oblique muscle, you have got transverse abdominis muscle, you have got transverse fascia, all of this, right? So what is happening? All these structures are continuing down as scrotum. This is posterior, this is anterior. They are continuing down as your scrotum. Okay, so even what I am trying to tell you is that these layers are also continuing down into the scrotum. These layers are also continuing down into the scrotum. Okay, but what is this part over here? This part is what is called as your spermatic cord. What is this? This is your spermatic cord. Okay, all of them together they form in the form of a cord, and this is called as spermatic cord. So this is what spermatic cord is called as. So let us see what are the contents of spermatic cord. First of all, let us draw the picture. Okay, so let me draw the outermost structure over here. Spermatic cord is having three important layers. This is the outermost layer. Next layer is this one. Okay, this is the second important layer over here. After that we have got the third important layer. We have got three important layers. So we have got three important layers. After this we have got, so what are these layers? First of all, yeah, let me complete this up. What are these layers? See, first important thing is that, what did I tell you? What is spermatic cord? Spermatic cord is nothing but your abdominal muscles, they continue downward. They continue down, they extend down to the scrotum, and in between them the cord which is formed is called spermatic cord. For example, you know external oblique muscle within the abdomen. So if it is continuing down to the scrotum, in the scrotum also you will call it as external oblique muscle? No. You should call it as external spermatic fascia. So the outermost layer over here is external spermatic fascia. So external spermatic fascia was the continuation of what? External oblique muscle. Okay, so the external oblique muscle का aponeurosis जो है, that will be continued down as external spermatic fascia. For example, let us say this red color one over here is called as cremasteric fascia. What is cremasteric fascia in the abdomen? In the abdomen, this cremasteric fascia, was your internal oblique muscle. So internal oblique muscle in the abdomen continued down, right, as cremasteric fascia, and the name changed as cremasteric fascia. In the same way, what is this green color one? This is called as internal spermatic fascia. When you have external spermatic fascia, you will also have internal spermatic fascia. Then internal spermatic fascia was the continuation of what? Transversalis fascia. Internal spermatic fascia was a continuation of your transversalis fascia. Okay, so you have got external spermatic fascia, you have got cremasteric fascia, you have got internal spermatic fascia. So external spermatic fascia was a continuation of external oblique aponeurosis. This was internal oblique muscle and transversalis fascia over here. Clear, all of you? Now let us look at the contents. Now when it comes to the contents, the artery that is present in the center over here is called testicular artery. Surrounding this testicular artery, you have got a plexus here, group of veins together. These group of veins together, they form a plexus called as pampiniform plexus. What is this? Pampiniform plexus. Below that, you have got another important structure called, this is a remaining part of what? Processus vaginalis. The processus vaginalis did not obliterate completely, did not disappear completely. There is a little bit remaining part there. That remaining part is called as remnant of processus vaginalis. Okay, so let us finish up these parts. What are these? What is this called as? This is called as pampiniform plexus. Pampiniform plexus. And what is this artery over here? This is called as testicular artery. What is this called? Testicular artery. Next, what is this part over here called as? This is called as remnant. Remnant of what? Processus vaginalis. Remnant of processus vaginalis over here. Next, back here if you see, you have got a duct over here. This is called as a ductus deferens. What is this called? This is called as a ductus deferens. This is called ductus deferens. Just side to the ductus deferens, you have got a small artery. This is, what is this artery over here called? Artery to ductus deferens. This artery over here is called as artery to ductus deferens. Artery to ductus deferens. So this is artery to ductus deferens over here. Next important thing is that here you have got another important artery over here. What is this particular artery called as? What is this particular nerve called as? As I already told you, one of the content here we have got is a genital branch of genitofemoral nerve. So this is genital branch genitofemoral nerve. And lastly, between the cremasteric fascia and internal spermatic fascia, we have got an artery. In the same way, we even have got a vein. What is this artery and vein that is located over here? This artery and vein here is called as cremasteric vessels. This is called as cremasteric vessels. These are called as cremasteric vessels over here. So these are some of the contents of spermatic cord, but whatever it is, we shall write down in detail what are the contents of spermatic cord. So basically, these are some of the contents which I have written, but in detailed, let me write down what are the actual contents over here. We have got three structures. 3 arteries we have got, 3 nerves we have got, 3 structures we have got. So what are the 3 arteries? What are the 3 arteries which we have got? So one artery, what is the artery over here? See, cremasteric vessels, in the sense we have got cremasteric artery. Cremasteric artery. Tell me, what is the second artery? Artery to ductus deferens. So you called as ductus deferens artery. Ductus deferens artery. And what is the third artery over here? Where did we write another artery? Yeah, testicular artery. Third artery was your testicular artery. So that was your testicular artery. Third artery was your testicular artery. Okay, right. Now 3 arteries are finished. Now after that we discussed about 3 nerves. Okay, so 3 arteries and 3 nerves are there. So what are the 3 important nerves over here? First nerve is genital branch of genitofemoral nerve. So first nerve over here is genital branch of genitofemoral nerve. Next nerve, what is the next nerve over here? Yes, what is the next nerve over here? We did not write any other nerves. Yes, but there is another nerve called as cremasteric nerve. As there was cremasteric artery, we will also have cremasteric nerve. Okay, and finally we have got sympathetic fibers. Sympathetic nerve fibers. We have got sympathetic nerve fibers. Okay, next, what are the 3 structures which we have got? What are the 3 structures which we have got over here. What is the first structure which we have got? We have got a structure called ductus deferens. Ductus deferens. Right? What is the next structure which we have got? We have got pampiniform plexus. Pampiniform plexus. And finally, what is the structure we have got? Lymphatic vessels. Lymphatic vessels. So these are the three important structures which are located over here. So we have got three arteries, three nerves, and three important structures here within this particular spermatic cord which you have to know. Next important thing is that you have to remember this thing. What is this thing? What are the structures in the abdomen that are continuing down into the scrotum, right? So just remember three. I will also tell you in detail later on, but for now what you need to know, three important structures. Remember it as tie turns to ice. Tie turns to ice. Just remember this. What do you mean by T? T stands for transversalis fascia. Transversalis fascia. T stands for transversalis fascia. I stands for internal oblique muscle. Internal oblique muscle. Okay. E stands for external oblique muscle. External oblique muscle. So T stands for transversalis fascia, I stands for internal oblique muscle, E stands for external oblique muscle. Now ties turns to ICE, eyes. I stands for internal spermatic fascia. Internal spermatic fascia. Right, next I over here turns to C. C stands for cremasteric fascia. Cremasteric fascia. Right, next E, cremasteric muscle and fascia. Okay, muscle and fascia, remember this. And E stands for external spermatic fascia. External spermatic fascia. It turns into external spermatic fascia over here. So these are some of the very important structures which you need to understand over here. Okay. Now completely right from the skin, we will see what structures in the abdomen are converting into the structures into the scrotum. Okay, we shall see completely all the structures now itself. So let us now itself discuss about what are the structures in the abdomen. What are the structures in the abdomen are converting into the structures in the scrotum. Okay, what are the structures in the abdomen converting into the structures in the scrotum? First important thing, in the abdomen we have, first of all let us write down the layers of abdomen. We have got skin. After skin, what is the layer? That is your superficial fascia. We have got the superficial fascia. After superficial, within the superficial fascia there are two other fascias which we have got. One is called as the camper fascia. Camper fascia. Another one is called as a scarpa's fascia. Camper fascia and scarpa's fascia. Next, after that we have got deep fascia. We have got a deep fascia. After deep fascia, what do we have got? We have got external oblique muscle. Okay. Next we have got internal oblique muscle. Next we have got transverse abdominalis muscle. After that we have got transversalis fascia. Transversalis fascia. Transverse abdominis muscle, transversalis fascia. And next we have got the parietal peritoneum. Parietal peritoneum. Okay, now let us write down these structures. Okay, so let us say skin over here. Skin is converted to what? Skin is converted to skin of scrotum. Skin in the abdomen is converted to skin of your scrotum. Both the camphor fascia and scarpa's fascia together they are converted to dartus muscle. This is the muscle which is present in your scrotum. Next, the deep fascia is converted to the deep fascia of your scrotum. Deep fascia of your scrotum. External oblique muscle. Now, this is the place where you need to know. Eyes, I told you, tie turns to eyes, okay? So, external oblique muscle will convert into external spermatic fascia. We discussed this before. With a mnemonic, tie turns to eyes. Internal oblique muscle. Internal oblique muscle will turn to cremasteric fascia. Cremasteric fascia. Transverse abdominalis will not convert to anything, and transversalis fascia will convert to internal spermatic fascia. Internal spermatic fascia. And finally, we have got the parietal peritoneum, which is not converting into anything. Okay, so these are the structures that are present. These are the layers of the scrotum. If I ask you what is the outermost layer of the scrotum, skin, right? And what is the innermost layer over here, you have to tell it as internal spermatic fascia. Okay, now let us see regarding the inguinal canal. Regarding this inguinal canal, let us see what is the anterior wall, posterior wall, roof and floor formed by. Anterior wall of inguinal canal, posterior wall of inguinal canal, the roof of inguinal canal and the floor of inguinal canal. So what are they formed by? Now how do you know is that? So if you are making a section like this, right, a sagittal section, in the sagittal section you will come across few muscles. Okay, so what are these muscles is that in the front, anterior to abdomen, you have got skin. After skin, let us say what is the structure muscles you have got? First you have got the skin, superficial fascia, deep fascia, and what is the next important muscle? External oblique. Okay, so let me draw that external oblique over here. See, this muscle over here is your external oblique muscle located exactly in the front. After external oblique, what is the next muscle you have got? Internal oblique muscle. So just behind external oblique, I have got internal oblique muscle like this. After internal oblique muscle, what do you have got? Transverse abdominis muscle. What is this? You have got transverse abdominis muscle. So this is your transverse abdominis muscle. Behind that, what is that? Fascia, right? So this is your transversalis fascia like this, transversalis fascia. Now, where is your inguinal ligament? First of all, you have to know where is your inguinal ligament. So to locate this inguinal ligament, let me write down the names of this muscle. External oblique muscle, internal oblique muscle, transverse abdominalis, transversalis fascia. What did I tell you? I told you that if this is external oblique muscle, the aponeuros of external oblique muscle will completely turn like this, right? It will make a loop. This is called inguinal ligament, which means if this is external oblique, the lower portion of this particular external oblique muscle is making a loop like this. You see, it is turning like this. It is making a loop and forming a ligament over here. This ligament is called as inguinal ligament. Inguinal ligament. So this ligament over here is called as inguinal ligament. Once the ligament is formed, inside you see a canal. So where is that canal here? This is the canal. This canal is called inguinal canal. Contents of inguinal canal I already told you. One of the content in the male here is we have got spermatic cord. This is your spermatic cord. This is your spermatic cord over here. Now tell me, what are the walls over here? Anterior wall formed by, anterior wall of what? Inguinal canal. Anterior wall of inguinal canal is formed by external oblique muscle. Posterior wall is formed by transversalis fascia. Roof is formed by internal oblique and transverse abdominis muscle. Floor is formed by what? Inguinal ligament. Easy, right? So anterior wall is formed by what? Anterior wall is formed by external oblique aponeurosis, not muscle, aponeurosis. Okay. Posterior wall is formed by fascia transversalis. Roof is formed by internal oblique muscle and transverse abdominis muscle, right? And here floor we have got the inguinal ligament. Inguinal ligament. It is formed by the inguinal ligament over here. Okay, so these are some of the important things which you need to know regarding the inguinal region. So now we shall be discussing regarding the liver. Okay. Now coming to the liver over here, what are the important things which you should know regarding the liver? I will discuss now. First important thing is that if you look at the liver over here, this is the structure of the liver, and you know that the liver is located in the right hypochondric, right, little bit in the right lumbar and the epigastric region. So here there are two important notches which you can see within the liver over here. Okay. So what is the name of this notch and what is the name of this notch over here? So if you look at the first notch, behind this notch on the posterior side, you have got a structure called as gallbladder. So that is the reason why this notch here is called as cystic notch. What is this? This is called as cystic notch. Okay. Next important notch over here is the notch for a ligament called ligamentum teres. This is a notch for ligamentum teres. This is a notch for ligamentum teres. So you have got two notches, cystic notch, another one is notch for ligamentum teres. Now how do you divide the liver basically? For example, let us say this is a cystic notch, notch for ligamentum teres, and let me draw two pictures over here, and you know one very important thing, that let us say here you have got inferior vena cava. What is this? This is your inferior IVC, inferior vena cava. Okay, and this is the place where your gallbladder was present, right? This is a cystic notch. This is your cystic notch where your gallbladder is present. And next important thing is that here I told there is a ligament, right? What is this ligament? This is the ligament teres, right? This is a notch for ligamentum teres, right? Notch for ligamentum teres. Now how do you divide the liver? Basically liver is divided into lobes, right? Basically how many lobes we have got? We have got two lobes. From the anterior aspect you can see that the liver is divided into two lobes. So but in surgery, in anatomy, how the liver is divided I will tell you, but surgery point of view also I will tell you, so that when you study the surgery it would be easy for you. Okay, so you know this is your gallbladder. Now what I am telling you is draw a line that is imaginary touching the inferior vena cava to gallbladder. Now this particular line which I made you to draw here, this is called as Cantlier's line. This line over here is called what? This is called as your Cantlier's line. So with the help of this Cantlier's line, we are dividing the liver into two lobes. What are these two lobes over here? This is called as the right lobe of the liver. This is called as the left lobe of the liver. In the same way, based upon the ligamentum teres, you divide the liver into right lobe of the liver, you divide it into the left lobe of the liver. Okay, so what are these two divisions over here? This is called as a surgical division of the liver, surgical division of the liver, and this division over here is called as an anatomical division of the liver. So we have got two important divisions, one is called surgical division, another one is called as anatomical division. So surgically, why do you divide the liver? Because you have to do the liver transplantation. So out of right and left, which one you give here? R is for recipient, who wanted to receive. The left lobe is left with the donor. Okay. So for example, if I am giving the liver, my left lobe is left with me, the left lobe is left with the donor, I am the donor. Okay. Left lobe is left with the donor, right lobe is for the recipient. So what we do is that the right lobe is given to the recipient, and the left lobe is left with the donor, Okay, this is the important thing. So this is how anatomically and surgically you will divide the liver. Now if you turn the liver back on the posterior side, how does the liver look? So this is how the liver looks on the posterior side. This is the liver, how it is looking on the posterior side. Now what are these spaces over here? So here there is a ligament called ligamentum venosum. Okay, so here you have got a ligament and this is called as ligamentum venosum. Okay, in the same way you have got another ligament down over here. What is this? This is called as ligamentum teres, which I have already told you, right? So this is your ligamentum teres. This is the ligamentum teres. right? Ligamentum teres, which I have already told you over here, ligamentum teres. Okay. In the same way, you have got another important thing over here, that here you have got, what is this? This is called as your inferior vena cava. So this is your inferior vena cava, IVC. Okay. So this is your IVC, inferior vena cava. In the same way, what did I tell you? Posteriorly you have got the gallbladder, right? So here we have got the gallbladder like this. So this is your gallbladder posteriorly located. Now if you look here, between inferior vena cava and ligamentum venosum, right? Between inferior vena cava and ligamentum venosum, you see a bare area over here. You see an area that is located between ligamentum venosum and inferior vena cava. This is nothing but called as a caudate lobe of the liver. Okay, this is nothing but called as the caudate lobe of the liver. This is called as a caudate lobe of the liver. In the same way, you can also appreciate one more lobe over here. Where is this lobe located? This is the lobe that is located between the gallbladder as well as the ligamentum teres. So this lobe that is located between the gallbladder and ligamentum teres is called as the quadrate lobe of the liver. So here we have got two important lobes. One is called as a caudate lobe of the liver, another one is called as a quadrate lobe of the liver. So the upper one is called as a caudate lobe and the lower one is called as a quadrate lobe. Okay, and this is the important thing which you need to know. We have anteriorly we can see the right and left lobe, but posteriorly we can see the caudate lobe and quadrate lobe. You have to know caudate lobe is sandwiched between inferior vena cava and ligamentum venosum. In the same way, quadrate lobe is sandwiched between ligamentum teres and gallbladder. Okay, now let us look at the veins over here. Okay, what are the different kinds of veins which we have over here? So if you look at the veins of the liver over here, now you can see that this is your inferior vena cava. Okay, so what are the veins that are draining into inferior vena cava? So one is you have got a vein over here. This is called as your right hepatic vein. What is this? This is called as your right hepatic vein. After that, you have got another hepatic vein over here. This is called as a middle hepatic vein. And next you have got another hepatic vein over here. This is called as a left hepatic vein. You have got the right hepatic vein, middle hepatic vein and left hepatic vein. In the same way, here you have got a very important vein over here. This is called as a portal vein. Okay, so what is this particular vein over here? This is called as your portal vein. Now portal vein is divided into two other veins over here. What are these? One is called as the right half of the portal vein and the left half of the portal vein, right and left branches. Okay, so this is a portal vein dividing into two veins over here. Okay, so this portal vein is dividing into right and left portal vein over here. So okay, let me write these things down over here. So this is your hepatic vein. These are your hepatic veins. Okay, out of these hepatic veins, this is called as your right hepatic vein, right? This is called as your middle hepatic vein, and this is called as your left hepatic vein, and this is called as your portal vein. So with the help of these hepatic veins, you have divided the liver completely into 8 segments over here. So what are these segments? And all the time remember, segments have to be numbered in the clockwise direction. Okay, so this is called as the first segment of the liver. This is called as the second segment of the liver, right? And let me rub this part down over here little bit. Let me draw it a little bit more broader, like this. So this part over here is called as the third segment of the liver. This is your third segment. And here we have got the fourth segment of the liver. Here we have got the fifth segment of the liver. This is your sixth segment of the liver. This is your seventh, and this is your eighth. You see, all the segments I have drawn here, 1, 2, 3, 4, 5, 6, 7, 8 in the clockwise direction. Now we have to see which segment drains into which lobe, which segment drains into which vein. For example, let us, for example, look here, segment number 5, 6, 7 and 8. It means, it means this one. 5, 6, 7 and 8. Tell me which vein is near to this 5, 6, 7 and 8. between 5, 6, 7 and 8 there is a right hepatic vein. So all of them, they drain the blood into this right hepatic vein. So 5, 6, 7, 8 they drain into what? Right hepatic vein. Right hepatic vein. Next important thing is that segment 2, segment 3 and segment 4, where do they drain their blood into? They three drain the blood into the left hepatic vein. Left hepatic vein. Okay, so segment 2, segment 3 and segment 4, they drain into what? Left hepatic vein. Okay, now segment 4, right? Segment 4, segment 5 and segment 8, again they drain into blood where? They drain into your middle hepatic vein. Middle hepatic vein. Okay, they drain into middle hepatic vein. Segment 4, 5 and 8, they drain into middle hepatic vein. Then you did not tell about segment 1. Segment 1 will drain the blood directly into your inferior vena cava. Okay, so remember one thing, that segment 1 will directly drain the blood into inferior vena cava. So this is how the segments, they drain their blood into their respective veins. Now why am I telling about this? Why am I telling is that, for example, let us say the right hepatic vein has been thrombosed. There is a thrombosis of right hepatic vein. Now tell me, will the segment 5, 6, 7, 8, will it be able to drain the blood into right hepatic vein? Yes, but after draining, can the blood pass into the inferior vena cava? No. In the same way, if there is thrombosis of the left hepatic vein, okay, now tell me from which segments the blood is not getting into the hepatic vein? So 2, 3 and 4. If there is thrombosis of the middle hepatic vein, then which segments will suffer? That is 4, 5 and 8, right? But this condition is called as hepatic vein thrombosis. So in case of hepatic veins thrombosis, for example, if the patient is having thrombosis of all the veins, or let us say exactly the place where all of them are draining, this place is having a obstruction, it is having an embolus over here. Okay, so because of this hepatic vein thrombosis, right, all the segments will suffer, yes or no, except segment 1. Why? Because segment 1 is directly draining into inferior vena cava. Okay, so this condition where all segments, okay, where all segments are involved, all segments are involved in hepatic vein thrombosis except segment 1, right? Why? Because segment 1 drains into inferior vena cava. This condition, pathological condition, you called as Budd-Chiari syndrome. So the question they will be asking you is that in Budd-Chiari syndrome, which lobe or which segment is spared? That is segment number 1 is spared. Why it is spared? Because it directly drains the blood not into the hepatic veins, rather into your what? Into your inferior vena cava. Now one very important point from physiology, I just want to share it with you, that let us say this is your liver over here. This is your esophagus, right? This is your esophagus over here. Next you have your stomach, jejunum, ileum and so on. Okay, right. Now next important thing is that from the esophagus also you have got veins. From the stomach, duodenum, you have got veins like this, right? So what is going to happen? All these veins, you see, all these veins collectively they join together. All these veins collectively they join together and they drain into what? They drain into your liver. They drain into your liver. Okay, they drain into your liver. All these segments together they drain into your liver. So here we have got, what are the veins we have got? We have got esophageal veins, we have got gastric veins, we have got duodenal veins, ileal veins, jejunal veins, all the different types of veins are there. Now normally what happens? Normally what happens is that whenever you are taking any kind of food, right, that food gets digested within your stomach, small intestine here. After digesting, what is happening? The digested materials, whatever are there, they are mixed with the blood, right, and they enter into these portal veins. So this digested food materials, the nutrients, the amino acids, the nutrients, all kind of minerals which are derived out of that, all kind of toxins, all of them, they enter into the blood of your portal vein. So from here all these material they will go to the liver. And what will the liver do? Liver will check whether whatever this person has eaten or whatever this person has drank within this food, whether there are any kind of let us say toxic materials or not. If there are any toxic materials, what your hepatocytes are going to do is that these hepatocytes are going to detoxify them. Okay, they are going to detoxify this. For example, if you are drinking alcohol daily, alcohol is a toxic material. So alcohol will be directly absorbed into your blood. So obviously they will be entering into your portal vein. So this absorbed alcohol will enter into your liver. And what hepatocytes are doing? Hepatocytes are detoxifying this alcohol. It means they are converting the alcohol into water. And that is the reason why you pee while you are drinking the alcohol. So what is happening over here? If you are drinking the alcohol daily, then what will happen after 10 years, 20 years? Slowly these hepatocytes will lose their function. Hepatocytes can no more detoxify. Why? Because the hepatocytes are tired, they are already dead. So what is happening now? Again, when you drink alcohol, all the waste material, whatever is there, this waste material starts entering through the blood into your liver. But can liver detoxify now? Liver cannot detoxify. So in that case, what is going to happen? Tomorrow you'll drink, day after tomorrow you'll drink, every day you're drinking for 1-2 years. Slowly the waste material is getting, the toxic material is getting deposited within the liver. And finally, this liver will turn into a cirrhotic liver. So patient is going to have liver cirrhosis. Patient is going to have liver cirrhosis. Okay. Now, when patient will have liver cirrhosis, remember one thing, these esophageal veins, jejunal veins, gastric veins, do they know that the liver is not in a good condition? No. Do your stomach and all know? No. So what is happening once if the liver cirrhosis has occurred? Still, you keep drinking alcohol and alcohol starts entering into your bloodstream. From there, this alcohol starts entering into your liver. But now liver is in a state of taking the blood? No. So what will liver do? Liver will push the blood back. Okay. And where is the blood going to stay? The blood is going to stay within your portal vein. Again you drink, again the blood comes like this, right? Again the liver is pushing the blood back. So again the blood stays over here. So there is only input channel is working, but output is not working, right? So why output? Who is the main mediator of output? That is your liver. The gates of the liver are closed. So whatever alcohol you are drinking, it keeps on accumulating within your veins. So when it keeps on accumulating within your veins, now tell me, within this portal vein, the pressure is increased or decreased? The pressure is increased. So that increased pressure within the portal vein is called as portal hypertension. Is called as portal hypertension. Second important thing what can happen? Second important thing what can happen is that if you see here, don't you think the veins will, the size of the veins will still remain the same, or the veins will be dilated abnormally like this? You see, the veins will be dilated abnormally. Why? Because there is a pool of toxic materials, a pool of fluid that has been accumulated. There is a pool of blood that has been accumulated here. Blood with high toxic materials have been accumulated. Don't you think even the veins of the esophagus are also dilated? So if the veins of the esophagus are also dilated, this condition you call it as esophageal varices. Esophageal varices. So don't you think within the esophageal veins also there is excess amount of blood with excess amount of pressure? Yes. So once if there is excess amount of pressure within these esophageal veins, don't you think that with the high pressure these veins might rupture? Once this esophageal varices will rupture, don't you think the patient will vomit the blood out, right? So patient is also going to have hemoptysis. Hemoptysis is because of rupture of esophageal varices. Not only that, let us say this is this entire abdomen like this, right? These are his legs, let us say. Okay. Now because of excess fluid here, don't you think the fluid escapes? The fluid escapes into the abdominal cavity. Why is the fluid escaping into the abdominal cavity? Normally the lining the blood vessel, the cells whatever are there, they're tightly attached to each other. Because of high pressure, when the cell wall is stretching, when the blood vessel is stretching like this, what will happen? The blood vessel stretches like this. As it is stretching, you see gaps in between here. Through these gaps, the fluid starts escaping out. So where it will escape? The fluid starts escaping out into the peritoneal cavity. Okay. So as the fluid starts escaping into the peritoneal cavity, patient will have a very big tummy. That is called as ascites. That is called as ascites. And fifth important thing is that, as I already told you, the veins are dilated. The veins on the abdomen are also dilated. That condition you call it as caput medusae. That condition you call it as caput medusae. Okay. So whenever a patient is having liver cirrhosis, when you look at during the liver transplantation, when you remove the liver and see, right, you can see many micro nodules on the liver. Small nodules will be there, and there will also be macro nodules also. Micro and macro nodular appearance. Micro and macro nodular appearance is characteristic for your liver cirrhosis. Okay, so this is some of the important things you need to see. Now let us look at the scans over here. See, this scan is a normal scan. This is a normal scan with a good texture of the liver like this. Okay, now look at this. Again, this is also a normal scan with a good texture of the liver. Right, now look at this scan. Is the texture normal? No. There are bumpy elevations on this. You see these bumpy elevations, it means micro and macro nodular appearance is seen. So this is a normal level, this is a healthy, this is a cirrhotic liver. So in the healthy liver, you can see that it is completely fine, right, smooth. But on the cirrhotic liver, you can see a macro nodule, you can see micro nodules. You see these are micro nodules over here, right? You can see macro nodules over here, micro nodules. So micro and macro nodular appearance is seen in what? You see it in case of liver cirrhosis. Okay. As I told you, ascites. So this is a condition of ascites, where there is excess amount of fluid that is accumulated over here. And next, what did I tell you? I told you veins of the abdomen are also enlarged. So this enlargement of veins over here is called as your caput medusae. Caput medusae. Right? So this is another picture of your ascites over here. Okay. Now another important reason for ascites I can tell you. Another important reason for ascites I can tell you that, for example, this is your blood vessel. Okay, this is your blood vessel. Let us say that these are your endothelial cells. These are your endothelial cells generally. Okay, these are your endothelial cells generally. Okay, okay, let me remove the endothelial cells. Let us say these are your blood vessels. Now, within your body, you have got proteins. You know, we have got albumins. So, there are proteins. So, these are all the albumins that are located over here. Now, who is releasing these albumins? From where are these albumins released? These albumins are released from the liver into the bloodstream. Now, there is excess amount of blood here, fluid. Let us call it as fluid, right? Now, do you think can this fluid escape outside? No chance. Why? Because all these albumins, all these proteins here, they are acting as a barrier. They are not letting, see, fluid wanted to escape out. Fluid wanted to escape out, but these proteins are pushing the fluid back. So it cannot escape out. Now what will happen is that, for example, if the patient liver is completely damaged, do you think liver is going to release albumins over here? No. The level of albumins will be decreased. When the level of albumins will be decreased, now tell me, don't you think the number of albumins over here are very, very few? As the albumins are very few, don't you see the gaps in between? Don't you think that through these gaps you see excess amount of fluid, it can go out? You see, excess amount of fluid can go out, and this fluid can accumulate in the interstitial space, and this can lead to what? Edema. Okay, so that is what is contributing for your ascites. Okay, this is another contribution for your ascites. So this will be taught in physiology anyways, but I have to teach it to you here, so I have taught you. So now let us focus on the next important thing, that is the ligaments of the liver. Now this is a picture which I have kept for you, but anyways I am going to draw another image here coming to the ligaments of the liver. So let us say this is your stomach. Okay, let me draw this directly. So this is your liver over here. You know that here you have got a ligament. Okay, so what was that ligament over here? This ligament which you got over here is called as your ligamentum teres. Okay, ligamentum teres. Now in the center of this ligamentum teres there is another ligament over here. What is this? This is called as your falciform ligament. Falciform ligament. And what is this ligament? Ligamentum teres. Ligamentum teres. Okay. Next, on the top here you have like a crown. On the top you have got a ligament. This is called as coronary ligament. This ligament is called coronary ligament. Okay. On the right and left side of the coronary ligament, there is a condensation of this ligament in the form of a triangular shape. You see? So these are called as right and left triangular ligament. This is called as a left triangular ligament. Okay, and this is called as your right triangular ligament. So we have got two triangular ligaments, right and left triangular ligaments. Let us look at the ligaments here. So what is the ligament in the center over here? Just now I taught you, falciform ligament. Okay, and what is this? This is called as ligamentum teres, or you can call it as round ligament of liver. Ligamentum teres or round ligament of liver. Next, on the top like a crown, what is this? Coronary. This entire thing is coronary. On the edges of coronary, what is this? Right triangular ligament, left triangular ligament. Okay, so these are the important ligaments which you need to understand over here. Okay, next I have also taught you on the back side we have got ligamentum venosum, right? So now after discussing this part of the liver, now we shall be discussing two very important triangles over here, guys. So before we discuss those triangles, first of all you have to know what are these structures over here. You know that this is a right hepatic duct, left hepatic duct, and this is your cystic duct over here. Okay. Now remember this thing, right and left hepatic duct join together to form this particular duct over here. This is called as common hepatic duct. Okay. Common hepatic duct and cystic duct join together to form. This is called as common bile duct. What is this? Common bile duct. Now here actually you can appreciate a triangle over here, right? So this particular triangle over here is called as a hepatocystic triangle. So if you look at the borders of hepatocystic triangle, see this is called as a superior border. Okay, what is this? This is called as a superior border. Okay, next this border is called as a lateral border, and this border over here is called as a medial border. So what are the different borders we have got over here? We have got one is called as a superior border. Here we have got the lateral border, and here we have got the medial border. So what is the superior border made up of? Superior border is made up of the inferior margin of your liver or inferior surface of your liver. Lateral border is made up of what? It is made up of your cystic duct. Okay, and neck of the gallbladder. Medial border is made up of what? Medially what do we have? You have got your common hepatic duct. So these are the three important borders. So let us write down these borders over here. So what are the three important borders? Superiorly you have got the inferior surface of liver. Inferior surface of the liver. Laterally, what do you have laterally? Laterally you have got is the cystic duct. Laterally you have got the cystic duct and the neck of gallbladder. Neck of the gallbladder. Medially you have got what? Common hepatic duct. Medially you have got common hepatic duct. Okay. So these are the things. Now let us again write down the structures over here for the revision purpose. This is your right hepatic duct. This is your left hepatic duct. This is your gallbladder, and this is your cystic duct. Okay. Now this artery over here is called as the left hepatic artery. Okay. This is your left hepatic artery. Here you have got is a right hepatic artery. Okay. Now right hepatic artery has got a branch. This branch is called as your cystic artery. Cystic artery over here. Now here you can also see one more triangle over here. You see there is one more triangle over here. So what is this triangle over here? This is called as Calote's triangle. Okay, so Calote's triangle is having what? So it is having a superior border over here. Okay, it is having a lateral as well as a medial border. This is the medial border and this is the lateral border over here. Okay, so superiorly what do you have? Superiorly you have got the cystic artery. Okay, laterally you have got the cystic duct, and medially you have got, what is this duct over here? What is this? This is called as your common hepatic duct. Okay, so this duct over here is called as your common hepatic duct. So it has got a superior border, it has got a lateral border, it has got a medial border. Okay, lateral and medial border. So superior border is consisting of what? It is consisting of cystic artery. Lateral border is consisting of cystic duct. Medial border is consisting of common hepatic duct. Common hepatic duct. These are the important things. So this triangle over here is called as the Kellogg's triangle. This triangle over here is called as what? This is called as your Kellogg's triangle. Okay. Whenever a patient is having cholecystitis, you have to remove the gallbladder. So in that case, you, instead of preferring for the open surgery, you do a laparoscopic surgery. So for that, for laparoscopic cholecystectomy, you choose a specific triangle over here called as your Kellogg's triangle. Okay, so this is a Kellogg's triangle which you use. And by the way, what is the name of this triangle? This is your hepatocystic triangle. Hepatocystic triangle. Okay, so these are the two important triangles which you need to understand over here. So now we shall be talking another important thing over here, that is regarding the ureters. Anatomy of ureters. So ureters are nothing but the transport channels. Okay, so they transport the urine from the kidney to the bladder. So they transport urine from kidney all the way to the bladder. Okay, so if you look at the length of this ureters are around 25 centimeter in length. Okay, so first of all, we have to look where does the ureter start and where does this particular structure end. Okay, so as I already told you, ureters start all the way from the pelvis, I mean from the kidney to the bladder. So exactly where, let us say that this is your right kidney. This is your right kidney over here, and let us say this is your left kidney over here, right hand left kidney. Okay, so where are the ureters? So these are the ureters. So this is one ureter over here and this is an other ureter over here. So what did I tell you? Ureters are draining into your urinary bladder. Okay, so let us say that this is your urinary bladder over here. This is your urinary bladder over here. Now within this urinary bladder, you have got a triangular area like this. This triangular area over here is called as trigone of the urinary bladder. And now what will happen? This urinary bladder will continue down as your urethra. All of you know that. Okay, so this urinary bladder will continue down as urethra. Okay, and remember one thing, on either side you have got what? You have got an almond shaped structure. This is what is called as your prostate gland. Okay, now these are your ureters, right and left ureter. Now what is happening? Let us draw these structures over here so that you'll understand better. So this right ureter is draining, and where this right ureter is opening, this right ureter is opening with the help of an opening over here. This is called ureter orifice. So where is the ureter orifice located? Near the trigone. Okay, so as I already told you, so this part over here is called as your trigone. In the same way, on other side also you have got a trigone like this. Okay, you have got what? You have got a trigone like this. Clear? And this is the urethra, as usually you know, right? So this is what I was telling you, that it starts all the way from the kidney. Now in the kidney, exactly where? This part of the kidney over here is called as your renal pelvis. So it starts all the way from the renal pelvis down till here. What is this, by the way? This is called as your trigone of the urinary bladder. Trigone of urinary bladder. Okay, and these openings over here are called as ureteric orifice. Ureteric orifice. These openings are called as ureteric orifice. Okay, and note not to worry that this is your urethra and this is your prostate. This is your prostate gland. Now important thing you need to understand over here is that this particular ureter, whatever is there, ureter is basically divided into two different parts. Okay, so one is called as abdominal part of the ureter, another one is called as the pelvic part of the ureter. Now what do you mean by abdominal and pelvic part? So you know that this is one half of the pelvic bone, And now what I'm doing is that, let me draw an artery over here. This is called as the abdominal aorta. Abdominal aorta will divide into two common, what is this? Common iliac arteries. One is called as the right common iliac, another one is called as the left common iliac. Let us say the right common iliac is dividing into external iliac, and down here is internal iliac. Okay, so what is this particular artery over here? Common iliac artery. Okay, next important thing is that, where is the urinary bladder located? So this is a picture you are looking from the side. Okay, so let us say this is the place where your urinary bladder is located. This is the place where your urinary bladder is located. And all of you know that this is your ureter, like this. Okay, this is your ureter, that is draining the urine into your urinary bladder. Okay, now what are the different parts of the ureter? Ureter has got two important parts. What are those two important parts? As I told you, abdominal part and pelvic part. Abdominal part in the sense all the way from the renal pelvis. Now when I tell renal pelvis, again don't confuse, let us say this part over here is your renal pelvis. You see this part over here is called as a renal pelvis. All the way from the renal pelvis, till this part. Which part? The place where the bifurcation of the common iliac artery is happening. Okay, you see, this is called as your common iliac artery. Common iliac artery is dividing into what? External iliac and internal iliac. The place where this common iliac artery is dividing, till here is called as the abdominal part. Now from the bifurcation of common iliac artery all the way till the base of the urinary bladder, you see this is called as a base of the urinary bladder. Till there you call it as a pelvic part. Okay, so let me write down here, this is called as the abdominal part, and this is called as the pelvic part. So we have to write it completely, that ureter is divided into two parts. Okay, what are the two parts? One is called as the abdominal part of the ureter. Another one over here is called as the pelvic part of the ureter. Abdominal part and pelvic part. Abdominal part in the sense all the way from the renal pelvis, till the bifurcation of common iliac artery. Okay, not this, yeah, this is common iliac artery. Okay, bifurcation of common iliac artery. When I tell pelvic part, from the bifurcation of common iliac artery till the base of urinary bladder, till here you call it as a pelvic part. Okay, pelvic part. Now let us see what are the anterior relations and posterior relations of the right ureter as well as the left ureter. Now look at this particular picture over here. Now in this picture you will completely understand what are the anterior relations and posterior relations of both your right and left ureter over here. This is your right kidney, you know that, right? Now I am going to draw one part. So this part over here which I am drawing right now, what is this? This is called as your duodenum. Okay, what is this? This is called as your duodenum. So this is your duodenum. Now exactly speaking, which part of the duodenum is crossing? See, this is called as the first part of the duodenum. This is called as the second part of the duodenum, and this is called as a third part and the fourth part of the duodenum. So exactly speaking, the second part of the duodenum is crossing the anterior. I mean, anteriorly it is passing over the ureters. So that is why I am calling it as anterior relation. So first important thing that is forming the anterior relations of your right ureter. So this is your right ureter. This is your right ureter. This is your left ureter. Okay, right now we are discussing about the anterior relations of both the right ureter as well as the left ureter. So coming on to the right ureter, the first important thing is second part of duodenum. Okay, next important thing is that there is a vessel, right? There is a blood vessel over here. This is called as a right gonadal artery, right? So simply write it as right gonadal vessels. When I tell right gonadal vessels, it means it is the artery as well as vein, both of them. Okay, so here the second part we have got is the right gonadal vessels. Also they pass above the right part of the ureter. Next important thing is that, for example, if I am drawing this as a cecum and down is appendix, okay, what is this? This is called as your which part of the colon? This is your ascending colon. If you remember from the lecture which I taught on superior mesenteric artery, there I told you that the right side of the colon completely it is supplied by superior mesenteric artery. The left side of the colon completely is supplied by inferior mesenteric artery. Okay, so for example, let us say, let me draw this thing. This is your abdominal aorta. For example, abdominal aorta. Here I have got an artery called as superior mesenteric artery. Now this superior, what is this artery? This artery is called as superior mesenteric artery. Now this superior mesenteric artery is giving few branches. For example, it gives one branch all the way that goes above the right ureter and supplies to entire of your right colon. So that is why you call this artery as what? You call this artery as right colic artery. What is this artery called as? Right colic artery. These things we have already talked. Next, there is another artery. There is another artery that is coming from superior mesenteric, right? And this is coming down all the way and supplying here. This is called as ileocolic artery. I told you, if you remember, right? So this artery over here is called as ileocolic artery. Ileocolic artery. So we have got the right colic artery, we have even got the ileocolic artery. There are two important arteries over here. Okay, and final important thing, just remember it, that here we have got this particular structure, two-fold, double fold of peritoneum. This double fold of peritoneum is completely enveloping a part of your bowel. You see, this is a part of your bowel which it is completely enveloping. This double fold of peritoneum which is enveloping this also passes anteriorly. This double fold of peritoneum which is enveloping your bowel also passes anteriorly. So this part over here is called as your root of the mesentery. This is called as mesentery and this is called as a root of the mesentery. So if I ask you what are the structures that are forming the anterior relations of the right ureter, what are the structures? Once again, we have got our second part of the duodenum. Yeah, we have got our second part of the duodenum, right gonadal vessels, right colic artery, ileocolic artery and root of the mesentery. These are the structures that are forming the right side. Now, most of the structures are similar on the left side here, that for example, here I told about right gonadal vessels. So the left side anteriorly what you will have? Left gonadal vessel. So if there is right, there is also left gonadal vessel. In the same way, right side I have got an artery called as superior mesenteric artery. Then left side what will I have? I will have an artery over here. This is called as inferior mesenteric artery. What does this inferior mesenteric artery do? You know the colon which we have over here is your descending colon. Okay, after that this part of the colon which I have over here is called as a sigmoid colon. Clear? Descending colon as well as a sigmoid colon. Now this inferior mesenteric artery gives a branch to the descending colon and supplies this descending colon. So what is the name of this branch? If you studied that superior inferior branches, this is called as your left colic artery. Left colic artery. Okay. Next, there is another branch that comes down and supplies to your entire sigmoid colon like this. So what is this particular artery over here? This is called as sigmoid artery. So you have got the left colic artery, you have got the sigmoid artery over here. Okay, left colic artery as well as sigmoid artery. Next important thing is that there is also mesentery here. Okay, I just want to draw it like this. Yeah, there is also mesentery like this. Now this particular mesentery passes from, this is a double fold of peritoneum actually, that is passing from the sigmoid colon. So you call it as sigmoid mesocolon. Double fold of peritoneum, you call it as sigmoid mesocolon. See, double fold of peritoneum in different organs, the names are different. For example, if there is a double fold of peritoneum around your stomach and all, you call it as omenta. For the colon and all, you call it as mesocolon. Okay. For some parts, you call it as mesentery. So double fold of peritoneum has different names. So this is sigmoid mesocolon. Sigmoid mesocolon. So these on the left side, very few. Left colic, sigmoidal artery and sigmoid mesocolon. These are the structures that form the anterior relation of the left ureter over here. Now let us discuss about the posterior relations of right and left ureter. Posterior relations of both right ureter as well as the left ureter. If you look at the right ureter, if you look at the left ureter, right and left ureter, what are the posterior relations? First, coming to the right ureter, you have got a muscle called as right psoas major. Left side you have got left psoas major. Left psoas major. Right side you have got bifurcation of right common iliac artery. Here left side you have got bifurcation of left common iliac artery. Bifurcation of right common iliac artery here. Here down here got the bifurcation of the left common iliac artery. So these are the anterior and posterior relations of the right as well as the left ureter. Now speaking on with the constrictions. What are the anatomical constrictions? Ureter, at some places it is constricted, okay? Anatomical constrictions of the ureter. Anatomical constrictions of ureter. So what are the different kinds of anatomical constrictions of ureter? Basically, we have got three important anatomical constrictions. What are these three important anatomical constrictions? First, let us say this is your right kidney. Let us also say that this is your abdominal aorta. This abdominal aorta is dividing into two common iliac arteries. These are the two common iliac arteries. Let us also tell that here you have got your urinary bladder. Okay, this is your urinary bladder over here. Okay, now what are the constrictions? See, first important constriction is that this part, this wider part, he is called as a pelvis. See, I am highlighting it. You see this wider part over here? This wider part is called as a pelvis. Now this part of the pelvis is continuing into the ureter. Okay, so this wider part over here is called as pelvis, and this renal pelvis continues as ureter. So the point where it is starting as a ureter, where is that point present? Where is that point present? That is present between a renal pelvis and this is your ureter. So this particular junction over here, you see this particular junction over here is called as pelviureteric junction. What is this particular junction over here? This is called as pelviureteric junction. This is called as pelviureteric junction. Okay. Next important thing is that this particular ureter, whatever is there, it passes over, you see, it is passing over what? It is passing over your right common iliac artery. It passes over right common iliac artery. So there also there will be one constriction. Now the second constriction is the place where it is entering into your, what is this? The urinary bladder. For example, let us say the wall of your urinary bladder is thick. I mean all over. I'm just drawing at one point here. Okay. So yeah, this point is narrow. This point is narrow like this. Okay. So now you can figure it out better. You see here, the point where it is entering into the urinary bladder, there is also a constriction over here. So how many constrictions? So first constriction is called as pelviureteric junction. There is one constriction. Okay. Where is the second constriction over here? The second constriction is over here. This is at the level of pelvic brim. Pelvic brim. What is the pelvic brim? Where is pelvic brim? Pelvic brim is at what? At common iliac artery bifurcation. Next, the third point. So this is your third point over here. This is at the level of uretero, vesical, vesica in the sense urinary bladder, vesical junction, uretero-vesical junction. This is the third point, uretero-vesical junction. Okay, where the ureter is entering into the bladder. So point number 1. This is the first part, this is the second constriction, and this is the third constriction. In this way, there are 3 important constrictions over here. Now let us discuss what are the arteries that are basically supplying to your ureter. The right ureter and the left ureter are supplied by a few different arteries over here. Let us discuss what are these important arteries that are supplying to your right and left ureters. So let us look at the blood supply over here, the blood supply to the ureters. Okay, so let us discuss about the blood supply to your ureters. Now coming to the blood supply, let me draw the right kidney over here. So this is your right kidney and this is your left kidney, okay, and here you have got, this is your ureter, right? This is your ureter, the right ureter and the left ureter. Right and left ureter over here. Next important thing is that here you have got, what is this? This is your abdominal aorta. Okay, this is your abdominal aorta. Abdominal aorta is dividing into 2 common iliac arteries. Okay, so these are the 2 common iliac arteries. Now these 2 common iliac arteries, further they divide into external iliac and internal iliac. It is dividing into external and internal iliac. I will only show on one side. Okay, it is dividing further into both external iliac as well as internal iliac. External and internal iliac. Now let us look at what are the arteries over here. The first important artery is that there are 2 arteries that are supplying to the kidney. What are they? They are called as the renal arteries. Okay, let me first draw the arteries. Next important thing is that there are 2 arteries on the right side, right, and on the left side. These are called as a gonadal arteries. Okay, so what are these arteries over here? These arteries over here are called as your gonadal arteries, right and left gonadal artery. Okay, now after right and left gonadal artery, this is your internal. Let me name first before I write down all these arteries. Let me name these arteries so that it would be easy. So here, what is this artery? Yes, this is called as your renal artery. This is called as your gonadal artery, right? This is called as your common iliac artery, dividing into external iliac artery and internal iliac artery. Okay, now there are branches that are going from the renal artery like this. There are branches that are going from the renal artery. There are also branches that are supplying from the gonadal arteries, right and left. Okay, now the branches from the internal iliac, these branches are many. Okay, let us say internal iliac itself is giving one branch. Next, internal iliac is giving many branches, right? One branch is supplying the superior vesicle, upper part of the urinary bladder, that is called a superior vesical artery. So superior vesical artery supplies to your ureter. Next, you have got inferior vesical artery supplying to your ureter. Next, you have got the middle rectal artery supplying to the ureter, and finally uterine artery is also supplying to the ureter. Okay, so what are these arteries? Let us name them as A, B, C, D and E. So first of all, the arteries which are supplying are, one is called as a renal artery. Okay, clear? Another one is the gonadal artery. Next, yeah, by the way, this artery also, that is a common iliac, is also giving branches like this. Okay, so common iliac artery, Next important thing is this internal iliac artery, Okay, now this internal iliac artery is giving many branches. So one is the internal iliac artery itself it gives one branch. Next important thing is what is this? What is B? Yeah, A is the artery itself. Next we have got B, C and D, right? And E also. E. Then what is branch B over here? Yeah, what is branch B? Branch B is superior vesical artery. Next we have got inferior vesical artery. Next we have got the middle rectal artery. Middle rectal artery. Next we have got the uterine artery. Uterine artery. So these are the different branches that are giving to the uterus. So now we shall be discussing regarding the adrenal gland. Now regarding the adrenal gland or the suprarenal glands, you know where are they located, okay? And remaining next important thing is that these are grouped one under the retroperitoneal organs. These are also called as these are the retroperitoneal organs, okay? So for example, if this is your kidney like this, right, kidney, where is your suprarenal gland located? Here, okay? So it means they are located superiorly and laterally or medially, right? They are located supromedially, okay? So they are located supromedial to kidney. They are located supromedial to kidney, okay? They are located supromedial to kidney. If you look at the adrenal gland, actually both the adrenal glands are not symmetrical, they are asymmetrical, okay? The adrenal gland on the right is different from the adrenal gland on the left. So if you look at the adrenal gland, for our convenience sake, we shall be drawing it in the triangular form over here. So we have got two important parts. The center part, whatever is there, is called adrenal medulla. The remaining white part is called as the adrenal cortex. Adrenal cortex is in turn divided into three layers. Adrenal cortex is in turn divided into three layers. Okay, so all of you know the mnemonic, all of you know what is GFR, glomerular filtration rate, right? So the outermost layer over here is called as zona glomerulosa. The next important layer is called as zona fasciculata. And the last layer over here is called as zona reticularis. Okay, so the first letters in all of them three is GFR. Okay, remember like this, outer to inner. Next, what is zona glomerulosa releasing? It is releasing mineralocorticoids. One of the mineralocorticoid is aldosterone. These things will be taught in physiology. Okay, what is zona fasciculata releasing? Glucocorticoids. One of the example is cortisol. What is zona reticularis releasing? Sex hormones or androgens. Okay, now what is this part over here called as? What is the center part over here? This is called as adrenal medulla. What is this called as? This is called as adrenal medulla. So adrenal medulla releases two important things. One is called as epinephrine. Another one is called as norepinephrine. Epinephrine as well as your norepinephrine. So if you look at the blood supply of this particular adrenal gland, what is the blood supply? Let me draw the right kidney and this is your left kidney. Okay, and you already know that, okay, where are the glands? See, one gland is on the top here supromedially, the left one is on the left side. So let me draw this. This is your abdominal aorta, for example, abdominal aorta. Now the main artery over here, what is this main artery over here? This is called as your renal artery on the right, renal artery on the left. Okay, in the same way, you know that here you have got diaphragm. Let me draw it with the green. This is called as your diaphragm. Okay, so artery supplying to the diaphragm over here, this is called as inferior phrenic artery. Okay, first of all let me name these arteries. So this artery is called as inferior phrenic artery. Okay, this is abdominal aorta and this is your renal artery. Now one important thing is that what are the arteries that are supplying to this particular suprarenal gland. Now from the inferior phrenic artery you see a branch that is supplying here, right? From the abdominal aorta directly you see a second branch. From the renal artery you see a third branch. You're clear with this? So what are these three branches that are supplying over here? See, this branch over here is called as the superior branch, and this branch over here is called as the middle branch, and this branch over here is called as the inferior branch. Superior, middle and inferior. What are these three arteries here? These are called as suprarenal arteries. Suprarenal arteries. So how many suprarenal arteries are there? Superior suprarenal, middle suprarenal and inferior suprarenal. Superior suprarenal is coming from the inferior phrenic artery. Middle suprarenal is a direct branch of your abdominal aorta, and inferior suprarenal is a branch of your renal artery over here. Okay, now let us draw the same picture and discuss what are the veins over here. So this is your right kidney, this is your left kidney, and here you have got your adrenal gland on the top supromedially on both the sides. Okay, let us say the vein which is present over in the center here, this is called as your inferior vena cava. Okay, now next important thing is that here you have got this vein, this is called as a right renal vein, and you know left renal vein is long like this, right? One is called as a right renal vein, another one is your left renal vein. Let me write these things down. So this is your left renal vein, RRV, right renal vein. Okay, now another important thing is that there is a vein that is the direct branch of inferior vena cava that is draining blood from the top of your gland. Okay, top of your gland over here, right? Next important thing is that from your left renal vein, there is a vein over here. This vein is called as a left suprarenal vein. This is your left suprarenal vein. So just look here, how many suprarenal veins you have got. This is right suprarenal vein and this is left suprarenal vein. Now important thing you need to know that if you remember previously when I was teaching you, if you remember that about right and left gonadal vein, I told you that right gonadal vein drains into inferior vena cava, whereas left gonadal vein will drain into the left renal vein. You remember that, right? So this is your right gonadal vein, this is your left gonadal vein, right and left gonadal vein. Right gonadal vein will drain into your inferior vena cava, this is your IVC, inferior vena cava, and left will drain into left. In the same way, if you look at this particular vein over here, what is this vein? This is called as your right suprarenal vein. This is your right suprarenal vein. Right suprarenal vein is draining into directly inferior vena cava, whereas the left suprarenal vein is directly draining into your left renal vein. So these are the two differences which you have to know, right? So this is all you need to know regarding the adrenal gland. Now let us start our discussion on the kidney, the major part. Okay, kidney is the major part over here. Now when it comes to the kidney, topographically speaking, kidney ranges all the way from T12 to L3. Okay, second important point you need to know that the right kidney is lower than the left. Why? Because right side here you have got liver. Okay, you need to know that the right kidney lower than left due to liver on top, or you can write as liver in the which hypochondrium? Right hypochondrium. Liver located in the right hypochondrium. Okay, so if you ask about the weight of the kidney, the weight of the kidney is around 150 grams each. Each kidney is around 150 grams. Now remember this thing, it doesn't depend, the location might change but the weight doesn't change. Okay, so remember this 150 grams is in males mainly, but when it comes to females, the weight of the each kidney will be around 135 grams in case of females. Okay, so what are the different poles you have got within the kidney, guys? What are the important poles? if this is your kidney like this, right, you know very well that this is your renal pelvis and ureter. Okay, so if I am drawing a line like this, if I am drawing a line dividing the kidney into 4 parts, so this pole over here is called as the upper pole of the kidney. This is called upper pole, and this one over here is called as a lower pole. Okay, this border over here is called as a medial border, and this border over here is called as a lateral border. Then what about the anterior and posterior? You can look at another picture over here. See, coming to the poles, what it tells? Superior pole, inferior pole. This is the medial border over here. This is the lateral border over here. Now, if you are looking from the top also, this is superior, inferior. Top, from the top place, you can see anterior and posterior. Right? So it means this is how is this picture is that? See, this is how the picture is. So here is a superior, inferior. This is anterior. Now what did he do? He just turned the kidney like this. Now superior, inferior, this is anterior, this is posterior. Now again he kept it to the right. Superior, inferior, this is posterior, down will be your anterior. Clear all of you? So in this picture I think it would be clear to you. Now what I am telling you is that from one side to other side, it means from anterior to posterior side, how is the arrangement of renal vein, renal artery and renal pelvis? Okay, so anterior most on the anterior side. See, this is anterior side. If I am flipping it, this will be the posterior side. So from anterior side to the posterior side, it means this is anterior side, this is the posterior side, right? Anterior and posterior side. So here anteriorly I have got first vein, here I have got artery, here I have got renal pelvis. Okay, so from anterior to posterior, you see here all of these things are overlapping upon one another, right? So first you have got renal vein, then you have got renal vein, then you have got a renal artery, then you have got a renal pelvis. So remember it as VAP, V-A-P, VAP. Okay, renal vein, artery as well as pelvis from anterior to posterior side. Now what I will do is that, for example, if I am standing like this, you make a transverse section of my body. Now you make a transverse section of my body, right? What will you see? Vertebra is in the center. On the left you have got left kidney, on the right you have got right kidney, and I have made a transverse section. After making a transverse section, you are looking from the top. When you look from the top, in the center you have vertebra, left side you have left kidney, right side you have got right kidney. So that picture we will draw now. For example, when I make a transverse section, this is the vertebra over here. This is a vertebra, and these are the structures over here. Okay, so this is a vertebra. So here I will have my right kidney, here I will have my left kidney. So what I will be doing, I will be only drawing on one side. Okay, I will only draw on one side. Let us say this is the kidney like this. This is the kidney. Clear? So let us say that this is the left kidney. You are looking from the top, so this will be the left kidney. Okay, this is the left kidney over here. Now remember one thing, that this left kidney is exactly surrounded by a capsule. This left kidney is completely surrounded by a capsule like this. This is a fibrous capsule. This capsule is also called as a true capsule. What is this capsule called? True capsule. Okay, so this capsule which is surrounded by the kidney over here is called as a fibrous or a true capsule Okay, next important thing is that there are two fascias over here. Okay, there are two fascias over here. So first of all, the fascia which is covering the kidney is called as fascia of Garota. What is that? Fascia of Garota. The fascia which is covering the kidney is called as what? It is called as fascia of Garota. So this fascia of Garota is divided into two layers. What are those two layers? I will discuss it right now. So just look here. There is one layer of the fascia that is covering the kidney like this. Okay. there is another layer of the fascia that is covering the kidney like this. Okay, and later what will happen, both these fascias they join together like this. Okay, now there is one fascia that is located here. This fascia is anterior. This fascia is anterior because it is present on the front. So I am calling it as anterior renal fascia. Anterior renal fascia. Okay. In the same way, there is a fascia on the back. This is called as posterior renal fascia. Posterior renal fascia. Okay. Posterior renal fascia. Okay. So there is a fascia on the back over here. So this fascia over here is called posterior renal fascia. Now anterior renal fascia has given another name, and this name is called as fascia of Told. What is this? This is called as fascia of Told. Fascia of Told. And the posterior fascia is given another name. This is called as fascia of Zucker-Kandel. Zucker-Kandel. Fascia of Zucker-Kandel. So there are two fascias. So it means fascia of Geroda is divided into two. One is called as fascia of Told. One is called as fascia of Told. Another one is called as fascia of Zucker-Kandel. 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 Okay, there are two fascias like this. Okay, now what is happening over here? What is happening over here is that surrounding these fascias, in between these fascia as well as the renal capsule, you have got this yellow color structure which I am drawing. This yellow color structure, whatever I am drawing here, is a fat. Okay, now tell me, where is this fat present? This fat is present within the kidney, or this fat is present surrounding the kidney? Yes, this fat is present surrounding the kidney. So I am calling this particular fat as perinephric fat. Perinephric fat. What is this fat called? This fat is called as perinephric fat. Next, down here you have got a muscle. Okay, so this particular muscle which you have over here is called as quadratus lumborum. What is the name of the muscle? This muscle over here is called as quadratus lumborum. Quadratus lumborum. And there is also a fascia. You see, there is also a fascia like this, and this fascia is called as transversalis fascia. What is this fascia called? Transversalis fascia. Now this transversalis fascia, what is happening? This transversalis fascia will go and join with this particular fascia like this. Okay, but by the way, remember that I told you the anterior renal fascia and posterior renal fascia. These two fascias are joining here, right? This point where they are joining, they both of them join together to form this particular structure called as lateral conal fascia. This is called as lateral conal fascia. So joining this conal fascia, you have got another fascia in the green called as fascia transversalis. Fascia transversalis. Okay, now what I am telling you is that between what is this? Between the fascia of Zucker-Kandel and fascia transversalis, here also you have got a layer of fat. To differentiate it, I am drawing it with another color, right? So here also you see a layer of fat. Okay, so what is this fat called as? This fat is surrounding the kidney. You call it as paranephric fat. Okay, what do you call this as? You call it as paranephric fat. This is called as paranephric fat over here. So these are some of the important structures and fascias which you need to know. Okay, now let us look at what are the relations, anterior as well as the posterior relations. So this is a little bit a difficult part which I want you to just memorize this, then it would be easy. This is your right kidney. This is your left kidney. Okay, now you already know right kidney right, as well as the left kidney, both of them are having this particular part. What is this part? Where your adrenal gland is present. What is this? This is the suprarenal region. So you know this. This is not a difficult task to remember. So both of these regions are suprarenal area. So right now we are discussing about what? We are discussing the anterior relations. We are discussing anterior relations of both right and left kidney. So this is being the right kidney and this is being the left kidney. Okay. Next important thing, right kidney will have a particular structure like this on the right side. What is this? Liver. Left kidney will have an important structure like this on this side. What is this? Spleen. So it means that this particular area which I will be highlighting right now, just look here, this particular area, how part of liver will be overlapping this area. So that is why this area over here, now here itself I am writing, called as hepatic area. What is this area called? This is called as hepatic area. Okay. Next, you also know that here we have got ascending colon that is going like this, right? So it means that this particular area here is called as what? Colic area. You see, this particular area over here is called as your, what is this? Colic area. This is called as colic area. Okay. Next, there is another important area here. There is another important area lastly over here. This is called as jejunal area. Okay. So this area is called jejunal area. So you have got hepatic area, colic area as well as jejunal area. Next important thing is that this entire part, remember this, very very important. Okay, see, this entire area over here is occupied by the duodenum. So that is why you call this area as duodenal area. Duodenal area. This is called as your duodenal area. Okay, and by the way, I told you splenic area, right? So this part over here is called as your splenic area. This is called as your splenic area. Okay. Next important thing is that here there is one more area like this. This area in the center is called as a pancreatic area. Okay. This is called as pancreatic area. This is called as your pancreatic area. So in the same way, you also have jejunal area over here. If I am dividing it into two like this part over here is called as your jejunal area. So you see, this is not having any kind of concept. So I can draw the duodenum, liver and all, but that would just increase the complexity of the picture. So it is better you remember this way. We have got the colic area. So how do you remember this is that the top ones are easy, you know that. Okay. On the right side here you have got liver, so hepatic. Here you have got spleen, so splenic. Done. Next, here you have got colic area. Same on the opposite side, here you will have colic area, right? Down here you have got jejunal area. Here also you have got jejunal area. The only difference is that, see, here you have got duodenum. Let me draw this. This is the duodenum, and you know the head of the pancreas over here, and this pancreas tail is projecting towards the spleen like this. So now you match and see where is the duodenum to your right kidney. Where is your pancreatic area? It is to the left kidney. I hope this is clear. This is how you basically match and study the things. Okay, so these are some of the important areas which you need to know. The anterior relation. Coming to the posterior relation. Okay, now coming to the posterior relations of the left as well as the right kidney. Okay, so now I am changing the positions because these are the kidneys anterior side. Now if I am flipping them opposite, so obviously the positions will change. So this will be called as the left kidney. Now this will be called as the right kidney. Previously this was called right, that was called left. Now the positions will change, right? So that is why you called as the left as well as the right kidney over here. Now what are the areas which you can locate over here? First, before I locate any area, first of all let me locate this particular part. See, this area over here, this one, this is the place for which rib? This is the place for 11th rib. And down here you have got a place for 12th rib over here, 11th and 12th. Let us look on the opposite side. This is the place for 12th rib, not the 11th rib. Why? Because the right kidney, let me draw this, the right kidney is a little bit below. Okay, so you see the right kidney is little bit below, that is why it is not reaching up to the 11th. So you should know that this is the 11th rib over here, and this is the 12th rib over here, and this is directly the 12th rib, no 11th rib. These are the posterior relations of right and left. Next, here down you have got three important muscles. So this is one muscle, this is muscle number 2. Let me color it. So muscle number 1 is this one, okay, and here we have got muscle number 2, okay, muscle number 2, and here we have got muscle number 3. So you see the left kidney is having how many muscles over here? There are three important muscles. The same thing goes on with the left side also, okay. What are these three important muscles over here? This is called as transverse abdominis muscle. Here we have got quadratus lumborum muscle. Here we have got psoas major muscle. The same thing goes on with the left side also. Okay. Same thing goes on with the left side also, but I'm not writing it. That's it. So this is your transverse abdominis muscle, and here you have got the quadratus lumborum muscle, and here you have got the psoas major muscle. Clear? Right. Next important thing is that on the right side you have got some very important structures. For example, let us say there is a nerve here. This nerve is called subcostal nerve. Now there is an artery here. This artery is called subcostal artery. There is a vein over here. This is called a subcostal vein. So overall I am right now telling about subcostal vessels. Okay, subcostal vessels, which is containing artery, vein and subcostal nerve. Next, two more nerves you have got over here. See, there is one nerve that is coming down, there is another nerve over here. What are these two nerves over here? One is called as, this nerve which is down over here is called as ilioinguinal nerve, and this particular nerve over here is called as hypogastric nerve. Iliohypogastric nerve. You have got both ilioinguinal and iliohypogastric. Okay, so I hope you remember what are the relations of the left kidney and what are the relations of your right kidney. Now let us discuss about the anatomy of the kidney. Okay, let us discuss what are the structures that are located within the kidney. So let me draw a little bit a bigger picture like this. Okay, now here yeah, if this is the kidney over here, remember one thing, here you have got a pyramid like this. Here also you have got a pyramid. Here also you have got a structure. This is called as a pyramid. And here also you have got a structure. This is called as your pyramid. These are called, the picture might not look good, but still try to understand. Okay, these are called as renal pyramids. So let me join this part like this. These are called as renal pyramids. Okay, now down here I am drawing a part with the yellow. You see this part which I am drawing with the yellow, right? These are called as renal sinuses. So here I have got one renal sinus. Here I have got another renal sinus like this. Here I have got a third renal sinus. So I have got a renal sinuses over here. What are these renal? I will write about these later on. Okay, what are these called? These are called renal sinuses. Renal sinuses are containing what? These renal sinuses are containing lymph nodes. They are also containing perinephric fat. That is why I have drawn it with the yellow color. Okay, right. Next important thing is this part is your renal pelvis, and renal pelvis is joining into the ureter proper. Okay, so let me this part over here is called as renal pelvis, and this part over here is called as ureter proper, and this part over here is called as your renal sinus. Again, what did I tell? Renal sinus is containing lymph nodes and perinephric fat. Now, what are these structures over here in between the renal sinuses? You call it as minor calyx. What are you calling it as? Minor calyx. And what is this part over here called as? These parts over here are called as major calyx. Minor calyx, and little bit distal to that we have got the major calyx. Minor calyx and major calyx. Actually, minor calyces, they fuse to form the major calyces. Okay, so you need to know that there are two different parts. See, this outer part is called as cortex. This is called as cortex, where these renal pyramids are present. This part is called as medulla. Cortex as well as your medulla. Okay, now what I'm doing is that I will just enlarge one renal pyramid to explain the structure over here. Okay, so let us say that one renal pyramid, I'm just enlarging it like this. Okay, so this is your renal pyramid. Now, if you look at this particular renal pyramid, how is the arrangement of glomerulus within this? All of you know, here we have got the Bowman's capsule like this, right? Next, after that we have got, this is called as a PCT. After that we have got down over here, what is this? This is called as your, we have got PCT. After PCT, what is this? Descending loop. And then we have got the ascending loop like this, right? After this ascending loop, we have got the DCT, and finally it is draining into a duct. This duct is called as collecting duct. Let me shade this area so that you would understand it better. So this particular duct over here is called as what? This is called as your collecting duct. Okay, this is called as collecting duct, and this collecting duct opens, this collecting duct opens here. So this opening of this collecting duct down near the apex here is called as a renal papilla. So this is the place where it opens. See, this is the place where it opens like this. This open part is called as a renal papilla. Okay, this opening over here, you call it as a renal papilla. See, this one over here is called as renal papilla. And by the way, what is this duct over here is called as collecting duct or duct of Bellini. Collecting duct or duct of Bellini. You can call it as collecting duct or duct of Bellini. Next important thing is that let us discuss about the arteries over here. Okay, I'm drawing it with the green. Now remember here. Now, before we discuss arteries, you should actually know one very important thing, that these renal pyramids are there, right? Now, on the renal pyramids, you have got some structures like this. These structures that are located on the surface of renal pyramids are called as medullary rays. What are these called as? These are called as medullary rays. Okay, so these structures over here are called as medullary rays. What are these structures called? These structures are called medullary rays. Now, the renal pyramid and the medullary rays. See, this is your renal pyramid and the medullary rays. Together you call it as a lobe of the kidney. So the renal pyramid and the medullary rays, renal pyramid and the medullary rays here, right? So this entire part you call it as the lobe of kidney. What do you call it as? You call it as the lobe of your kidney. Next important thing is regarding the artery. I told you, let me finish that up. So there is an artery that is present in the center like this. Okay, let me zoom in this. There is an artery over here. What is the name of this artery? This is called as, see, this is lobe of the kidney. See, this entire, okay, this entire part is lobe. Here also there will be another lobe. Between the lobes, if I am drawing an artery, this is called interlobular or lobar. Interlobar artery. Okay, this is called as interlobar artery. Now, what will happen with this interlobar artery? This interlobar artery will divide into two arc-shaped arteries like this. You see, this interlobar artery is dividing into two arc-shaped arteries. These are called arcuate arteries. What are they? Arcuate arteries. Now, arcuate arteries are giving branches in this way. You see, arcuate arteries are giving branches. See, this is one branch, this is another branch, this is another branch, this is another branch. So, arcuate arteries are giving branches like this. These branches over here given by these arcuate arteries are called as interlobular arteries. What are they called as? They are called as interlobular arteries. So what I was telling you is that this artery over here is called as interlobar, giving arc-shaped arteries. These arc-shaped arteries are giving few more arteries over here like this. So let me discuss this. So this is your interlobar artery. This is your arcuate artery. This is your interlobular arteries. These are your interlobular arteries. Interlobular arteries. So these are some of the important things which you need to remember regarding this kidney part. Okay. Now we shall discuss the blood supply of the kidney in detail. Okay. Blood supply of the kidney in detail completely we will discuss now. Okay. So for that again I have to draw the kidney over here. This is the kidney and yeah, not to forget that you have got pyramids like this, right? These are your renal pyramids over here. Now remember one thing, what is this artery over here? This artery which I am drawing is abdominal aorta, and this is giving an artery over here is called as a renal artery. What is this? Renal artery. Now look here. First, we have got an artery over here called as abdominal aorta. Okay. Branch of abdominal aorta is your renal artery. Okay. Where is your renal artery? This is your renal artery. See, this is your renal artery. Clear? So I am just putting it as one. This is your renal artery. This is your renal artery. Okay, that is one. Now after this renal artery, artery number 2. What is this 2? There are 5 segmental arteries. I cannot show it to you here. Just write it as 5 segmental arteries. Okay. Now these 5 segmental arteries are going to divide and they will form lobar arteries. Okay, 5 segmental arteries, they will divide and form lobar arteries. See, for example, so here let us say there are 5 segmental arteries like this, right? These 5 segmental arteries are dividing into lobar arteries. See, this is one lobar artery. What is this? This is one lobar artery, and here I have got another lobar artery. Yeah. You see these arteries over here? I'll highlight them. You see, this is one lobar artery. This is another lobar artery. This is a third lobar artery, fourth lobar artery, fifth. So these are the lobar arteries. What are these arteries over here? These arteries are lobar arteries. So I'm just giving them the number 3. Okay. These 3 are lobar arteries. After lobar arteries, the artery number 4 I have got is interlobar. What is this? Interlobar artery. Interlobar artery in the sense this one. So they come down over here. This is your interlobar. This is your next interlobar. Next, next, and next. So I am giving them the number 4. 4. What is 4? Interlobar. After interlobar, the 5th important one is arcuate arteries. Arcuate artery. Why are you calling it as arcuate artery? Because I just told you that this artery will be divided into arc-shaped arteries like this. These arc-shaped arteries dividing into 2 arches. Each artery is dividing into 2 arches like this. So these arc-shaped arteries, which I'll give them as number 4, 5, are called as arcuate arteries. After these arcuate arteries, artery number 6 is called as interlobular artery. Look at the difference, lobar and here it is lobular. Okay, so these arcuate arteries are in turn giving some branches like this. You see, it is giving some branches onto the top. So these branches which are given on to the top like this, these are called as interlobular arteries. What are they called? Interlobular arteries. After these interlobular arteries are done, that is your artery number 6. Artery number 6. Next, artery number 7, what do you have? All these interlobular arteries, they collect together. They collect together to form the efferent. See here. Let me show up this thing to you. Let us say, yeah, see, this is one artery. Okay, let me draw this. See, what is this? What am I drawing right now? Yeah, what am I drawing right now? Yes, tell me, what am I drawing right now? So all these, see, this is one interlobular artery, what is this? Interlobular artery, interlobular. All these interlobular arteries, they are joining together to form an artery over here. This is called efferent arteriole, right? And this efferent arteriole, like this, okay, for much more clear image, let me do this. So this is your interlobular artery, interlobular. See, you see many arteries, all of them, they're joining together like this. Okay, they join together to form efferent arteriole. This efferent arteriole will divide like this. Will divide like this. Will divide into what? What are they? They are dividing it into what? Glomerulus. Okay, what are they forming? Glomerulus. And all of these join together to form efferent arteriole. Okay, so what is this? This is arriving inside. You see, this is a direction, right? So this artery is arriving. So efferent arteriole, AA, arriving arteriole is efferent. And this artery is exiting. So efferent arteriole. Efferent arteriole will again join with the veins. You know the procedure, right? First you have got artery, then you have got arterioles, then you have got capillaries, then you have got venules, then you have got veins. You know it, right? So the same way. So look here, interlobular artery. After all these interlobular arteries, they join together to form what? They join together to form efferent arteriole. Efferent arteriole. And efferent arteriole will form glomerulus. And this glomerulus will later on form the efferent arteriole. Efferent arteriole over here. Now this particular efferent arteriole will form your what? Vein, interlobular vein. Interlobular vein. And after interlobular vein, okay, let me put this part over here. So efferent arteriole will finally form what? Interlobular vein. So now the interlobular veins collect the blood and they drain into arcuate vein. Now from there they drain the blood into interlobar veins. Okay, interlobar veins. From there the lobar veins. From there the segmental veins. Okay, segmental veins. How many segmental veins we have got? Again the 5 segmental veins. From there the renal vein, and from there the inferior vena cava. Okay, so this is how the artery and the veins, they completely drain. So this is all you need to know regarding the anatomy of your kidney. So now we shall be discussing regarding the blood supply to your pancreas. Okay, so what is the important blood supply to the pancreas over here? So coming on, first you know that previously I have taught you regarding the celiac trunk. Okay, I have taught you regarding the previously you know that I have taught you regarding the celiac trunk. Okay, I have taught you regarding the celiac trunk, superior mesenteric artery as well as the inferior mesenteric artery. Now let us use those arteries to draw the blood supply over here. So you have to be perfect before I discuss these things. You have to be perfect with the celiac trunk, superior mesenteric and inferior mesenteric artery. So let us say at the level of T12 you have got the superior celiac trunk over here. So this branch over here is called as your celiac trunk. Celiac trunk is present at the level of T12, you know. Superior mesenteric is present at the level of L1, okay, and inferior mesenteric is present at the level of L3. So this celiac trunk is basically giving an artery like this, right? Now, you know, it gives an artery to the spleen, and you know, behind the stomach and behind the pancreas, this artery is moving like this. What is this? This is how tortuously the artery is moving like this, right, behind the pancreas. And then if you see here that this artery comes out like this and supplies to your spleen. Now actually this artery, yeah, by the way, what is the name of this artery over here? This artery is called as a splenic artery, okay? This artery is called as splenic artery. This splenic artery is divided into three parts. So this part of the splenic artery is called as a pre-pancreatic part. What is this? Pre-pancreatic part. Next, this part of the splenic artery is called retropancreatic part because it is present behind the pancreas. And this part over here, you call it as the post-pancreatic part, okay? So there are three parts of this splenic artery. One is called as a pre-pancreatic part, post-pancreatic part, as well as the retropancreatic part. Okay, now leaving this here, let us go to another branches over here. What are these other branches? You know, here we have got the hepatic artery proper. Later it will divide into what? This is called as a common hepatic artery. It will divide into hepatic artery proper, right? So it is going to divide into hepatic artery proper, and there is an other artery that is coming down between the stomach as well as the duodenum. You call this artery as what? This is called as gastroduodenal artery. You know that the gastroduodenal artery is giving two branches. One is called as a right gastromental artery, okay, and another branch over here, this is called a superior pancreatoduodenal artery. What is this? Superior pancreatoduodenal artery. Now this superior pancreatoduodenal artery is present on the front side and on the back side also. You see, that is why I am drawing the dotted lines. It is present on the back side also. Okay, it is present on the front and it is present on the back. So what do you call this? Yes, you call this as superior pancreatoduodenal artery. So which is present on front and back is, one is anterior and the other one is your posterior branch. Two branches, anterior as well as a posterior branch. In the same way, down here you have got another main artery, right? What is this particular artery over here? This is called as superior mesenteric artery. What is this? Superior mesenteric artery. From the superior mesenteric artery also, you see an artery that is coming in anastomosing here. Anastomosing with what? Superior pancreatoduodenal artery. So this artery must be named as inferior pancreatoduodenal artery. So it is also having a posterior branch like this. What is this? Posterior, yeah, inferior pancreatoduodenal artery. So what is this branch over here? This is your inferior pancreatoduodenal artery. Both anterior branch we have and posterior. Anterior and posterior branch we have got over here. Now, next important thing is that from this splenic artery, from the splenic artery, you see a branch that is coming over here, right? This particular branch is called as posterior or dorsal pancreatic artery. What is this? Dorsal pancreatic artery or posterior pancreatic artery. This is your dorsal pancreatic artery. What is this? Dorsal pancreatic artery. This particular dorsal pancreatic artery is dividing into a right branch like this, and this is coming down all the way, right? Coming down all the way. And by the way, remember this, that this particular branch, this artery, this particular branch is moving posteriorly, not anteriorly, okay? So I have to draw the dotted lines over here. See, it is divided into a right branch like this, and there is another branch that is going transversely, you see. So this is called as a transverse What is this? Transverse pancreatic artery. One is called as a right branch and the other one is called as a transverse pancreatic artery. This is your transverse pancreatic artery, transverse pancreatic artery. Next important thing is that you even have got some small branches here. You see? Small branches of splenic artery like this. Okay? You even have got some small branches of splenic artery. In the same way, you even have got a large branch of this splenic artery as well. Okay? So, what are these small branches called? All these small branches together you call it as short pancreatic arteries. These are called as short pancreatic artery, and this branch over here is called as great pancreatic artery or greater pancreatic artery. Greater pancreatic artery. We have got a short pancreatic artery, we have got a greater pancreatic artery. So this covers the blood supply of your pancreas, blood supply to your pancreas. Okay, this covers the blood supply to your pancreas. So now we shall be discussing regarding the prostate gland. Okay, so what are the important features of the prostate gland? So first important thing you need to know that prostate gland is pyramidal in shape. Prostate gland is pyramidal in shape, right? So what are the things that are secreted by the prostate gland? You can remember the mnemonic by the name Pacific, all the structures by the name Pacific. What are the important things that are secreted by this prostate gland? Okay, so P here stands for prostaglandins, so P here stands for prostaglandins. A here stands for amylase. A here stands for amylase. C and I stands for citric acid. C and I stands for citric acid. F and I stands for fibrinolysin. F and I stands for fibrinolysin. Okay, and P also stands for prostate specific antigen. A also stands for acid phosphatase. So these are the structures, these are the enzymes and the acids that are released by this particular prostate gland. So first of all, let us discuss where is the location. Okay, where is the location of this prostate gland? So if you look at the location of this prostate gland, so this is your urinary bladder. Okay, and down here you have got your urethra. So this is your urethra over here, right? So where is your prostate gland? This is the location of your prostate gland. So can I tell that prostate gland is located somewhere near to the neck of the urinary bladder, right? So this is located it is located below the neck of the urinary bladder, and down here you have actually got a diaphragm like this. Okay, so this particular diaphragm, which is located down in the mid part of the urethra over here, is called urogenital diaphragm. On either sides of this prostate gland, you have got a muscle, right? So this particular muscle over here is called as levator ani muscle. Okay, what is this muscle over here called as levator ani muscle? So this is your urinary bladder, right? This is your prostate gland, and this is your levator ani muscle. Okay, and this is your urogenital diaphragm. Urogenital diaphragm. So where is your prostate gland located? Basically, prostate gland is located below the neck of the bladder and above the urogenital diaphragm. Okay, prostate gland is located below the neck of the bladder and above the urogenital diaphragm. Below the neck of the bladder and above urogenital diaphragm with levator ani on either sides. With levator ani on either sides. Levator ani on either side. So this is the location of your prostate gland. Now, if you look at the lobes, what are the different lobes of the prostate gland? So, what are the different lobes? So, we have done a transverse section, we have got a sagittal section. So, in this transverse and sagittal section, we can see what are the different lobes that we have. Now, if you have to understand this, first of all, understand the sagittal section. Don't look at the lobes. In the sagittal section, what is this part over here? This part is called as your urethra. Okay, you see, this is your prostate gland. This is your prostate gland. The center of the prostate gland, what is this? Urethra. Here also, this entirely is your prostate gland, right? But the center of the prostate gland, what do you have? Urethra. And there is something that is joining the urethra. What is that? I will draw in the next picture and tell you. But right now, what you need to know, that this is the urethra and this is the duct called ejaculatory duct. Right? So, this is in the transverse section. For example, if this is a prostate gland, right? If this is a prostate gland over here, okay? If I am making a section like this and looking from the top, that is this picture. If I am making a vertical section and looking from the side, that is this particular picture over here. So, first of all, you have to know what are the different lobes do we have over here in the prostate gland. First lobe which we have is the anterior lobe. We have got the anterior lobe. Where is the anterior lobe? This is your anterior lobe. Back side will be what? Posterior lobe. So, we have got posterior lobe also. Okay. Third important thing is that we have got a median lobe. Why? Because there is only one lobe in the center here. This is called median lobe. Fourth important thing is that on either sides, these are to the lateral lobes. So, on either sides, we have got two lateral lobes. So, these are the lobes of your, what are they? These are the lobes of your prostate gland. Okay. Now, much more clear picture from front to back, right? For example, if I am standing, you can see my anterior side. If I am turning that side, right, from my front to the back, what are the structures you have got? In the front, mostly, in the front, what do you have over here? You have got your pubic bone, right? So, this is your pubic bone over here. Next, behind the pubic bone, what do you have? This is your urinary bladder. Okay. Down to the urinary bladder, what do you have? You have got your urethra over here. Down to the urinary bladder here, you have got your urethra. Next important thing is that here, what do you have? You have got your, what is this? This is called as your, prostate gland. So, this is your prostate gland over here. So, this is your prostate gland. This is your prostate gland. Okay. Now, the center part of the prostate gland is urethra. Now, another important thing is that attached to the urethra, what do you have? Yes, attached to the urethra like this, what is the structure you have got over here? This is called as ejaculatory duct. Okay, this ejaculatory duct is ejaculating what? This ejaculatory duct is ejaculating from the seminal vesicle, semen from the seminal vesicle. And backside, what do you have? Backside, you have got rectum. Yes or no? This is a simple thing, very simple thing to understand. For example, if I am turning to the right side like this, if I am turning to the right side, in the front I have got pubic bone, right? Next I have got urinary bladder, and backside, what do I have got? Rectum. Yes or no? Pubic bone in the front, backside rectum, in between I have got what? I have got urinary bladder. So, this is all you need to know. Now, next important thing is that let me draw the layer of peritoneum. So, peritoneum is a layer that is covering. Peritoneum is equivalent to pleura. Pleura is covering pleura for your lungs, pericardium for your heart, peritoneum for your bowel, right? So, peritoneum is covering your urinary bladder like this. Okay, this is your visceral peritoneum. And this peritoneum is making a pouch in the rectum and going like this. Okay, so this pouch is made between urinary bladder anteriorly, and again I am telling, so if, okay, let me tell you one thing, you will understand it right now. I know most of you understood this, but still, just for your peace of mind, let me draw this part. Yeah, let me compress this part here. Now look here, what I was trying to tell you is, yeah, now you understood this. Now you understood, this is the umbilical region, right? So here is the head that is looking front, and this is the back back part. Okay, this is the buttocks. Now you understood what I was trying to draw here, right? So now, yeah. So now what I am trying to tell you is that here you have got rectum. Between the rectum and between the urinary bladder, you have a pouch over here. This pouch is called as a rectovesical pouch. Rectovesical pouch, very important pouch. Okay, why? Because if, for example, if there is any bleeding in the body, if there is any organ that has been ruptured, right, on the top you have got liver, spleen. If they are ruptured, the blood will drain down into this pouch, rectovesical pouch. Okay, right. What is this particular structure over here? What is this particular structure over here? This is called as your seminal vesicle. Seminal vesicle. And what is this duct over here? This is called as your ejaculatory duct. This is called as your ejaculatory duct over here. Okay, and this is your prostate gland. This is your prostate gland. This is your prostate gland over here. Okay, now next important thing is that there is a ligament that is attached all the way to the urinary bladder here. This ligament is called as median umbilical ligament. What is this? This is called as median umbilical ligament. Median umbilical ligament. And not to forget that this is your pubic symphysis. Okay, this is your pubic symphysis. And if you closely observe, you see a space that is present behind the pubic symphysis, right? This space is called as a retropubic space. Retro in the sense back to what? Pubic. Retropubic space. Retropubic space, or you can also call it as space of Retzius. Space of Retzius. Okay, this is called as space of Retzius. Right, so these are the structures that are located from anterior to posterior. So by the way, this section over here which I have drawn over here is sagittal section. Okay, so this is your sagittal section. In this sagittal section, you see now what is this duct, now you understood, which is coming from the side over here like seminal vesicle, right? The same picture I have drawn over here down, right? So this is a sagittal section. Now let us look at the capsules. What are the different kinds of capsules which we have that are surrounding your prostate gland? Okay, so again let me draw the urinary bladder firstly. This is your urinary bladder over here, and urinary bladder is continuing down as urethra. Clear? It is continuing down as urethra, and here you have got a bulbous part. This is called as a bulbous part of the urethra. What is this? Bulbous part of the urethra, or you can call it as intrabulbar fossa of urethra. What is that? Intrabulbar fossa of that urethra. So into this intrabulbar fossa, there are two important structures that are draining. Okay, there are two important structures on either side that are draining into this intrabulbar fossa. These structures which are draining are bulbourethral glands. What are these? Bulbourethral glands. Okay, so this is your bulbourethral glands. Okay, and what is this? This is called as the intrabulbar fossa. What is this? Intrabulbar fossa of your urethra. Intrabulbar fossa of your urethra and bulbourethral glands over here. Next important thing you need to know is that here we have got a what is this? By the way, this is your prostate gland. Obviously this is your prostate gland. Whatever with the green I am drawing is a tissue of the prostate. Now surrounding your prostate gland, you have got a capsule here. You see, surrounding the prostate gland you have got a capsule. So this capsule which is surrounding the organ is called as a true capsule. Okay, next far away here you have got another capsule like this, right? So this capsule which is surrounding the prostate very far, this is called as a false capsule. Okay, what is this called? False capsule. Okay, you know, in the pelvis, these are the structures present in the pelvis. In the pelvic region you will have pelvic fascia. So pelvic fascia will undergo condensation and form this capsule called as false capsule. Okay, then how true capsule is formed? True capsule is formed by, you see this prostate gland, You see the prostate gland. So for example, if this is a prostate gland, okay, the outer layer of the prostate gland, which is called as a fibrous stroma, right, the peripheral fibrous stroma. So let me draw this and tell you. See, this is your prostate gland here, okay. Now what I am telling you is that if this is your prostate gland, the outer layer of prostate gland, okay, so this prostate gland is having what is this all this is the fibrous stroma, peripheral fibrous stroma, in the sense which is located in the periphery, which I'm drawing with the pink. This peripheral fibrous stroma becomes hard, condensed, and it converts into a capsule. Peripheral fibrous stroma will convert into a capsule. Between the true capsule and a false capsule, you have got a plexus like this, right? What is this plexus that is located here? This is called as prostatic venous plexus. So let me write down all the points over here. This is called as your false capsule. What is false capsule? False capsule is formed by what? It is derived from what? Pelvic fascia. It is derived from pelvic fascia. And what is this pink color one? This is called as true capsule. Okay, true capsule is formed by condensation of what? Peripheral fibrous stroma. Peripheral fibrous stroma, condensation of peripheral fibrous stroma. Okay, bulbourethral, and these are the things which you already know. And yeah, by the way, what is this particular plexus over here? This is called as your prostatic venous plexus. Prostatic venous plexus. What is this? Prostatic venous plexus over here. Okay, prostatic venous plexus. These are the important things which you need to know. So regarding capsules, yeah, first there is also one more capsule. First capsule was your true capsule. Second capsule was your false capsule. Okay, and now I am telling you third capsule, that is called as surgical capsule. What is that? Surgical capsule. What is surgical capsule? Surgical capsule is a pathological capsule. Pathological capsule. When it is formed in case of BPH. What is BPH? BPH stands for benign prostatic hyperplasia. Prostatic hyperplasia, which means your prostate gland is enlarged. Okay, so all of you just look at this. See, this tissue, whatever is there, this is the normal prostatic tissue. Okay, now once the prostatic tissue undergoes hyperplasia, you see this is a BPH tissue, right? So this BPH tissue keeps on increasing in size. Okay, so usually you have a urethra in the center. Okay, on one side here, what do you have? What is this? This is your, I'm just drawing only one side of the prostate gland. This is your prostate gland. So now what is happening is that slowly there is a prostatic tissue that is formed here. The benign prostate hyperplasia, in the sense this tissue is getting hyperplasia. It means there is increase in number of cells over here. Okay, so what will happen? What will happen is that you look at the thickness of this particular tissue. Isn't it reducing? Yes or no? It is reducing, right? So till here now we have got the prostate gland. This is a prostate gland. What will happen? Again there is hyperplasia. So when there is hyperplasia again going on, what will happen? Again till here the gland size has been increased, but you see that the peripheral part is getting condensed. Now if the hyperplasia is much more, what is it doing? It is pushing the central green color part to the periphery. So once it is pushing the central green color part to the periphery, now don't you think this part is looking like a capsule, double layered capsule? But this capsule is called as your prostatic capsule or your surgical capsule. Okay, and remember one thing, as this is growing, what will happen is that the center urethra also becomes narrow from both the sides. As the urethra is becoming narrow, it will be very difficult for the urine to pass down. So that is why in patients with BPH, they will have difficulty voiding. Voiding means initiation of the urine. Okay, so patient will have difficulty urination in BPH. Clear all of you? So whenever a patient is having difficulty urination in BPH, so patient will be complaining like, doctor, nowadays whenever I'm starting to urinate, it is taking much longer time to urinate. I cannot initiate the urine. I'm not able to empty my total bladder and all. So these are the complaints, and these are usually seen after 40, 45 years, 50 years. So what you need to do is that you need to do an examination. You see, this is a prostate gland over here, right? This is your prostate gland, right? So what you need to do, you need to see whether the prostate gland has become thick or not. How will you see? Instead of putting your finger through the urethra, which will rupture the urethra, it is better you put your finger through the rectum and start palpating. You put your finger through the rectum like this and start palpating this area. You see what you find is that you find that both the sides of the prostate gland are equally enlarged. Okay, if both the sides of the prostate gland are equally enlarged, it means patient is having benign prostate hyperplasia. And this test which you are doing over here is called digital rectal examination. Digital rectal examination. Digital rectal examination. For example, when you are putting your finger inside and palpating, you see that there is irregular enlargement. Like you feel in this way that the prostate gland is enlarged in this way, right? Then this is not called BPH. This is not called BPH. When do you call it as BPH? If you see the prostate gland is enlarged evenly on both the sides, you call it as BPH. Then what do you call this one as? This one you call it as what? Carcinoma, cancer, prostate cancer. Okay, so prostate cancer you do, and also you do a specific testing called prostate specific antigen. If it is more than 1.4, then you consider it as, I mean, it depends upon the age group. So different age group will have a different value. So anyways, don't remember this. These will be taught in your surgery. Don't remember this right now. So just remember that BPH, you will palpate, you palpated a patient and you felt some irregularly enlarged both the sides of your prostate gland. Both the sides of the prostate gland is irregularly enlarged. There are some nodules there, you feel some bumpy elevations, then it is not BPH, it is a cancer, prostate cancer. Clear? Right, so this is one of the important thing. Next, there are different zones within the prostate gland. For example, this is the same picture again, nothing to worry. What is this muscle? Levator ani muscle. Right, this is your prostate gland. Right, and the duct over here is ejaculatory duct, you know. Now, prostate gland is having 4 important zones. What are those 4 important zones? See, one is called as an anterior zone. Okay, one is called as an anterior zone. Next one, the blue one is called as a peripheral zone. The zone which is surrounding your what? Surrounding your ejaculatory duct is called central zone. Central zone is surrounding your ejaculatory duct. But tell me, what is the zone that is surrounding your urethra? Where is urethra? This center line is the urethra here. That is your transition zone. Okay, transition zone is surrounding your urethra. It is surrounding your urethra over here. Remember one thing, in case of benign prostate hyperplasia, out of all these zones, which zone is undergoing hyperplasia? That is your transition zone. Your transition zone undergoes hyperplasia here. Okay, very important question. So in benign prostate hyperplasia, which zone of your prostate is undergoing hyperplasia is your transitional zone, because that is the only zone that is surrounding your urethra. Okay, I hope you understood whatever I am talking about this thing. Now coming about the arteries, very simple. Coming about the vasculature, the artery which is supplying here is internal iliac artery. A branch of internal iliac artery is prostate artery. Prostatic arteries. So prostatic arteries that are coming from the internal iliac arteries are supplying here. Okay, and coming to the nerve that is innervating over here, that is inferior hypogastric plexus. Inferior hypogastric plexus. Okay, so these are some of the important things you need to know regarding the prostate gland. Now we shall be discussing regarding vas deferens or ductus deferens. Vas deferens, or you also call it as ductus deferens. Okay, so what is the basic length of this vas deferens? That is around 45 centimeters in length. Okay, what is the function of this vas deferens or ductus deferens? What does it do is that from the epididymis, where the spermatozoa are formed, right? So from the epididymis, it will transport the spermatozoa into the ejaculatory duct. Okay, so it transports spermatozoa, very short topic, spermatozoa from epididymis into your ejaculatory duct. So this is a function of your vas deferens. You can look at the picture over here. This is your vas deferens, right? And this is your seminal vesicle. So this seminal vesicle is opening into the duct of the vas deferens, and together they will enter into the urethra, right? So now look at this particular picture, you will understand here. You look at this particular picture, this is seminal vesicle. I did not draw vas deferens over here, right? Vas deferens, seminal vesicle, they both of them open into the urethra. Look at this particular picture. Now here you will understand clearly. So here we have got seminal vesicle, right? You see seminal vesicle, and what is this? This one is your vas deferens. They both of them are opening into this center part. What is this center part called as urethra? On either sides, what do you have again? Prostate gland you have got over here. Okay, you have got prostate gland, and this vas deferens started from where? You see this E stands for what? Epididymis. From epididymis, the sperms pass all the way through the vas deferens, like this, like this, like this, and finally this is how they enter here. Okay, so regarding this is one of the important thing, but blood supply is bit important here. That is most commonly asked over here. Okay, so there are three arteries that supply blood here. Okay, one is called superior artery. Okay, another one is called middle artery, another one is called inferior artery. Superior, middle, and inferior. What is this? Superior vesical artery, next we have got middle rectal artery, and we have got inferior vesical artery. Okay, so each one of them will give three branches. So what is the name of the branch? This is called artery to vas deferens. So this one will give artery to vas deferens, middle will give artery to vas deferens, inferior also will give artery to vas deferens. Okay, so all of them, they will give artery to vas deferens. Next we have got another important reflex called as cremasteric reflex. Okay, cremasteric reflex, very important reflex you need to understand over here. Let us say that this is your spinal cord. This is your spinal cord over here. Okay, and let us also draw the spermatic cord, right? And finally we have got the testis. So this is just a schematic picture. Again I am telling you, don't take things into particular. This is just a schematic picture. So this is your spermatic cord, and this one is your testis. And remember one thing, this one surrounding the spermatic cord and testis over here, you have got a muscle like this. So what is the name of this muscle? This muscle is called as your cremasteric muscle. Okay, this muscle over here is called as your cremasteric muscle. So this muscle over here is called as your cremasteric muscle. Okay, so what is the name of this muscle? This muscle is your cremasteric muscle over here. Now there are some sensory branches, right? There are some sensory branches that are taken. Okay, let me put the sensory branches. See, there are some sensory branches that are taken all the way up. You see, sensory nerves that are taken all the way up like this, and from here you have got another branch here. Now from here you come across the motor branch that supplies all the way down over here. Okay, all the way down. Motor branch supplies all the way down to this muscle. So collectively this nerve is called as which nerve? This is called as genitofemoral nerve. Genitofemoral nerve. This genitofemoral nerve is having two important branches, genital branch as well as femoral branch. So this sensory branch is called as a femoral branch, and this motor fiber is called as a genital branch. Genital branch. So what is this cremasteric reflex is that whenever you are stroking the skin on the medial side of the thigh, inner thighs, when you are stroking the skin, right? So let us say this is the thigh, and here you have got the testis, right? This is the thigh over here. So when you are stroking the skin on the medial side of the thigh, what is going to happen is that the femoral branch will take the impulse up, right? It is going to take the impulse up like this, and then it will activate your genital branch, and genital branch will contract your cremasteric muscle, right? So when it will contract your cremasteric muscle, the ipsilateral testis is ascended up. I mean, one side of the testis is retracted up. So there is ipsilateral contraction of testis. So this is a normal thing. The testis along with the cremasteric muscle, it is ascended up over here. So that is called as your cremasteric reflex. So that is the only thing which you need to know over here. Hello guys. So now we shall be discussing regarding the derivatives. Okay, derivatives of foregut, midgut as well as hindgut. After this we will discuss about the omentum, the lesser omentum, greater omentum, and all the basics which are needed for you to answer in your exams. Okay, so first of all, if you look at the foregut, how many parts of the gut we have got? We have got 3 embryological derivatives, that is foregut, midgut and hindgut. All of you know that. So you have to exactly know foregut will develop into what all structures of your intestine. Okay, so first I'll show it in this particular picture, then later on we will write it down. Okay, so foregut will develop into one important thing, that is your esophagus. Okay, foregut will develop into your esophagus. Next, it is developing into your complete stomach, right? Now if you look at the duodenum, this is your duodenum, right? It is developing only till the upper half of the duodenum, not the lower half of the duodenum. So what do you mean by upper half of the duodenum? The place where, see, into the duodenum the ducts are opening, all of you know, right? So upper half of the duodenum in the sense up to the opening of common bile duct, it is, right? For example, all of you know that we have got a right hepatic duct, left hepatic duct. Together they join and form common bile duct. Okay, common bile duct, right? This is common hepatic duct. Cystic duct is also the cystic duct, and common hepatic duct together form the common bile duct. Okay, you know that this particular common bile duct joins with a duct of the pancreas. Okay, so what do you mean by upper part of the duodenum, in the sense up to the level where this common bile duct was opening. So below that, for example, if common bile duct was opening at this point, okay, so till here this entirely is formed by what? It is entirely formed by foregut. Below the opening, let us say the common bile duct opening was here. So from below the opening or distal to the opening of common bile duct, you have what? The lower half of the duodenum. So upper half of the duodenum, that is at the opening of the common bile duct, till there it is upper half of the duodenum, that is formed by the foregut. Right, now coming to the midgut, the lower half of the duodenum, it means below the opening of the common bile duct. Okay, much more clearly if I want to tell you, actually speaking, directly common bile duct will not open. Common bile duct along with the main pancreatic duct, they join and form hepatopancreatic duct. Okay, so that will open here. So let us say this is the duodenum over here, and now I am drawing this common bile duct over here. Okay, actually it is called hepatopancreatic duct. Okay, so about till here it is formed by foregut. Next, from below the common bile duct, this part of the duodenum is formed by your midgut. Okay, so midgut is formed by the lower half of the duodenum, the complete jejunum, right, the complete ileum. Next we have got the cecum. Next we have got the appendix. Here we have got the cecum, this is the appendix. Next we have got the ascending colon, and coming to the transverse colon, only the right part, right? This entirely is transverse colon. So I'm dividing the transverse colon into right part of the transverse colon and the left part of the transverse colon. So right 2/3 of the transverse colon, till here it is formed by the midgut. Now when it comes to the hindgut from the left 1/3 of the transverse colon and then the entire descending colon, sigmoid colon, right? Rectum and anus in the sense this is your anal canal, only the upper part of the anal canal, only the upper part of your anal canal. So if we write down all the things that are formed over here, so first we will write the derivatives of your foregut. Okay, so what are the derivatives of foregut? I have told you foregut will develop into your esophagus, stomach and upper half of duodenum. Okay, upper half of duodenum in the sense at the opening of common bile duct. Okay, after that we have got the next important thing that is called as a midgut. Next important thing we have got over here that is called as a midgut. Now what do you mean by the midgut over here? Midgut starts from the lower half of the duodenum, the lower half of duodenum. Midgut starts from the lower half of the duodenum. Lower half of the duodenum in the sense distal to common bile duct. I mean below the common bile duct or distal to common bile duct. Right? After that, after duodenum, you have got purely your jejunum, you have got ileum, you have got cecum. Right? Attached to the cecum, what do you have? You have got appendix. You have got ascending colon and right 2/3 of transverse colon, right 2/3 of your transverse colon. Okay. After midgut, the next important part is your hindgut. So what are the structures that hindgut is developing into? So the right 2/3 of transverse colon is the midgut, then the left 1/3, of transverse colon, next you have got the descending colon, next you have got the sigmoid colon, okay, and you have got the rectum and upper part of the anal canal, upper part of anal canal. So these are the structures that are formed over here. So foregut, midgut as well as hindgut over here. Okay. So these are some of the very important derivatives which you have to know. The next important part is we shall be discussing about the omentum and its regarding the peritoneum. What is lesser peritoneum, right? What is visceral peritoneum, parietal peritoneum, lesser sac, greater sac, right? So all these important things we shall discuss right now. Okay. Right, let us say that this is the structure and I am drawing two structures over here. If you can see, yeah, the structure which I have drawn with the red, that is an organ. Let us say that is one part of your intestine, whatever it might, just tell it as an organ. Okay. Now what is this black color one? This black color one in future it is going to form your peritoneum. Okay, so what is this black color one over here? This is called as your peritoneum, and this one over here is called as your organ. Now if you look in the next picture, what is happening is that this is what happens in the next picture. Now you should see and tell what is happening. What is happening over here? What is happening here is that this particular organ is insulating inside. So what is happening here? The organ insulates inside. So as the organ is insulating inside, what is happening? You can see two layers, right? So this is your outer layer over here, and this particular layer over here is called as the inner layer. Yes or no? So just imagine a balloon, right? Just imagine a balloon. So you have got the balloon, right? Completely filled with the air. Now what you do is that you poke the finger into the balloon. Now when you poke the finger into the balloon, the layer that is attached, the layer that is completely surrounding your finger is called as the inner layer, and the layer which is not attached to your finger is called as the outer layer. Clear all of you? So that is a thing. So we have got inner layer and we have got outer layer. Now this will further develop into one more important structure over here. So let us put this thing over here. Yeah. Now look how it is developing furtherly. The insulation becomes more. It means the organ is more insulated deep inside, and this is how it is formed. You see what has happened? The organ has penetrated more deep inside. Now you can see perfectly two important layers. So this is the pure outer layer. So you call this as outer parietal layer. Outer parietal layer. You call this as what? You call this as outer parietal layer. And this part of the layer which is purely connecting, except at this point, the remaining point around 99% of the organ is completely surrounded by this layer. So this is called as the inner visceral layer. This is called as the inner visceral layer. Okay. This is called as your inner visceral layer. So you have got outer parietal layer and inner visceral layer. Now, if you look carefully, that here you see a double layer, right? What did I tell? I told this entire black color thing is your peritoneum. Peritoneum is having two layers. How many layers? Two. Outer parietal layer of peritoneum and outer visceral layer. So peritoneum is divided into parietal peritoneum and visceral peritoneum. But here you can see that there is a double layer fold of peritoneum. This double layered fold of peritoneum has given different names. For example, this particular double layered peritoneum, whatever is there, this is your double layered peritoneum. Okay, this double layered peritoneum is attached to one end of the organ, right? For example, let us say this organ is your intestine. What is this? Let us say this is your intestine. What is this? This is your intestine. For example, if this is a small intestine, this organ is a small intestine. See, if this is your small intestine which is in the form, let us say this is your small intestine which is in the form of a loop. You see the loops over here? You see the loops like this, right? Small intestine is in the form of a loop. Now what I'm doing here is that I'm just making a transverse section. When I make a transverse section, if you're looking from the top, this is how it looks, right? And what is happening surrounding this small intestine? You see a double layered peritoneum. This double layered peritoneum surrounding your small intestine is called mesentery. It is called what? Mesentery. I hope you have heard a term mesentery a number of times. For example, this organ is a colon. Whatever it might be, sigmoid colon, ascending colon, descending colon, transverse colon, whatever it might be. If this organ is a colon, then surrounding this colon, you see visceral peritoneum, and you also see a double layered fold of peritoneum. This double layered fold of peritoneum near to this colon is called as mesocolon. Mesocolon. In the same way, if this organ is stomach, then what is this double layered fold of peritoneum that is attached to the stomach? That is called omenta. That is called what? Omenta. So you have omenta. I am pretty sure that you have heard of these three important names separately. So there is something called mesentery, mesocolon, omenta. So names might be different, but the overall meaning is same, right? A double layered fold of peritoneum, if it is covering your intestine, like small intestine, you call mesentery. Colon, which is large intestine, you call as mesocolon. For example, you call ascending mesocolon, transverse mesocolon, descending mesocolon, right? For example, if I tell stomach, that is omenta. Okay, there are two types of omenta, you know, lesser omenta, greater omenta. So regarding the details, we'll go it later on. And remember one thing, this inner layer is called as your visceral layer. This inner visceral layer of your peritoneum is also called as mesothelium. This inner layer of this inner visceral layer is called as your mesothelium. What is it called? Mesothelium. And what is this particular mesothelium lined by? I mean, what is the type of epithelium? Simple squamous epithelium. Okay, simple squamous epithelium. It is made up of what? Simple squamous epithelium. Okay, So regarding this particular picture which you can see, we will come to this particular picture later on, right? So let us continue discussing the things right now. Okay. Now one very important thing you need to know, that the male peritoneum, whatever is there, the peritoneum which is present in the males, okay, the male peritoneum, the male peritoneum whatever is there, right? So this particular male peritoneum is actually a closed sac. What is this? This male peritoneum is actually a closed sac. Why am I calling it as closed sac? The peritoneum is completely closed, no opens, no openings, okay? It is a closed sac peritoneum. It is a closed sac peritoneum. In the same way, the female peritoneum, whatever is there, the female peritoneum is called as the open sac peritoneum. The male peritoneum is a closed sac peritoneum, the female is an open sac peritoneum. For example, let us talk like this. See, let us say you have got your urinary bladder like this, okay? Attached to urinary bladder, there is no gap, directly you will have urethra. Okay, this is the bulbous part of the urethra like this. Clear? Next important thing is you have got ureters like this, you have got kidney. Okay, ureters and kidney. Here you have got ureters and you have got kidney. Now if you carefully look, the peritoneum that is completely surrounding this, is completely closed. Why am I telling closed? Because if you enter through the urethra, from the urethra you are reaching up to the bladder, from the bladder you enter into the ureters, from the ureter you enter into the kidney, and kidney is completely closed. You see, the entire peritoneum is completely closed, right? So this peritoneum that is lining the males is not in contact with the peritoneal cavity. It is not at all in contact with peritoneal cavity. Okay, let us talk about the females. Why in females it is called as open part? For example, let us say this part over here is called as your vagina and the cervix. Okay, and let us say that this is the uterus over here. Now attached to the uterus, what do you have? You have got fallopian tubes. Let us say fallopian tubes are present. Okay, and fallopian tubes are fimbriated like this, all of you know. And let us say this is your peritoneum. This particular cavity with the green color shade, whatever I am giving, let us say this is your peritoneum. What is this? This is your peritoneum. Okay, peritoneal cavity. What is this? This is your peritoneal cavity. Now look here, in the females, from the vagina, right, there is continuation into the cervix. From the cervix is in contact with the fallopian tubes, and fallopian tubes are in contact with the peritoneal cavity. It means it is open. Yes or no? But in the males it is completely closed. So that is why the male peritoneum is a closed sac peritoneum, but the female peritoneum is an open sac peritoneum. Now embryologically, how do you classify this peritoneum? So let us discuss about the classification of peritoneum embryologically. Classification of peritoneum embryologically. Okay, so if you look here, embryologically how it is classified. For example, from the side if you are looking at me, right, this wall whatever you are looking, this is called anterior abdominal wall. On the back, whatever wall I have, that is posterior abdominal wall. Between anterior abdominal wall and posterior abdominal wall, in the center, what do I have? I have got the gut. Clear? For example, this is your anterior side, the anterior abdominal wall, and this is your posterior, which is on the back, posterior abdominal wall. So in the center, what do you have? In the center you have got a developing gut. Now this gut is perfectly straight. It did not take any shapes. Why? Because it is not yet developed, right? So this is the gut. And by the way, again, let me write this. This is your anterior abdominal wall. This is your posterior abdominal wall, and this part over here is called as your gut. Okay, now how can you see all these three layers? Can you see from the front? Can you see from the back? No, only you can see is laterally. So from the lateral, and by the way, this is your lateral view. From the lateral view, this is how you can see. Now there is a fold of peritoneum. Listen carefully. Now there is a fold of peritoneum. There is a fold of peritoneum that is attached from anterior abdominal wall to the gut like this. You see, there is a fold of peritoneum that is attaching anterior abdominal wall to the gut. This fold of peritoneum is called anterior mesogastrium or ventral mesogastrium. What is this fold of peritoneum called? This fold of peritoneum is called as ventral mesogastrium. Ventral mesogastrium. In the same way, you even have got a fold of peritoneum that is attached from the gut to the posterior abdominal wall. From the gut to the posterior abdominal wall. And this mesogastrium is called as a dorsal mesogastrium. We have got two mesogastriums. One is ventral mesogastrium, another one is dorsal mesogastrium. So the ventral mesogastrium, the dorsal onto the dorsal mesogastrium here, we have got three important blood vessels. See, there is one blood vessel like this supplying to the foregut, there is one blood vessel supplying to the midgut, there is one blood vessel supplying to the hindgut. What are these blood vessels? If you remember, yes, we have discussed this. This blood vessel is called as celiac trunk. Celiac trunk, you remember, right? It is present at the level of T12, and this one is called as superior mesenteric artery, present at the level of L1, and this one is called as a inferior mesenteric artery, present at the level of L3. These are the three things we discussed. So now you understood what is ventral mesogastrium, what is dorsal mesogastrium. Okay, what is ventral and what is dorsal mesogastrium. If I make a transverse section, if I make a section, if I cut it like this, how does it look? How does it look? The center you have got an organ like this, right? So here you have got ventral mesogastrium, here you have got dorsal mesogastrium, right? Ventral mesogastrium and dorsal mesogastrium. Okay, so what is this particular one? This particular one over here is your ventral mesogastrium. This one over here is called as dorsal mesogastrium, ventral and dorsal mesogastrium. And this is your anterior abdominal wall, and this one over here is your posterior abdominal wall, Now look in the next stage what is going to happen. So this is a continuation down here. In the next stage again, let me draw this thing. This is your anterior abdominal wall over here. This is your posterior abdominal wall. In the next stage, slowly this particular gut will start to take some changes, right? So there are some shapes that are appearing within the gut. You see, within the gut there are some shapes that are happening here. And again the same, this is the same. Ventral mesogastrium is same again here, right? And back here you have got the dorsal mesogastrium. This is also the same. Nothing has been changed. Now look at the next stage of development. In the next stage of development only you would see the things here, important things. Let us say this is your anterior abdominal wall. This is your posterior abdominal wall. Now the organs, the intestines are taking perfect shape, right? So esophagus has taken a perfect shape. Slowly stomach has taken a perfect shape, right? Duodenum and the small intestine, right? The jejunum and ileum, they are like bowel loops. So they are also taking the shape like this. You see, the bowel loops are also taking a shape. See, this is a duodenum and the bowel loops are taking a shape. You see? The bowel loops are also taking its own shape in this way, right? Now remember one thing, there are two important points you need to remember, that these bowel loops are taking their shape. Yes or no? These bowel loops are looping so much that these bowel loops can even push the anterior abdominal wall forward like this. You see, they have pushed the anterior abdominal wall forward like this. Now as they have pushed the anterior abdominal wall forward, you see a kind of swelling on the anterior abdominal wall. You see a bumpy swelling, right? Any bumpy swelling you see in the abdominal wall, you call it as a hernia. But this hernia is happening because normally hernias happen when the muscles, they become weak, right? So if this is the entire abdomen, this part of the abdomen, the muscles are weak, so hernia can happen here. It means the bowel, the loops of intestine can protrude outward like this. Okay, for example, here Here the muscles are good, but still during the development this is happening, right? During the development, the abdominal wall contents are herniating in through the anterior abdominal wall. So such kind of hernia, you call it as what? Physiological hernia. So physiological hernia is a normal hernia that happens during the development. Clear? That is a normal hernia. Now, because of this bowel, because of this small intestine that is completely creating a hernia here, right? So what has happened is that, you know that we have this ventral mesogastrium. So this bowel loop has separated the ventral mesogastrium into two parts. You see, this is a ventral mesogastrium over here, and there is no ventral mesogastrium down. Remember that thing. The bowel loops have created a channel in between, a bridge in between the ventral mesogastrium. As a result, there is only ventral mesogastrium on the top. There is no ventral mesogastrium down. But posteriorly, do you have any kind of interruption? No. So posteriorly, the ventral mesogastrium is fine. The dorsal mesogastrium. Posteriorly, the dorsal mesogastrium is fine, right? So here, this is your ventral mesogastrium. This is your ventral mesogastrium. This is your dorsal mesogastrium, and there is no ventral mesogastrium down. Okay. Now what we will do? What we will do is that so obviously, from the ventral mesogastrium only ligaments will start developing, and some of the organs start developing here. Even from the dorsal mesogastrium also some ligaments start developing. Now we have to discuss those ligaments, yes or no? So we will discuss which part here, which section we will discuss. We will discuss at this level. Why are you not discussing at this level? Because here we don't have any kind of mesogastrium only. Then why we will discuss here? Here we have got both ventral mesogastrium and dorsal mesogastrium. So what I will do, I will draw the stomach, right? And I will draw what organ is developed here and what organ is developed here and what are the ligaments over here. Okay. Again, I am drawing the same picture over here. So here we have got the anterior abdominal wall, and let us say this is your posterior abdominal wall. Okay. And this is the gut. This is your esophagus, and this is your stomach over here. Stomach and the duodenum. Stomach as well as your duodenum over here. Okay. So let me draw the duodenum like a duodenum. Yeah, this is the duodenum. Now what is happening is that slowly an organ is developing in the ventral mesogastrium. Slowly an organ is developing in the dorsal mesogastrium. If I ask you, where is spleen? The spleen is present in the region of dorsal mesogastrium or ventral mesogastrium? Dorsal. Right? So liver is developing from where the liver is developing? The liver is developing within the ventral mesogastrium. Now usually here, let us say I am removing the liver now. Previously, what do you know? What do you know is that here you know that you have got ventral mesogastrium. So till where you have got the ventral mesogastrium? Till the first bowel loop, right? So till the small intestine, let us say till here you have got the ventral mesogastrium. Here there was no ventral mesogastrium. And where is liver developing now? Liver is developing all the way in the center. Now because of this liver that is developing in the ventral mesogastrium, you see what did this liver do here? The liver has separated ventral mesogastrium into two parts. See, this is called as the anterior part of the ventral mesogastrium. This is the posterior part of the ventral mesogastrium. So from the anterior abdominal wall to the anterior surface of the liver, whatever ventral mesogastrium you have got, this is called as the anterior part of the ventral mesogastrium. From the posterior surface of the liver to the lesser curvature of the stomach, whatever mesogastrium you have got is the posterior part of the ventral mesogastrium. Clear? Now let us look in detail what these structures are developing into. Okay. So let me draw the picture little more clear. So here there is a developing what? This is a developing liver. And if that is a developing liver, then this particular ventral mesogastrium is the anterior part of your ventral mesogastrium. What is this? Anterior part. Okay. And this ventral mesogastrium is ending at a point. What is this point? This point is called as your umbilicus. In the anterior abdominal you have got umbilicus. So this ventral mesogastrium is ending at the level of umbilicus. Okay. Next, you even have got ventral mesogastrium on the back like this, right? You see, there is ventral mesogastrium on the back side also, back to the liver. Now, what is this called as? Yes, what is this particular one called? So, this part of the ventral mesogastrium is called anterior ventral mesogastrium. Anterior ventral mesogastrium. This is called as posterior ventral mesogastrium. Anterior ventral mesogastrium will develop into falciform ligament. Posterior mesogastrium will develop into two important structures. What are those two important structures? Now you see that this structure is connecting. The liver and the stomach. So what is this structure should be called as? Hypogastric ligament. What is this? Hypogastric ligament. And what is this structure? Hepatoduodenal ligament. So I am writing it as hypogastric ligament, and this is hepatoduodenal ligament. Hepatogastric and hepatoduodenal are developed from posterior part of ventral mesogastrium. So both of them together you call it as lesser omentum. Both of them together you call it as what? You call both of them together as lesser omentum. Okay, what do you call both of them? Lesser omentum. So what is the important thing you need to know? As a result of the liver that is developing, right? So this liver has divided the ventral mesogastrium into two parts. This liver has divided the ventral mesogastrium into two parts. What are those two parts over here? From anterior abdominal wall all the way to the anterior border of liver. You see here, from the anterior abdominal wall to the anterior border of liver, whatever you have got over here, what is this? This is called as your falciform ligament. Okay. In the same way, from the posterior abdominal wall of what? Liver. I'm sorry, not the abdominal wall. From the posterior border, right? Posterior border of liver till the posterior abdominal wall. What do you call it as? This is called as lesser omentum. So this particular lesser omentum is divided into two parts. One is called as hepatogastric, right? Another one is called as hepatogastric ligament and hepatoduodenal ligament. Clear? So this is the important thing which you need to know. So this is a final part which you need to understand over here. So from today onwards, if I ask lesser omentum is having how many ligaments, that is your hepatogastric and hepatoduodenal. Okay. So if I ask falciform ligament is, it is derived from what? It is derived from ventral mesogastrium or dorsal mesogastrium, anterior part of ventral mesogastrium. Now coming to the posterior side. What about the dorsal mesogastrium? So dorsal mesogastrium also, here you have got dorsal mesogastrium, right? And by the way, don't forget that here you have got your diaphragm. This is diaphragm. This is your right hemidiaphragm. This is your left hemidiaphragm, for example. Now the dorsal mesogastrium, which is attaching to the dorsal mesogastrium, I'm just changing the color, okay? The dorsal mesogastrium which is attaching to the diaphragm, now you have to call this dorsal mesogastrium as gastrophrenic ligament. So gastrophrenic ligament is derived from dorsal mesogastrium. In the same way, the dorsal mesogastrium from the posterior, from the greater curvature to the anterior border of the spleen. You see, this is the greater curvature. This is the anterior border of the spleen. So the dorsal mesogastrium that is attaching the anterior border of the spleen to the greater curvature. you call this particular one as gastrosplenic ligament. Gastrosplenic ligament. Okay. Next, the remaining part of your dorsal mesogastrium is just hanging down. It is not attaching to anything. You see, it is just hanging down but not at all attaching to anything here. So this part which is not at all attaching to anything, you can see here. You see, it is just hanging down, not at all attaching to anything. And this is originating from where? From the greater curvature, right? So this is called as your greater omentum. Greater omentum. So now you understood clearly what is greater omentum. Greater omentum is a derivative of what? It is a derivative of your dorsal mesogastrium, right? Gastrosplenic are also developed from the dorsal mesogastrium. So ventral mesogastrium also, you know the story right now. Okay. Now let us go back to this particular picture. Now look here. Here what did you understand? There are two ligaments here, hypogastric, hepatoduodenal. Both of them together you call it as lesser omentum. And here you have got, what is this? This is your gastrophrenic ligament and this is gastrosplenic ligament. And there is another one, that is your greater omentum, which is just hanging down. One very important point you need to understand over here in case of greater omentum is that this greater omentum is having dense patches of macrophages. You see, there are dense patches of macrophages. What is the use of that? These are also called as milky spots. Milky spots that is responsible for the defense, right? Defense, immunity, right? So that would fight against any kind of infection over here. Okay. So this dense patch of macrophage or the milky spots is very important over here. Okay. This is very important part. So these are some of the important things which you need to know over here, right? These are some of the important things which you need to know. Now apart from this, you have to understand what are peritoneal folds. Most of the folds I have already discussed just before. Okay, just interchanging the terms. In the peritoneal folds, we will discuss what are the ligaments. Okay. So what is a ligament called? What is a ligament called is that any bilaminar fold of peritoneum, which I have already told you. If this is an organ, right, you see this is a peritoneum and this is a bilaminar. You see two layers are surrounding it. So that is why you call it as bilaminal, right? What is this? Bilaminal fold. Bilaminal fold of peritoneum. So this one over here is called as your ligament. What is this called? Ligament. Okay. So where do you find this? You would find this attached from one organ to another organ, or it is attached all the way from the organ to the abdominal wall. Okay. What do I mean by that is, here I have got one organ, here I have got another organ, right? So surrounding this like this, there is a fold of peritoneum and there is a double layer like this, again surrounding this. You see, from organ to organ, you see this double layered fold of peritoneum. This is called as ligament. For example, if you can see here, organ to organ, liver is one organ, stomach is one organ, organ to organ, what do you have? Hepatogastric. What did you call this as? Ligament, or you called it as omentum? You call this as ligament. Hepatogastric ligament. And what is this? Hepatoduodenal ligament. Together you call it as lesser omentum. Organ to abdominal wall is also called as ligament. See, this is organ, this is abdominal wall. Together what did you call here? Ligament. What ligament? Falciform ligament. So organ to organ, if there is any double layered fold of peritoneum, you call that as a ligament. Organ to abdominal wall also you call it as a ligament. So here again, organ to organ, what is this? Gastrosplenic ligament. Clear? So this is one important thing. So this is the definition of your ligaments. Now second important thing is that what is omentum? What is the meaning of omentum? What is the meaning of omentum? I have already given you in the starting. You see, double layer peritoneum. If it is related to the stomach, you call it as omentum. Okay, if it is related to the stomach, you call it as omentum. If it is related to the lesser curvature of the stomach, you call it as lesser omentum. If it is related to the greater curvature of the stomach, you call it as a greater omentum. Okay, so what you should write over here regarding this omentum? This is a peritoneal fold. Peritoneal fold that is related to stomach. Peritoneal fold that is related to the stomach over here. Clear? Now what I am going to do is that I am going to make a sagittal section. So in this sagittal section, see, if I am going to cut my body into right half and left half, right? So once after cutting the body into two halves, see, again I am explaining the picture over here. This is a body, right? So you are cutting it into two halves. The right half, see the right half, this is the left half. Now I have removed the left half. Now this is the right half, right? So this is the surface which is covered and this is the surface which is exposed, right? The inner organs are exposed. Now here also you see that this is your anterior abdominal wall, back is your posterior abdominal wall. And what are these? These are your cut organs, right? If this is a loop of duodenum, that is cut section. This is the, let us say, small intestine, cut section, right? So all the cut parts are there. So when I am showing it to you, you can see a circle of small intestine, a circle of large intestine, a circle of liver, a circle of stomach, like that. I hope you are understanding, right? So that same picture we will draw. Okay, so once again, here what do I have again? This is your anterior abdominal wall with an umbilicus. Okay, here I have got my posterior abdominal wall, anterior and posterior abdominal wall over here. Yeah, anterior and posterior abdominal wall. And remember one thing, that here I have got what? Here I have got liver. What is this? Liver. Just beneath the liver I have got this particular structure over here. What is this? This is your stomach. That is your stomach. Next, here I have got part of the colon and this is called as your transverse colon. Okay, transverse colon. And down here I have got small intestine. Okay, here I have got sigmoid colon. What do I have got? Sigmoid colon. And anteriorly, don't forget that you have got the bladder over here, and posteriorly what do you have? Posteriorly here you have got your rectum. Posteriorly you have got your rectum over here, bladder and rectum, like this. Okay, so you have got your bladder and you have got the rectum, like this. Clear? So what is this? This is your umbilical region. Clear? This is your umbilical region. Now okay, let me write down these names over here. So this is your liver. Okay, this is your stomach. Clear? This is your transverse colon, this is your small intestine, and this is your sigmoid colon, this is your bladder, and this is your rectum. This is your rectum over here. Okay, so now you understood, this is your anterior abdominal wall, and this is your posterior abdominal wall, So for those who are not still understanding, again I am telling you that this is a body here. Right now this is my body. You see the loops of duodenum like this within my intestine. Now what did you do? You cut my body like this. When you have cut my body, there is a right half, there is a left half. Left half I have removed. So this is a right half. You see, this is a right half. This is the body closed, right and left half. Okay. Now within the right half, you see this part is completely closed, but this part is open. Now I am turning it to you. Right. You can see this is the anterior abdominal wall, posterior abdominal wall, and these are the cut section of the organs which you can see. Now look here. What are the layers that are surrounding over here? So here you can see this is one layer of peritoneum. Now see how this layer of peritoneum, we are tracing the layers of peritoneum. Now this layer of peritoneum is covering your liver, is covering completely your anterior surface of the liver, and then this is also covering your stomach, where lesser curvature of the stomach, right? It is also covering a lesser curvature of stomach, and then it is hanging down like this. Clear? And then it goes on to the back and covers your transverse colon. Yes or no? Transverse colon, and then to the posterior abdominal wall. Again it is coming in the front, covering your small intestine to the posterior abdominal wall. Okay, you will understand once I finish up the picture. Okay, next it is again coming forward, covering your sigmoid colon to the posterior abdominal wall, and again it is coming forward and covering the rectum, forming a small pouch. You see a pouch that is formed, and it is covering your bladder and then goes and attaches to your umbilicus, joins your umbilicus. Okay, so whatever sac, this is entire closed sac, whatever sac I have drawn is very big, right? So that is why this big sac over here which I have drawn right now is called as greater sac. What is this? Greater sac. This entire sac is a greater sac. You see, this entire sac, this entire cavity, whatever is there here is called as your greater sac. Now let us look at another important sac over here. See, this particular sac again starts from the bare area of the liver, okay, and then it even covers your stomach like this. There is a fold that is coming down, and now it is, now look here, it is covering your transverse colon and then all of this to your posterior abdominal wall. Now tell me, this sac is greater, sac A is greater or sac B is greater? Sac B is greater, so that is why you called as greater sac. Now I am telling you that the sac A is called as the lesser sac. Sac A is called as what? Lesser sac. Now remember one thing, this lesser sac is also given another name called as omental bursa. This is called as omental bursa. What is the lesser sac given another name? Omental bursa. Next important thing, any double layered fold of peritoneum. Double layered fold of peritoneum, where did I tell? Yeah, any double layered fold of peritoneum that is related to the stomach is called omenta, right? Now look at this picture. Look at this picture. You see a double layered fold of peritoneum over here that is related to the stomach. Again, you see a double layered fold of peritoneum that is attached to the stomach. So can I call this particular one over here as omenta? This particular one over here as omenta. What omenta? Lesser omenta. Lesser omentum. Why are you calling it as lesser omentum? What did I tell you before in this picture? So towards the lesser curvature of the stomach, the omentum which you have over here is lesser omentum. Greater curvature of stomach, it is greater omentum. So look here, this part is the lesser curvature, this part is the greater curvature. So here in the lesser curvature, this double layered fold of peritoneum is called lesser omentum. Then where is greater omentum? You see near the greater curvature, you see this fold of peritoneum over here, this hanging part, this is called as your greater omentum. I hope now you are clear. So this is called as your greater omentum. So now you understood where is lesser and where is greater omentum. Next important thing, what is the next important thing is that you see here also you see a double layered fold of peritoneum. You see here also you can see a double layered fold of peritoneum that is attaching. What is this double layered peritoneum doing? Attaching a transverse colon to the posterior abdominal wall. Colon, any double layered peritoneum attached to colon, you should call it as mesocolon, right? So what you should call this as? You should call this as transverse. This double layered fold of peritoneum is transverse mesocolon. Okay. Next, you also see a double layered fold of peritoneum that is attaching small intestine to the posterior abdominal wall. So this is called as what? Mesentery. What is this called as? This is called as your mesentery. Okay. In the same way, you can also see a double layered fold of peritoneum that is covering your sigmoid colon to your posterior abdominal wall. Again, colon in the sense, this double layered peritoneum is called mesocolon. So you have to write it as sigmoid mesocolon. Sigmoid mesocolon. Second important thing is that you see a sac. You see a sac here. This is a sac that is located between bladder and rectum. So you call this sac or pouch as recto-vesical pouch. Recto in the sense rectum, vesica in the sense bladder. So why am I telling you this thing is that, for example guys, if there is a rupture of liver, let us say liver rupture ho gaya, let us say stomach rupture, whatever it is. So when there is rupture of liver, when there is rupture of the lesser curvature of the stomach, transverse colon, small intestine, what will happen? The fluid will finally enter into the greater sac. From here the fluid will escape and accumulate where? In your rectovesical pouch. Okay, so keep that thing in your mind. That is very, very, very important clinical point which you need to know. Okay, now what we will do is that we will actually make a transverse. If this is my body, you are making a section at the level of the liver. Okay, you are making a section and you are looking from the top. So when you make a section and look from the top, this is how it looks. This is a section. So in this particular section, where is your liver? So let us say this is your liver. Okay, let us say this is your liver over here. Okay, and here you have got your stomach. Here you have got your stomach, and on the left side, what do you have? You have got spleen. Let us say this is your spleen. Okay, and where is your right and left kidney? See, this is your kidney over here. This is your, yeah, what is this? This is your right kidney. The previous one which I have drawn was your left kidney. And not to forget that this part, obviously this is your vertebra over here. This is your vertebra. Next, above this I have got aorta. This is your ascending aorta. And what is this? This is your inferior vena cava. Ascending aorta and inferior vena cava. So let us write these things down. This is your liver. This is your stomach. This is your spleen, SPL, spleen, right? This is your right kidney, right? Why right kidney? Because it is present below the liver. Where is liver? Liver is on the right. And this is your left kidney, okay, left kidney. Now let us look how these peritoneal folds are attached over here. Okay, let us start from the liver itself. So let us start from the liver itself. Okay, so you see a fold of peritoneum like this. You see a fold of peritoneum that is completely attached to the liver over here. So this fold of peritoneum, first it is covering your, what is this? This is covering your kidney. Which kidney? Your left kidney. Then it is covering all the way your spleen. Yes or no? Next, it is covering all the way to your stomach. Now important thing is that after covering to the stomach, this is an extra fold of peritoneum that is coming down. Okay, or you can say that this fold of peritoneum, okay, let me draw the double layer. Okay, this is a double layer. Now tell me, what is this double layered fold of peritoneum related to stomach? You should call it as lesser omentum. So can I call this part of the lesser omentum as a free margin of the lesser omentum? Free margin of lesser omentum. So this is completely surrounding your stomach and spleen over here, and then over aorta, then inferior vena cava over here, and then finally your right kidney. Now tell me, look here, stomach on both the sides, up and down, it is surrounded by peritoneum. Spleen on all the sides, again it is surrounded by peritoneum. But look at the kidneys. Kidneys only on one side they are covered by peritoneum, on the other side they are covered by what? Posterior abdominal wall. Again, what is this abdominal wall? This is your anterior abdominal wall, this is posterior abdominal wall. So such kind of organs are present behind the peritoneum. You call them as retroperitoneal organs. So kidneys are an example of retroperitoneal organ. Okay, there are many other organs which are retroperitoneal. So all of you just look here, this is your kidney. Now this comes all the way, covers your entire posterior abdominal wall like this and attaches like this. Clear? Now let us discuss what are the important things you have to know over here. Now what did I tell you? Any fold of peritoneum connecting organ to organ is called ligament. So what is this particular ligament over here? Tell me. Connecting spleen to stomach. This is called as gastrosplenic ligament. You heard of this previously, I discussed, right? So this is your gastrosplenic ligament. This is your gastrosplenic ligament. In the same way, tell me, what is this ligament connecting your spleen to your kidney over here? This is called as your linorenal ligament. Linorenal renal ligament. This is called as your linorenal ligament over here. Okay. Next important thing is that what is this part, this structure over here? This is your right, what is this? This is your right free margin of your stomach. This is your right free margin of stomach. I mean your lesser omentum. Right free margin of your lesser omentum. This is your right free margin of your lesser omentum. So why is this so important? Why is this so important is that, let me rub this down and explain. Why is this so important is that within this you have got a vein. This vein is called as portal vein. Next you have got an artery. This artery is called as hepatic artery. Next within this you have got a duct called as common bile duct. So what do you have? You have got a vein called as portal vein. You have got an artery called, what is this artery called as? Hepatic artery and common bile duct. So let me write this thing. This is your PV. PV is your portal vein. Okay. Next here what is this? Hepatic artery. And what is this? Common, what is this? Common bile duct. So three of them together, what do you call? Porta hepatis. Where is porta hepatis present? That is present in the right free margin of lesser omentum. So here you have got porta hepatis. Porta hepatis, which is having portal vein, hepatic artery, common bile duct. Portal vein, hepatic artery as well as common bile duct. Now let me highlight one very important area for you. Yeah, you see this area, right? You know this area is starting all, see one side of this area is completely closed. You see there are closed borders all over here. Everywhere it is closed, but there is only one place that is open. You see this small, very narrow opening over here. This small narrow opening, whatever you can see this particular, this small narrow opening, which I will highlight it with the green. Okay, you see this small narrow opening here. This small narrow opening is opening into a wider canal. You see, it is opening into a wider cavity like this. This is your entire wider cavity. This is opening into your wider cavity. So any cavity which is very wide is called as greater sac or lesser sac? Greater sac. Then what this one should be called as? Lesser sac, and the remaining is greater sac. You see, this is all the greater sac over here. So this is all the greater sac over here. So there is only one small opening from where if you are standing in the lesser sac, you can enter into the greater sac only through this particular opening. So this particular opening, you see this particular opening which I am drawing with the dotted lines over here, this particular opening over here is called as what? That is called as epiploic foramen. So what is that opening called as? That is called as epiploic foramen. So epiploic foramen is also called as foramen of Winslow, foramen of Winslow or epiploic foramen. Now to this foramen of Winslow or epiploic foramen, there is an anterior border, there is a posterior border, there is a superior border, there is an inferior border. Okay, so what is anterior border consisting of? What is anterior border consisting of? Look here. If this is your foramen of Winslow, anterior is on the top. Anterior border is consisting of porta hepatis. Posterior in the sense down. Down what do you have? You have got inferior vena cava, and here you will have an organ called as, gland called as right suprarenal gland. Both of them are located down. So on the top of this, what do you have? On the top, again, just zoom in here. You see on the top, what do you have? If this is a foramen, on the top you have got porta hepatis, down you have got two structures, inferior vena cava, and here I did not draw that is your right suprarenal gland, right. Anteriorly I have got porta hepatis, which is also called as the right free margin of your lesser omentum. Next, posteriorly you have got inferior vena cava and right suprarenal gland, Superiorly what do you have? Here you cannot say superiorly because this is a section. Superiorly in the sense on the top, inferiorly in the sense on the bottom. So superiorly, what do you basically have? How will you look at that? How will you look at that? Let us say you see this. You see this particular opening, this gap over here. Superiorly, what do you have over here? Superiorly, you have got the liver. Superiorly, you have got the liver. Inferiorly down, what you will have? You will have the first part of duodenum. So superiorly, you will have the liver. Superiorly, you will have what? Superiorly, you will have the caudate. Yeah, you will have the caudate process of your liver, caudate process of the liver. Inferiorly, you will have the first part of duodenum. Inferiorly, you will have the first part of duodenum. So these are some of the important things which you need to understand over here. So now we shall be discussing regarding the peritoneal spaces. What are the spaces we have got in the peritoneum? Okay. So what are peritoneal spaces? First of all, tell me how many kinds of peritoneum you have got. You have got two important types of peritoneum. One is called visceral peritoneum and parietal peritoneum, right? So the space that is located between the visceral peritoneum and parietal peritoneum, so that space is a potential space, okay? So what is a peritoneal space? The space, this is a potential space that is located between visceral and parietal peritoneum. Okay. Now this particular peritoneal space, whatever is there, is usually divided into two compartments. Okay. For example, all of you know that on the right side we have got our ascending colon. This is your ascending colon. This is your transverse colon, and down here you have got descending colon, right? So this is your transverse colon. So transverse colon divides the peritoneum into an upper part and lower part. For example, if this is the transverse colon, so above the transverse colon, whatever space you have got, this is called as supracolic region because it is above the colon. And below the colon, whatever space you have got, that is called as the infracolic region. So peritoneum is divided into supracolic space and infracolic space, or you can say compartment. Above the colon it is supracolic compartment, below the colon it is infracolic compartment. So these peritoneal spaces are divided into two compartments. By transverse colon. So what are the two compartments? One is called as, what are those two compartments over here? Yeah, one is called as supracolic compartment, another one is called as infracolic compartment. Okay, supracolic and infracolic compartment. Now what do you mean by supracolic compartment? In the supracolic compartment there are three important spaces again, whereas in the infracolic compartment there are two important spaces. Okay, so what are the three important spaces that are located? See, one is, for example, one is located above the liver. So you call it as suprahepatic space. Okay, one space is located below the liver. You call it as subhepatic space. Suprahepatic space and subhepatic space. One is called as extraperitoneal space. Okay, so there are two suprahepatic spaces. How many are there? Two. There are two subhepatic spaces and there are two extraperitoneal spaces. Now when it comes to the infracolic compartment, there are two again. One is called as a right gutter space. Another one is called as a left gutter space. So we have got the right gutter as well as the left gutter over here. Okay, now if you look at the picture over here, If you look at the picture, let me explain this. So you all know that here you have got, this is your right hemidiaphragm, left hemidiaphragm. Okay, this is your liver, this is your spleen, this is your stomach. Okay, and here you have got ascending colon, transverse colon, descending colon, and sigmoid colon. Okay, now this is a duodenum. You see, duodenum will continue as jejunum, right? You see this point where duodenum is continuing as jejunum, that point is called duodenojejunal flexure. What is that point called? Duodenojejunal flexure. It means if this is duodenum, right? So at this point, duodenum will convert into jejunum, right? So duodenum will continue into jejunum. So it means that this particular point, you see this particular point which I'll be highlighting now. Yeah, it means this particular point, whatever you can see over here with the, yeah, you see this particular point over here is called as duodenojejunal flexure. Okay, so this particular point over here, you call it as duodenojejunal flexure. Duodenojejunal flexure, that is located at the level of L2. Located at the level of L2. Now from this duodenojejunal flexure, you see that there is a structure that is coming and attaching to the ileocolic junction. What is this? This is the ileocolic junction. You see this particular point over here is ileocolic junction. So what is this structure that is attaching? This is your root of mesentery. What is this? This is your root of mesentery. I hope now all of you know what is mesentery, right? What is mesentery? So this junction over here is called as ileocolic junction. This is called ileocolic junction, and this particular structure over here is called as root of mesentery. What is mesentery? Mesentery is nothing but a double fold of peritoneum that is covering your small intestines. So all the way from the duodenum and the jejunum to the ileum, this is your small intestine. So this is a mesentery, that is a double layer of peritoneum that is covering your mesentery is your small intestine is called as your mesentery. So this is the root of the mesentery. Okay, so this root of mesentery is present all the way. It is ranging all the way, extending from duodenojejunal flexure at the level of L2 to the ileocolic junction. Where is ileocolic junction present? Ileocolic junction is present at the level of right sacroiliac joint. Right sacroiliac joint. It is present at the level of right sacroiliac joint. And by the way, not to forget that here you have got the lateral abdominal walls here. Okay, so let me put up this over here. These are your lateral abdominal wall. What is this? This is your lateral abdominal wall over here. This is your lateral abdominal wall. We have got two lateral abdominal walls. One is called as a right lateral abdominal wall. Another one is called as left lateral. See, this is right lateral abdominal wall. This is left lateral abdominal wall, not anterior posterior. Okay, right lateral and left lateral abdominal wall. Another important thing you need to know is that there is a ligament that is connecting all the way from the colon to your diaphragm like this. You see, from the colon to the diaphragm, you see a ligament that is connecting over here. So what is the name of this ligament connecting the colon to the diaphragm? Yes, colon to the diaphragm. This is called as phrenicocholic ligament. What is this ligament? This ligament is called as phrenicocholic ligament. Phrenicocholic ligament. Okay. Now look here. You can actually look at a space, right? Where is this space located? This space is located between the right lateral abdominal wall. What is this? Right lateral abdominal wall and ascending colon. What is this colon over here? This is your ascending colon, and here you have got the descending colon. So between the right lateral abdominal wall and the ascending colon, you actually have got a space. You see this space over here? You see this space between the right lateral abdominal wall as well as the ascending colon onto the right. So this particular space which you can see is called as right paracolic gutter. What is this? Right paracolic. It means it is side to the colon. So you call as right paracolic gutter. Okay. So this is called as right paracolic gutter. This is called a right paracolic gutter. In the same way, you also have got the same space where between the left lateral abdominal wall, this is your left lateral abdominal wall and your descending colon. Okay, so this space that is located between the left lateral abdominal wall as well as the descending colon over here, right? What is this space called? This space is called as left paracolic gutter. We have got right paracolic gutter, and this one over here is called left paracolic gutter. So these are the two spaces. So what did I tell you here? Infracolic, below the colon, you have got right gutter and left gutter, right? So this is right paracolic gutter and left paracolic gutter. Now one very important thing you have to remember over here, that is this particular route of mesentery is dividing this entire small intestine area into two regions. Okay, so if you look carefully you will understand. So these are the two important regions. So it is dividing this entire paracolic area into two regions, you see. This is one particular region, and you can also look at another particular region here. There are two triangles, right? So they are in the form of triangles. So there are two triangles over here. One is called as a upper triangle, another one is called as a lower triangle. Actually, you don't call this as upper and lower triangle. Rather, you call this one as superior recess, and this particular one as inferior recess. Now you see superior recess is open or closed. You see superior recess, on the top you have got transverse colon, right? Medially what do you have got? You have got the root of the mesentery. Laterally what do you have got? You have got the ascending colon. So this superior recess is closed from all the sides. But if you look at inferior recess is open inferiorly. Down it is open. So that is the reason why, for example, if you get any kind of infection in the superior recess, this infection will stay only within this cavity. But if you get any kind of infection in the inferior recess, this infection will pass down into your pelvic cavity. Remember this thing, okay? So if a patient is having infection in or abscess or infection in inferior recess, okay, this infection or abscess can drain, okay, this will drain into what? This will drain into your pelvic cavity. This will drain into pelvic cavity. Clear? This will drain into your pelvic cavity. So this is one very important thing that I want you to understand over here. Next important thing. What is the next important thing is that if you look at this right paracolic gutter, okay, this right paracolic gutter is continuous with two important spaces. What are the two important spaces? See, above the colic region, I told you three important spaces are there, but let us look at these two. Suprahepatic above the liver, subhepatic below the liver. So it means this is your suprahepatic, this is your subhepatic. Okay, so right paracolic gutter is continuous with subhepatic as well as suprahepatic on the right side. Okay, but look at left paracolic gutter. Left paracolic gutter above, it is not continuous with anything. Yes or no? It is not continuous with anything, right? Why it is not continuous? Because of a ligament over here. This is called as phrenicocholic ligament. Okay, because a ligament called as phrenicocholic ligament. So this thing also I want you to understand that the right side, okay, the right paracolic gutter is continuous with what? With the right subhepatic, with the right subhepatic and right uh, suprahepatic, right suprahepatic spaces. You can call suprahepatic as subphrenic also. Why? Because suprahepatic is here, subphrenic in the sense below the diaphragm, right? So you can call it by the same name over here. But on the left is not continuous. Left paracolic gutter is not continuous, due to phrenicocholic ligament. Because of phrenicocholic ligament. Okay. Next important thing, if you look at this particular root, what is this? This is called root of mesentery. You know what is the length of this root of mesentery? It is around 15 centimeters in length. So now what we shall do is that, what are the relations of root of mesentery? We shall discuss what are the relations of root of mesentery. So this is around 15 centimeters. So what are the relations of root of mesentery, guys? So first, see, this is your root of mesentery. Okay, but before that you have to mention here, what is this particular structure over here? What is this? Yes, this is called as duodenojejunal flexure. Where is it? It is at the level of L2. And what is this structure over here? This is called as your, what is this structure? Ileocecal junction. This is your right ileocecal junction. This is your ileocecal junction. Now, what are the structures which are continuous? See, what is this? This is your duodenum. Okay, so if I ask which part of the duodenum exactly is touching this mesentery, you see this is your lower horizontal part of the duodenum is touching the mesentery like this, right? So the first important thing which we have to write over here is that lower horizontal part of duodenum, lower horizontal part of duodenum, okay. Now after this, coming to the second one, what is the second one over here? What is this aorta which you can see in the center? This is your abdominal aorta. So abdominal aorta is also in relation with the root of mesentery. Abdominal aorta, it is in the relation in the sense what? It is touching this root of mesentery, right? It is passing through behind, it is passing behind the root of mesentery. Yes or no? So abdominal aorta. Third important thing. What is the third important thing? What is this vein? If this is your abdominal aorta, what is this vein? This is your inferior vena cava. So third important thing is your inferior vena cava. Fourth important thing in the sense, you see this vessel. So this is vessel number 4. What is this for? Right gonadal vessels, not left one. Right gonadal vessels. Okay, right gonadal vessels. Fifth important thing, you cannot see it here, that is right ureter. And finally, sixth important thing, this muscle, that is your right psoas major. So this is the first important thing. Abdominal aorta is the second important thing. IVC is the third important thing. Fourth, fifth and sixth. So I hope you understood what are the structures that are in relation with the root of mesentery. If I ask within the mesentery, what are the contents of the mesentery? Okay, so what are the contents of the mesentery? Just remember the mnemonic as false. Okay, false jejunum and ileum. Just remember it as false jejunum and ileum, right? So what is F standing for? F stands for fat and connective tissue. First important thing, fat and connective tissue. Second important thing, A stands for autonomic nerve plexus. Autonomic nerve plexuses. Okay, second important is autonomic nerve plexuses. Third important thing, L stands for lymph nodes. You know how many lymph nodes? Around 100 to 200 in number. Fourth, S here stands for superior mesenteric artery. superior mesenteric artery as well as vein. Okay. Now, apart from this, jejunum and ileum are also the contents of the mesentery. Okay. Right. Next important thing, what are these structures over here? This is your bladder. Okay. This is your rectum. Here also, this is your bladder. This is your rectum. Then what is in between? This is your uterus. Okay. And this is your vagina. So what am I drawing here exactly? So this is these are the two structures in the males over here, and these are the structures in the females. Now why am I drawing this is that I actually wanted to draw the important pouches. One pouch you already know that this is a peritoneum that is covering the rectum, creating a pouch in between that and covering the superior surface and the anterior surface of the bladder. Right? So you know the name of this particular pouch. This pouch is called as recto, bladder is vesica, vesical pouch. What is this pouch? This is called as recto vesical pouch, recto vesical pouch. In the same way, you also see that you see a ligament here, the layer of the peritoneum here, which is winding up in this way, like this. So there are two pouches that are created. So this is one pouch and this is another pouch. Okay. So what are these two pouches over here? So one pouch over here is between the rectum and the uterus. This is called as the recto-uterine pouch, recto-uterine pouch, and this pouch over here is called as, what is this? This is called as vesico-uterine pouch. Vesico is bladder, vesico-uterine pouch. Okay. Recto-uterine pouch is also called as pouch of Douglas or the Douglas pouch. Okay. Why? Because if there is any injury in the abdomen, any kind of organ rupture, all the blood whatever is there, that will straight away, when it will fall down, instead of making a U-turn like this and going into vesico-uterine pouch, it will be very easy to enter into recto-uterine pouch. So all the products, all the blood whatever is there, that will be accumulated in the recto-uterine pouch in case of females and recto-vesical pouch in case of males. Right. So these are some of the important things which you need to know regarding the spaces over here. Okay. So now we shall be discussing regarding the stomach. Okay. What are the important things regarding the stomach? Okay. Now if you look at the stomach, let us look at the capacity. I mean, how much amount of food will the stomach be able to store, right, at different ages. Here we will discuss. Now for example, at birth, stomach will store, what is the capacity? What is the capacity of the stomach? At birth, the stomach can store around 30 ml of food, right? The capacity of the stomach is just 30 ml. Now at puberty, the stomach can store around 1000 ml. Okay. And when you reach your adult stage, for adults, it can reach around 1500 to 2000 ml. Okay, 1500 to 2000 ml. If you look at the stomach, guys, so let me discuss the structure of the stomach first, okay, before we discuss further important things. If you look at this is your stomach. Now in the stomach, you have to know that there are two ends in the stomach. Next important thing is there are two curvatures, there are two ends, there are two curvatures, and there are two surfaces. So what are the two ends here? So all of you can see this dotted lines over here. This particular end over here is called as cardiac end. What is this? This is called as your cardiac end. In the same way, here you have got an end. This end is called as a pyloric end. So two ends we have got in the stomach, cardiac end and pyloric end. Done. Two curvatures. What are the two curvatures? See, this curvature over here is called as a lesser curvature, and this particular curvature over here is called as your greater curvature. Okay. What are the two surfaces? Anterior and posterior. Anterior and posterior surface. There are the two surfaces over here. Okay. Now what are the different parts within the stomach? For example, this upper part over here is called as the fundus of your stomach. The remaining part over here is called as the body of the stomach. And this part over here, you see this part over here, this is called as a cardiac part of the stomach. This is called as a cardiac part of the stomach. And this part over here is called as pyloric antrum. Pyloric antrum. Okay. And this one over here is called as pyloric canal. Pyloric antrum and pyloric canal. Between pyloric antrum and pyloric canal, you see a dotted line over here. This dotted line is representing a sulcus called as sulcus intermedius. Sulcus intermedius. We have got a sulcus called as sulcus intermedius over here. Okay. Now let us directly discuss what are the structures that are located behind the stomach. It means under the stomach bed. Okay, so if you look at this picture, these are the structures that are located under the stomach bed. See, first important thing, what is this pink color structure over here? This is your pancreas, right? And there is also a kidney over here, right or left kidney. This will be left kidney. And also you have got a spleen over here. You even have got transverse colon over here, right? So all these structures are located under the stomach bed. So for easily remembering all these structures, you can just, if you want, you can look at the picture, or you can just remember the mnemonic over here. So what is the mnemonic is that, remember it as Dr. S3 kills his patients mercilessly. Patients mercilessly. So this is taken from the anatomy textbook. Okay. Now what is D over here? D stands for diaphragm. What is D standing here for? D stands for diaphragm. Next, S3, in the sense there are three S structures over here. S stands for splenic artery. S stands for splenic artery. S also stands for suprarenal gland. Now tell me, suprarenal gland is on the right and on the left, but which one? The left suprarenal gland. Next, there is also another flexure called as splenic flexure. Splenic flexure. Okay. So let us look at this now. Diaphragm. Diaphragm, in the sense, here we have got a diaphragm, left hemidiaphragm and right hemidiaphragm. So it will be your left hemidiaphragm. Next, splenic artery. The artery that is supplied to the spleen is splenic artery. If you study celiac trunk, you will understand the splenic artery. Suprarenal gland is here. Above the kidney, you have suprarenal gland, left one. Splenic flexure is, see, ascending colon converting to transverse colon. This is present, this flexion is present near the cleaver. So you call it as hepatic flexure. From transverse colon, you have got descending colon. Yes or no? See, from transverse colon, you have got descending colon. So this flexure is present near the spleen. You call splenic flexure. Next, you have got the kidney. Which kidney you have got? You have got right or left kidney? Left kidney. You have got your left kidney over here. Next, you have got the pancreas also. You have got the pancreas, and you have got mesocolon. What is mesocolon again? A double layer of peritoneum covering your colon. Right? So here it is transverse mesocolon. Transverse mesocolon. Clear? So these are the structures that form your stomach bed. Now let us discuss about the lymphatic drainage of your stomach. Now let us discuss regarding the lymphatic drainage of your stomach. Okay. Regarding the lymphatic drainage of the stomach, you need to understand that, let us say this is the stomach. This is the stomach over here. Now, first of all, you know, this part of the stomach is called as a cardiac part of the stomach. You know this. This is called as a cardiac part of the stomach. Next, I am also drawing one more line over here. Right? You know, this is the antrum and pyloric canal. Right? Antrum and pyloric canal. Now, I am dividing the stomach into two halves. What are these two halves? This is called as the 2/3, anterior 2/3 of the stomach. This is called as a posterior 1/3 of the stomach. Okay. And what is this part over here called as? This is called as antrum of the stomach. And here we have got a structure called as pyloric canal. Pyloric antrum and pyloric canal. And you also remember that here we have got what? We have got a structure that is spleen. What is this? This is your spleen. This is your spleen. In the same way, you even have got liver over here. You have got your liver over here. Liver over here. Right? Next, not to forget that in the center we have got, what is this? This is your abdominal aorta. And in the center of the abdominal aorta at the level of T12, what do you have? You have got this structure called celiac trunk. What is this? Celiac trunk. Okay. Now, there are a group of lymph nodes. There are a group of lymph nodes that are located below the liver like this. Okay. So these group of lymph nodes that are located below the liver are called as infrahepatic group of lymph nodes. What are these lymph nodes called as? These are called as infrahepatic group of lymph nodes. There are a group of lymph nodes that are located between the greater curvature of the stomach as well as your spleen. This is called as, what are these lymph nodes? Remember one thing. Here you will have what? Pancreas, you remember? Yes or no? For example, if I remove the stomach, you know, this is your spleen. Okay. And this is your duodenum over here. Right? If I remove the stomach over here, see, this is your head of the pancreas and this is the tail of the pancreas. Okay. Where is your stomach present? Your stomach is exactly present like this. Clear? So here between the pancreas and, let me draw it like this, between the pancreas and between the spleen, between the pancreas and the spleen, you have got a group of lymph nodes called pancreatosplenic lymph nodes. What are these called? These are called as pancreatosplenic group of lymph nodes. Next, we have got a group of lymph nodes below the greater curvature of your stomach. Below the greater curvature of your stomach, we have got a group of lymph nodes. These are called as infragastric lymph nodes. What are they called? Infragastric lymph nodes. Next, below the pyloric part also we have got group of lymph nodes. Below the pyloric part also we have got the group of lymph nodes. Below, this is called as subpyloric lymph nodes. Subpyloric lymph nodes. These are called subpyloric lymph nodes. In the same way, we have got lymph nodes around the celiac trunk. Around the celiac trunk, we have got the lymph nodes. These are called as celiac group of lymph nodes. What are these called? These are called as celiac lymph nodes. Celiac lymph nodes. These are called celiac lymph nodes. Next important thing is that, see, all the fluid, right? All the fluid from the cardiac part of the stomach, where is it drained? It is draining into your pancreatosplenic lymph node. Very important. Cardiac part of the stomach will drain into, right, pancreatosplenic lymph nodes. Next, the 1/3 of the stomach, the posterior 1/3 of the stomach, that is a greater curvature, is draining into infragastric lymph nodes. Anterior 2/3 will drain into what? They will drain into your celiac group of lymph nodes. And finally, you see this antrum part and the canal, antrum part, not the canal, only the antrum part. Antrum part is draining into subpyloric lymph nodes, and the canal part is draining into, pyloric canal is draining into infrahepatic lymph nodes. So you see there are different drainage systems within the stomach over here. But finally what is happening? Finally, in the sense, from infrahepatic, where the fluid goes, finally it is drained into your celiac group of lymph nodes. From pancreatosplenic, where is the fluid going? Finally it is going into the celiac group of lymph nodes. From subpyloric, where it is going? Again it is going into celiac group of lymph nodes. And from infragastric, where it is going? Finally again it is going into your celiac group of lymph nodes. So finally all the lymph nodes, they drain into what? They drain into your celiac group of lymph nodes. So this is how the lymphatic drainage is there. If you look at the nerve supply, there are two nerves. In the front we have got anterior vagal trunk. In the posterior side we have got the posterior vagal trunk. Anterior vagal trunk is giving how many branches? See, this is the first branch, that is called as a hepatic branch. Okay. The second branch over here is called as a celiac branch. What is the second branch? Celiac branch. The third branch over here is called as your gastric branch of nerve or latarsjet. Okay. So a branch of hepatic branch is your pyloric branch. So these are the nerves that are innervating the anterior vagal trunk, right? So in the anterior vagal trunk, they are supplying to a lesser curvature region over here. Now when it comes to the posterior vagal trunk, in the posterior vagal trunk, how many branches are there? One is called as the nerve of Grassi, right? Second is your celiac, and third is your nerve of latarsjet. So there are three nerves: celiac branch, nerve of latarsjet, and nerve of Grassi. Here also three branches: hepatic, celiac, and nerve of latarsjet. So these are the three branches from the anterior vagal trunk as well as the posterior vagal trunk. Okay. Now when it comes to the differences between the small intestine and large intestine, right, before we discuss that, first of all, what is small intestine made up of? Small intestine is made up of upper two-fifth of the small intestine is your jejunum. Upper two-fifth is your jejunum, and the lower three-fifth is your ileum. So upper two-fifth is your jejunum, lower three-fifth is your ileum. So together it comprises of small intestine. If you look at the differences between small intestine and large intestine, these are the basic differences which are asked in the exams. So it is 6 meters in length, it is 1.5 meters. Lumen is very narrow, it is very wider. Okay. Mobility, yes, mobility is more, and here the mobility is less. Why? Only because just water reabsorption is the main function of large intestine. Right? Yes, you have got the transverse mucous folds. These are permanent and not obliterated by distension of the gut. Here they are temporary. If you look at the villi are present. That is why there is increased surface area of absorption is seen in here. Here villi are absent. Right? Coming to the Peyer's patches, they are present in the small intestine, absent in the large intestine. So these are just the differences which you have to make out between your small intestine as well as your large intestine over here. Now let us look at another important topic, that is your duodenum. Very, 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 very important, right? So when it comes to duodenum, how many centimeter long is duodenum? Duodenum is around 25 centimeters in length. Okay. So where is your duodenum located? What is the anatomical position of your duodenum? So if you look at the topography of the duodenum, duodenum is present at the level of L1, L2 and L3. Next, how many parts of duodenum you have got? So these are the parts of duodenum. These are the different parts of the duodenum which you have. So this is called as the first part of the duodenum. This is called as the second part of the duodenum. This is called as the third part of the duodenum, and this is called as the fourth part of the duodenum. So first part of the duodenum is called as upper horizontal part. From here you are descending down, so this is called as a descending part, right? From here again, what is this? This is your lower horizontal part. When it is upper horizontal, lower side also it is horizontal, lower horizontal part, and again you are going up, so this is your ascending part. Okay. Upper horizontal part, if you want to remember it, or else just leave it. The upper horizontal part is around 5 centimeters. Lower horizontal part is double, 10 centimeters. Okay. Ascending part is the smallest of all, 2.5 centimeters, whereas the descending part is 7.5 centimeters. So this is the thing which you have to remember regarding this part. Now what we will discuss is that there are some structures passing in front of the first part. There are some structures passing behind the first part. It means there are some anterior relations, there are some posterior relations. In the same way, coming to the second part, there are some structures passing anterior to the second part. There are some structures passing posterior to the second part, in front and back. In the same way for the third part, in same way for the fourth part. So if I keep on drawing pictures, there will be a lot of pictures. It will be very difficult for you to remember. So just I'll try to give you a mnemonic, right? Anyway, the mnemonic also will fail anyways, but just try to relate it. Okay. First, we will discuss about the first part. In the first part, what are the structures passing anteriorly? So we will discuss about the anterior relation and posterior relation. anterior relation and posterior relation. So how do you remember this? Let us say you along with your friends, right? So you started to travel, right? You wanted to travel by train. Now you are reaching a particular destination. Now there is a family there. Now you wanted to meet their family, right? So what you do is that, so you go barehanded? No. What you do is that you will grab some gifts for their children, yes or no? So what is the first thing you do before you start your train journey? What you will do is that you will, the before day, you will quickly grab one gift. You will quickly grab one gift for children, right? So you will quickly grab one gift. What is that one gift you're gonna grab? So first important thing, Q. Q stands for what? Quadrate lobe of the liver. It means quadrate lobe of the liver. It means, so this quadrate lobe of the liver is present in the anterior part of, or in the front of the first part of duodenum. G stands for gallbladder. G stands for gallbladder. What is one? One is what? One is nothing but your first part of duodenum. What is one? One is nothing but your first part of duodenum. And G here stands for gastroduodenal artery. Gastroduodenal artery. So these are some of the three important structures that are present in the anterior part of the first part of duodenum. Now, in the posterior part, what do? Okay, you have grabbed the gift for the family, but for the children and all, obviously you have grabbed some chocolates and all, whatever it is. Now what is the second thing you do? All this stuff, whatever is there, will you take it like this into the train? No, you will pack it in the bag, right? So what do? Post in the sense, after the first part, what is the second thing you do? You pack it in the bag. You pack it in the bags. Okay, what does B stand over here? B stands for bile duct. So bile duct is passing behind the first part of duodenum. Okay, bile duct is passing behind the first part of duodenum. Next, AG, just turn AG as GA. GA stands for again what? Gastroduodenal artery. Gastroduodenal artery. These are the two important structures that form the posterior relation. Okay. Now coming to the second part. What is the second part? Second part of the duodenum is also called as what? Descending part. Descending part, which is 7.5 centimeters. Right? Here also we will discuss what are the anterior relations, what are the posterior relations over here. Now coming to the anterior relations. What are the anterior relations? You already started your train journey. Okay? You already started your train journey. Now when you have already started your train journey with your friends. So already you have crossed a river called as Ganga. You have crossed a river, right? What is that river? Ganga. And you are traveling where? You are traveling in a train. You are doing a train travel along with your friends. Friends in the sense your co-passengers. So it is, for you it is friends, but for the ticket collector, they are all your co-passengers, right? So what do you mean by GA over here? GA stands for gallbladder. Again, gallbladder forms the second part, the anterior part of the second. Now RI stands for what? The right lobe of your liver. RI stands for the right lobe of liver. TRA stands for what? Transverse colon. Transverse colon. Okay. TRA again stands for what? Transverse mesocolon. Transverse mesocolon. Now you understood what is transverse mesocolon. Next, in the sense what? Coils. Coils of small intestine. Coils of small intestine. So all these structures pass in front of the second part of the duodenum over here. Now next important thing is that coming to the posterior. Now you are sitting there, right? So someone had already made a plan for all the trip, right? So if you are sitting along with all of your friends, it would take a longer time. Let us say there is an elder guy within your group and he has already made the complete plan for the trip. So he is the major person, right? So he is called as a maker. So he is a plan maker. He is a trip maker, right? So what do you mean by M? MA. What do you mean by MA? MA stands for major. What is a major muscle? Psoas major. This is your right psoas major. Okay, MA stands for psoas major. K, what does K stands for? Kidney. Again, which kidney? Right kidney. What is this? Right kidney. Next, you have got your E. What is E here? E stands for edge of inferior vena cava. Which edge again? Right edge of inferior vena cava. Next, R stands for renal vessels. Again, which renal vessels? Right renal vessels. Right renal vessels. It means right renal artery, right renal vein. So it means this maker is all the time right. He is all the time right. Right? Who is making right decisions, right? So you have got a right psoas, right kidney, right edge of the liver, and right renal vessels over here. Right. So you are all enjoying in the train, right? So it has already been 30 minutes or whatever it is. It has already been 30 minutes. That is the third part. You are all sitting in the third compartment, right? So in the third compartment, the moment you sit there, right, within 30 minutes, again we are writing the anterior, we are writing the posterior relations. So what will happen now? The ticket collector will come, right? So the ticket collector has come. Now one of you is curious to see who is he, right? So obviously he'll be wearing the white dress with a black coat, ticket collector. So most of us have a habit of looking at his badge. So on the badge it is written Sunny Robbins. On the badge it is written, his name is Sunny Robbins. So now how do you make a mnemonic out of this? What is CO? CO stands for coils of jejunum. Coils of jejunum, right? SU stands for what? Superior mesenteric artery. Superior mesenteric artery. Next, RO stands for root of mesentery, which is 15 centimeters, right? Root of mesentery. Root of mesentery, you remember we studied the relations also. Finally, your train journey is finished. Now, the moment you get down, there should be someone to receive you. Yes or no? So let us say that family to whom you are going to meet, right? So that family have sent their driver. Okay, so obviously to collect all of you guys near the railway station. So that driver, he introduces himself telling that my name is, I am Pug. Okay, his name is Pug. Now what is I over here stands for? Inferior mesenteric artery. Why? Because here it is superior mesenteric artery. So opposite will be inferior mesenteric artery. A stands for what? Abdominal aorta. A stands for abdominal aorta. Now what does P stand for over here? P stands for psoas major. Now when I tell psoas major, right or left? Again right psoas major. See, left is anterior, right is posterior. Just think like that. Anterior is on the left side, posterior is on the right side, right? So right side always will be right, right? Next, U stands for what? Ureter. Which ureter again? Right side, so right ureter. G stands for what? Gonadal vessels. Again, which? Right or left? Gonadal vessels. Again, right or left? It is a right gonadal vessels. Okay. So this guy name is Pug. So who is he? Right. So he is the guy to receive you. Now all of you have gone towards the car. Right. So in the garage you have got a car over there. Now in the car there is already a driver sitting. Okay. The final guy, the fourth part. Fourth part, we are discussing the anterior relation, we are discussing the posterior relation. So there is a driver who is left there, right? So who is the driver is sitting in the car. Now driver also will introduce himself. He will tell my name is, that is me colon, me colon, right? So what is me over here? Me is transverse mesocolon. Transverse mesocolon. Colon is transverse colon. So transverse mesocolon and transverse colon. Okay. Now once you get into the car, now finally you all started going there. Now you have done completely a day journey, right? So you have done a day journey. In that journey you are completely dehydrated. So what is the first thing you wanted to do? How do you know that you are dehydrated after the journey? Your lips are completely dried. So you wanted to just water your lips, right? You wanted to wet your lips. So how will you wet your lips? How will you wet your lips? By drinking water. So the moment you get into the car, you usually drink water, right? Or even if you go to their house, the first thing they ask is you need some water or what, right? So what is L over here? L stands for left gonadal vessels, left gonadal vessels. Okay. I stands for inferior mesenteric vein, because mesenteric artery we are already done above. Inferior mesenteric vein. So that is the why I told you this mnemonic which I have gone is not proper. So but somehow it will help you to remember. So if you practice it, it would be easy. Next, P stands for psoas major, that is your left psoas major. Right is already done, right? So now it will be left psoas major, and S stands for the left sympathetic chain. So these are the structures that are forming the anterior and posterior relations of the four parts of your duodenum. Coming to the blood supply of the duodenum, if you understood the celiac artery, superior, inferior, mesenteric, blood supply will be really easy. Okay, let us say if this is your duodenum like this, duodenum, and let me draw that this is your abdominal aorta, for example. Here you have got an artery called as celiac trunk. Now this celiac trunk, one artery is going like this is called as common hepatic artery. This common hepatic artery is giving one branch down over here. Now you must be naming this, what is this? Gastroduodenal artery. This gastroduodenal artery will give two branches like this. Okay, one branch, these things I've already talked, that is why I'm going fast. Right gastroepiploic artery or right gastroomental artery. What is the next branch over here? This is called as a superior pancreatoduodenal artery. What is this? This is called as superior pancreatoduodenal artery. In the same way, down over here, we have got an artery like this at the level of L1, that is your superior mesenteric artery. This is your superior mesenteric artery located at the level of L1. This superior mesenteric artery is giving its own branch that is coming from down and anastomosing with superior pancreatoduodenal. So this will be called as inferior pancreatoduodenal artery. Now whatever branches you can see now, these are the anterior branches. So if I am drawing the same branches in the posterior, in the dotted fashion, these are the posterior branches. Okay, which means superior pancreatoduodenal artery, both anterior and posterior branches. Here also both anterior and posterior branches we have got. Okay, next, on one side you have got some continuous branches like this. What are these branches? These are your jejunal branches. What are these branches? These are your jejunal branches. Jejunal branches. Okay, now from these jejunal branches, right, you see an artery that is going and supplying to your duodenum like this, right? So what is this artery from the jejunal branch that is going and supplying to your duodenum? First of all, you should know this is your first jejunal artery, second jejunal artery, third jejunal artery, fourth jejunal artery, right? So from the first jejunal artery, a branch is going and supplying to the what is this? It is going and supplying to your duodenum. So this branch over here is called as artery from first jejunal branch. Artery from first jejunal branch of superior mesenteric artery. So what are the arteries that are supplying? Superior pancreatoduodenal artery anterior posterior, inferior pancreatoduodenal artery anterior posterior, and artery from the first jejunal branch of superior mesenteric artery, right? So now let us look at the differences between the jejunum as well as ileum, guys. So jejunum is thicker, right, and ileum is thinner. If you look at the jejunum, see this is the jejunum. If you look at the wall is thick over here, the wall here is thin. You see thicker wall and thinner wall. Okay, so the first point is it is thicker and thinner. Clear? If you look at the lumen is wider. Here the lumen is narrower. Okay, if you look at the circular folds, right, circular folds, they are longer and closely set. Here they are smaller and sparsely set. Okay, if you look at the circular folds, see these are the circular folds here. Actually both the pictures are looking same, but you need to know that these are longer, right? These circular folds are longer and they are closely set. Okay, they are smaller and coarsely set like this. Next important thing is that if you look at the villi, right? I'm not sure if the villi are seen over here, right? No, villi are not seen. Just you need to remember, villi are more, here they are less. Here they are large, here they are short. Here they are thick, here they are thin. Here they are leaf-like, and here they are finger-like villi over here. Okay. Next important thing is you have to look at the aggregated lymphoid follicles or Peyer's patches, right? So you see this, where are these Peyer's patches? See, these are your Peyer's patches. So here the Peyer's patches are very small in case of jejunum, but whereas in case of ileum the Peyer's patches are very large. You see, they are small, circular and few in number. These are large, oval and more in number. Exact opposite things. Okay. So coming to the mesentery, where is the mesentery over here? This is the mesentery. You see, this here, this one is the mesentery. Here mesentery is yellow in color. Why? Because it is containing more fat. Here mesentery is not yellow. Why? It is containing less fat. Okay. So these are some of the important differences between jejunum and ileum. By looking at this picture, you can get to know about this. So this completes your entire abdomen, right? Most important part, most important topics which we have discussed in the abdomen are done. So this is all you need to know regarding the abdomen, guys. So thank you so much for watching my video. Goodbye.